Coming up next, Artamonov Mikhail, intraosseous hydrogen therapy.
Well, dear colleagues and friends, thank you for inviting me. I think it's a great event. Dragi kolegova, dziękuję za pozvanie. Don't worry, I'm not going to translate the whole talk. It's just my appreciation for the unique Slovakian language. Okay? So I also represent a couple of new guys in the block, a couple of new societies that really within 2 years old. One is the American Society of Medical Gases. One is the Society for INTRAOSSEOUS Therapy. And I'll explain you in a few minutes why it's important. So I explain you in a few minutes how these topics are put together. I have nothing to disclose. Takes a little time, okay. So anyway, I kind of call this presentation almost like Tres Amigos, so 3 friends. So I thought about that, and we have problem. We're aging, we're dying. It's a problem we can't solve, but everybody's looking to extend the lifespan or make better quality of life, right? We all want to live longer, or at least better, right? So we know that on a cellular level we have a process called senescence, right? So it's basically a slow dying. And we have certain features, we discover already some mechanism of that. On the other hand, we have regenerative pool in our body, represented by stem cells. Primarily, the best quality of the stem cells are in bone marrow. And of course we have hydrogen, that's why we're here. Oh, I'm sorry. Of course we have a hydrogen, that's why we're here. So all 3 parts, degeneration, dying, regeneration as a stem cells, and the hydrogen. So can we combine them? Well, why not? I ask myself. It seems to be it's not a bad idea. Why yes? Well, we'll talk about that in a second. This is, by the way, a syringe prepared with activated hydrogen. By the way, my background, I'm interventional pain management orthopedic, so I do a lot of needles. So it's less brain work, more hands work. So forgive me, guys, if there is not that much science. It's my introduction of something that I do clinically and something that you may ask these questions yourself down the road, okay? So I go briefly over senescence. And again, we know it's not a goal of this topic to present the mechanism of aging, but we know some at least. We know that the slowing of this process plays a significant role in the aging process and all degenerative diseases, which probably is 80% of all medicine. And again, I made this handout when I look at the time, it was 15 minutes allowed, so I made it mostly for the references. So it's a lot of articles down in the presentation on different subjects. You can look at it later. I'm not going to read over those slides, so forgive me for that. So the second amigo is a hydrogen. And again, in this auditorium, I probably won't talk too much about the hydrogen because, you all know more than me about the hydrogen. And at least from this perspective, we have something that penetrates easy, something that likely non-toxic, something that we can use and safety been established. So why bone marrow? Well, again, bone marrow is a kind of holy grail of regenerative medicine. Yes, we can get stem cells from almost any compartment in the body, but the bone marrow is considered to be one of the most promising as far as the multipotency of the stem cells. And there is some evidence that stimulation of the bone marrow and stimulation of the bone marrow mesenchymal stem cells may lead to improved quality and improved outcome. So yes, we spoke a lot about oxidative stress. We spoke about different mechanisms of action of the hydrogen. And from the angle of the stimulating stem cells, we know I put together a few studies that I was able to find that somehow related from different angles to the regenerative medicine. We know that mobilizing bone marrow stem cells into the bloodstream, been shown to be effective in many degenerative diseases. I put in a kind of white color to highlight the name of the article for you and the main conclusion, so you can read it later. And I'm trying to get to the part which is probably more important, at least for this topic. So there is some studies that outline the effect or possible effect of hydrogen onto the stem cell and regenerative therapies. So the question was that I asked myself, what if we have those wonderful things? We have hydrogen that potentially can play a role in regeneration or slowing down the senescence. How can we deliver to the bone marrow? And we spoke about that. There are certain ways to deliver hydrogen. The previous speaker spoke about that. And I'm the guy with a needle, less brain, more hands. So I certainly start using hydrogen like any other gases that I've been using, ozone, and some others, carboxy, and I experiment on myself, of course, first, before any animals. So I did quite a few novel, I should say, application of the hydrogen that we can speak about, and that includes mostly injections, either subcutaneous, intraarticular, and in this case, intrabone marrow. So again, there's a few studies on comparison of different effects of the stem cells. So again, why not? So how we deliver the hydrogen potentially is very interesting from regenerative potential in the bone marrow. How do we deliver that? Well, again, we know that there are circulating stem cells. It's been shown to be effective, and we can play with the quality and quantity of the circulating stem cells. However, I think, and that's my idea for this topic, and correct me if I'm wrong, it certainly will require more studies and more experiments and more clinical experience, if intraosseous delivery of the hydrogen towards the bone marrow depot of the stem cells may be better than intravenous. So, how did I come up with the intraosseous way of delivery? Well, there's been some literature reports actually, and down this presentation you can see. I'll look over probably the anatomy atlases from 18, 19, and 20th century, and there is evidence that the anatomists in the previous centuries actually describe intraosseous anatomy much better than we know and than we being taught in the medical schools. So there is an intraosseous way to deliver. And I can certainly propose the idea and prove it that intraosseous way of delivery is very safe. That's number one issue, right? Why? Well, in the United States, for example, in 2005, FDA actually, it's not FDA that approved intraosseous way of delivery, but it's been considered and put in a pharmacopoeia that intraosseous way, primarily for resuscitation alternative, for delivery of the intravenous fluids and so on and so forth, for establishing emergency access to the human body, the intraosseous delivery works, it's safe. According to FDA, any medication that can be used intravenously can be used intraosseously. So I'm an interventional guy. I do a lot of guidance-based intervention. How do you play the video? I'm sorry. How do you play the video? Some of the videos here, and that's why I want to run a little bit through the data and show you some unique stuff, is really you won't see anywhere else. That's why I ask if anybody, orthopedics or pain management specialist in an auditorium, because that's for them it would be very interesting to see. So one more time. So you can see the needle is in the spinous process. That's one of the approaches to the vertebra. And I'm injecting the contrast, and you can see almost what I call unknown anatomy, unknown at least to me and my study in the medical school. There is a hidden anatomy that's behind the bone walls, so to say. You can play this video a little bit. That's actually, I took this video in one of the aquariums, and when you're changing filters, you see totally different picture. And that reminds me about what we see behind the bones, what I call hidden anatomy. So, we do a lot of different intervention. I wouldn't bother you with that. There are quite a few novel techniques. We use, for example, intradiscal and intraosseous application for the disc herniation at the same time. Now, I use traditionally more ozone and some other regenerative technique. However, I don't see any immediate reason why hydrogen cannot be used as well. And again, just forgive me, I'm just sharing my clinical experience and some ideas for you can put it in the science. This is my favorite video. I don't know if you see it clearly, but the needle is in the spinous process of C2 spinal vertebra. And what's good about that, you can see bidirectional flow of the contrast, and it goes up and down. So one of the ways to deliver medication of any sort to the brain and the circulatory system of the central nervous system, because there is actually isolated or semi-isolated circulation system around the spinal cord and the brain that we never put in consideration when we do that. So there is a way to bypass a lot of barriers that our human body has and deliver stuff to the brain or the central nervous system. We do it all the time for neurodegenerative conditions. So what do we know? Again, we know very well that intraosseous therapy or intraosseous approach is safe. All intravenous medication can be delivered intraosseously. Likely, intraosseous approach is preferred when you're trying to stimulate the regenerative pool. Now, another consideration I'd like to bring in this auditorium, why intraosseously? Well, it's not totally equal to intravenous. Why? Because there is a local absorption and local metabolism of the tissue no matter where you put the needle. And I prove it with a contrast. When you inject contrast inside the bone, depends on the location. It's not only vascular uptake into that central nervous system circulation, but there's also local uptake into the tissue. So therefore, we can increase concentration of whatever we inject, in this case hydrogen, locally where the main pool is. And of course, I haven't done any studies or anything like that. I'm a clinician. Again, I'm bringing up some ideas that can be explored if desired. So interesting enough, I found actually 3 weeks ago, I taught the doctors in Gdańsk, Poland, how to do it on the battlefield, part of the battlefield medicine. Hopefully in a few weeks I'm going to Russia to do the same. So interesting, one of the studies been done, and they show that intravenous access, establishing intravenous access takes on average 5.8 minutes, while establishing intraosseous access takes on average about 4.2 minutes. And by similarly trained people. So intraosseous medicine, I should say intraosseous approach, is mostly becoming as a part of battlefield and emergency kind of situation medicine. Popular in pediatrics, if any pediatric specialist in the auditorium, you probably know that well. So basically, why intraosseous? Because there is a way. That's presentation, I just go through that. Yes, people call bone is non-collapsible vein. And it's true from the resuscitation standpoint. You can always establish intraosseous access in any situation as long as I have a needle. While intravenous, you all know that it may be challenging. So there are specific points. It's not the point of my and goal of my topic to teach you how to do that, even though I can argue that it's pretty much painless and quick if you do it in the right way. As a matter of fact, in November, I'm running the first masterclass in the US on intraosseous applications. So it's becoming more popular because there's huge advantages of this way. So there are some, I call it sometimes, initially I call it outer myelo therapy. Why? Because it's outer, it's our own body. Myelo, we stimulate not only blood, we stimulate the spinal cord, so to say, and regenerative issues. And that's why we call it outer myelo therapy. So again, I already mentioned pharmacokinetic and pharmacodynamics of intraosseous therapy. Again, main advantages: approved, safe, effective, almost all medications. Now, answering the question, why not? Well, why not? Why not the hydrogen? Of course, you don't want to put the gas into the bone directly, because potentially it may lead to gas emboli. So, the only way to establish that, one of the few ways, is to do, hydrogen-rich saline drip, and that's what we start doing. Basically, you put, instead of the intravenous access to the vein with a drip of the hydrogen-rich saline or whatever you use as a carrier, you can use it intraosseously with the same frequency, same concentration. This is just few historical facts that I was able to find of intraosseous anatomy. Interesting enough, if there are any anesthesiologists in the auditorium, when you read the first application of the spinal block, spinal anesthesia, trying to find that, here we go. So described by Kornig, that's a kind of classic textbooks of for epidural application. As a matter of fact, when you read his book, it says in between the spinous vertebrae. He never actually entered epidural space. He put medication into next to the epidural space, and because of the anatomy, sometimes we use a depot of something put right next to the epidural space and create the slow absorption. It's almost extended release delivery system. And that's what we did. And he noticed complete paralysis below the waist in 30 minutes. So it took just 30 minutes from the intraosseous approach and from Batson plexus delivery into the epidural space. I found it's pretty cool because, again, we always think that there was epidural delivery. So, so what we're using intraosseous approach with hydrogen for? Well, again, it's a relatively new method for me as well. I'm trying to use intraosseous hydrogen drips for the same condition as we use something else, so meaning for neurodegenerative systemic uptake. However, we already start using hydrogen as a localized treatment. I think there was one study from China when they used subcutaneous hydrogen injections for the peripheral polyneuropathy, painful neuropathy, sub-Q injections. And we tried that already too. So there is some anatomy there as well. Interesting enough, that's another part of anatomy. You can see, again, to me it's mesmerizing because, I'm an X-ray guy, we do procedure on the X-ray, and we don't see this picture, but when you imagine this picture with a contrast, it's totally different anatomy. That's from very famous Chinese exhibition on anatomy. And that's what I meant. I don't know how much time I still have, but I briefly want to show you probably one of the most important points. So this is the central nervous system. So there is a separate cerebrospinal venous system that we, at least I, never run before during my study in the medical school. And that system, how they discovered that? They discovered connection between the prostate and the brain. And that's what the Batson was doing when he was researching the spread of the metastasis for the cancer. So if we interrupt to deliver something into the system, it may interrupt a lot of pathways, not only systemic absorption, but also affect some pathological processes that goes around the body through the lymphatic or through the cerebrospinal system. So you can read it down the road. There is quite a few slides, even though I removed probably 70% of them. So again, straight vascular pathway, metastasis, emboli, and who knows what else is being spread around the body through the cerebrospinal system. And that's what we're dealing with, because it's a direct connection between the low pelvic plexus and the upper cerebral plexus. So there is some information on bone tissue innervation. I don't want to bother you with that. But you certainly can use it as a references. There is a reference slides at the end. So the mechanism, you see there is quite a few mechanisms of the intraosseous therapy. First of all, it can be used just for the penetration of the skin itself, of the bone itself. we actually use it sometimes as a so-called osteoreflexed therapy. So meaning when we penetrate the bone just with a needle, it already has therapeutic effect. So imagine if we deliver something, as a matter of fact, there is a data that intraosseous penetration improves the bone density. So when we deliver, and there is studies on hydrogen that also has the same thing. So imagine if we have something that not only has systemic effect, but also have localized effect. It's just a food for thought. If we deliver hydrogen, it's through the intraosseous approach, it certainly would improve the bone density, or should improve bone density based on what we know. This is actually the only school of intraosseous therapy. On the right, there is a Professor Yankovsky who developed intraosseous reflexed therapy as a method during the Soviet Union time. He was doing to himself as an anti-aging. He died recently in 2020 in the age of 95, was working till the last moment of his life, driving car and so on and so forth. He was using intraosseous once a month as a claim as an anti-aging. Now I understand why. He didn't talk about stem cells, but now I understand why. On the left, there is a Professor Sokov from the Moscow Pain Association, and these two people, well, at this point only one left, who actually developed some intraosseous literature. So again, what can we do under the umbrella of intraosseous therapy? Well, again, we can do blocks. That was the pain blocks. That was the main kind of situation, how it was developed, injection for pain. Of course, we can do it as a therapy, meaning intraosseous delivery of any medication systemically. We can use it, and I propose to use it as a more regenerative approach. I use it initially with ozone and oxygen, but I don't see why it can be used with a hydrogen. That's the question for you. Again, technically, it's not challenging. I probably can teach anyone in the auditorium to establish intraosseous access in about 10 minutes. And there is some few slides on the patients. And that's what we're dealing with, especially in the US. You see there is at least several procedures done, including kyphoplasty, spinal cord stimulation, and so on and so forth. And just penetration of the bone tissue, the area of pain, brings significant relief. Same case, similar case. That's a combination of intradiscal and intervertebral at the same time. I call it segment therapy. It actually works quite well on regeneration of the segmental disc disorder. We start using different things around the intraosseous approach. Besides hydrogen, we start using the photodynamic therapy, so light inside the bone. It's the same idea as stimulation of the stem cell by light. There is a certain data that actually mesmerizing. One group in Israel, I think it was Dr. Aaron, they actually did interesting study. They irradiated with light the damaged myocardium directly, myocardium cells. For cardiologists, that would be interesting to know. And they irradiated the tibial bone with a certain frequency, same control group. And they found that improvement of the myocardial tissue was 70% higher in a group with remote radiation by light of the intraosseous pool, rather than stem cell inside the myocardium. So to me, it was kind of mesmerizing to see how remotely we can affect any regenerative process in the body. So the goal of, again, my quick topic today was actually just to see the novel ways or different ways, first of all, to deliver hydrogen somewhere in the human body. It's certainly, in my opinion and my experience, is safe. And also show you at least some benefits of intraosseous therapy as well. It's kind of unknown in medicine as a therapy. Again, it's used as alternative to resuscitation approach, but I encourage you to think about that as a therapy, because we're delivering something to very important places. So again, safe, we know can be used as a silent drip. We know bone marrow is important. We know there is an effect on mesenchymal stem cells. And now we know how to deliver it. So why not? Thank you very much.
Coming up next. Barancik Miroslav. The effective therapies on modulation of matrix metalloproteinases at pathological situations.
Thank you, Dr. Avingerova. At the beginning, I would like to express my thanks to all organizers of this really excellent meeting. And now I will start with my presentation, which is focused on where will I present some data results, which document the connection between action induced by molecular hydrogen and matrix metalloproteinases. Matrix metalloproteinases are enzymes that play a very important role in normal physiology and also at pathophysiology. Thank you. In our study, we focus on three different isoforms of MMPs: MMP2, MMP9, and MMP28. MMP2 and MMP9 are known as gelatinases, and these enzymes play an important role in degradation and remodulation of extracellular matrix, and are able also to cleavage also some extracellular matrix proteins such as troponin. It has been found that their activation could be related to structural disorganization of extracellular matrix, and was found that increased protein levels and activation of these enzymes is tightly associated with development of pathogenesis of several diseases. And important role play also circulating levels and activities of these two enzymes, as they were found to be closely related with some cardiovascular diseases such as heart failure. Third matrix metalloproteinase MP28 is a newest identified member of this MP family, which has, I think, at this time, approximately 27 members. And this metalloproteinase plays a very important role in maintaining of structure and function of most tissue at normal conditions. And in opposite to MMP2 and MMP9, the increased levels of this metalloproteinase are for tissue positive. And this is documented also by the studies of Ma et al., which were published in 2012 and 2013, which documented the deletion of this metalloproteinase increased dysfunction of the left post-myocardial infarction, and these effects of deletion of AMP2 were associated with stimulation of inflammatory responses. Aims of our study were to determine the potential role of these two metalloproteinases in pathology of radiation-induced cardiovascular toxicity and in rats, and to study the effects of molecular hydrogen on matrix metalloproteinase due to this development of changes induced by irradiation. In our study, we used the experimental model which was done by Dr. Kura and Professor Slezak. We obtained the samples 2 days and at day 2 and day 9 after irradiation, and we had we have control animal tissue or plasma of control animals, of animals exposed to irradiation of mediastinum. Irradiation was induced by a single dose of 10 gray, which was given to the area of mediastinum, and two groups of animals where was applied molecular hydrogen in 2 ways. The first way was in hydrogen-rich water daily and during 2 or 9 days, and by inhalation as a gas, 4% gas. We found that effects of irradiation were connected with significant stimulation, activation of LMP2 in plasma, circulating LMP2, and this increased activities of LMP2 are very bad prognostic factor for development of other complications. We detected changes in activity of 72 kilodalton of isoform, form of this metalloproteinases, and it is known that this isoform is stimulated by radical. Activation is induced by radicals, mainly by superoxide or peroxide. And we found that the effects of irradiation on circulating LMP2 were transient, and as you can see, with prolongation of time, the activities decreased. Important was finding that application of molecular hydrogen, molecular hydrogen-rich water, reverse the negative effects of irradiation of activities of LMP2, and that mainly at 2 days after irradiation. We looked also for the changes for influence of irradiation and molecular hydrogen on LMP2 and LMP9 in cardiac tissue, in tissue of left ventricle, but we didn't observe any changes. We found that neither irradiation nor molecular hydrogen changed the activities or protein levels of LMP2 or LMP9. The third metalloprotein which we analyzed was LMP28, and as I mentioned, this metalloproteinases plays an important role in maintaining of normal tissue structure. And we found that during irradiation, after 2 days, and also after 9 days, was a significant reduction of protein level of this enzyme. This indicates the development of negative changes at the heart tissue. Again, we analyze the tissue of left ventricle, and application of molecular hydrogen by inhalation, but also by in hydrogen-rich water, reverse the negative effects of irradiation on this metalloproteinases. Again, the effects were more evident after day 2 after irradiation, and in comparison at day 9, where only slight modification of irradiation-induced effect by molecular hydrogen induced by inhalation. It seems that this metalloproteinases plays an important role in pathophysiology of changes induced by irradiation, and similarly in our previous study, which we published in 2021, we found that this metalloproteinases is significantly downregulated, and even much more than by irradiation during development of diabetes. This data here are shown data obtained in tissue of left ventricle from control lean and obese diabetic CDF rats. Now we found that significant changes or most changes occurred 2 days after irradiation and application of molecular hydrogen, and we have done some experiments to determine possible mechanism involved, and now I present only this one because it seems that a very important role in the effects of hydrogen could play superoxide dismutase 2. This isoform is specific for mitochondria. It is mitochondrial isoform of SOT. And we found that hydrogen application significantly upregulated and very significantly upregulated protein levels of this enzyme in heart tissue. And we also found some data that indicate that in this upregulation plays an important role phosphatidylenosyl 3 kinase act pathway, and the effects are probably realized through NRF2 pathway. In summary, our data suggests that the activation of AMP2 and down regulation of AMP20A may have a negative impact on the progression of pathological changes induced by mediastinal irradiation, and the molecular hydrogen showed beneficial effects against mediastinal radiation-induced changes in AMP2 and AMP28. And here are co-workers which participated in this study, Dr. Fukarashvili, Dr. Boťanská, Dr. Kura, and Professor Sledák. And thank you for your attention.
Coming up next, Botek Mikhail. Molecular hydrogen application in exercise and training, current knowledge and future prospects.
Thank you, Mr. Chairman. I promise that I keep my time. It was reserved for my presentation. Hello, everybody. My name is Michael Botek, and before I start my presentation, which is linked with the molecular hydrogen and its application in sports medicine, I would like to thank you, Professor Slezak, and also his colleague who actually are responsible for this excellent for this conference and organization hold this nice conference in such a beautiful place and this castle. So at the beginning of my presentation, I want to where is the presenter? I want to refresh your mind about exercise physiology, because exercise physiology is a main topic of my research. So when we started exercise, muscles in the contraction needs so much energy. I mean energy in terms of ATP. But the ATP mostly are created in the mitochondria. But simultaneously with the ATP is creating also ROS. It means very active chemical radicals. Okay, that's quite good. But if you have a whole bunch of these free radicals and these exceed capacity of molecule antioxidant to this radical and this scavenging, oxidative stress occur. And also in the sports sciences, oxidative stress is linked with the fatigue, delay recovery, and also to decrease performance. And there is actually another issue which comes from excessive exercise. Long-term exercise, such as half marathon, marathon, ultramarathon and stuff, usually cause muscle damages. And muscle damages induce inflammation response. So it's quite good, because inflammation is essential for the adaptation. But if we got the inflammation can be divided into two different periods. The first one is a pro-inflammatory response. It's quite good. And this is followed by an anti-inflammatory response. So this is all good. But if you put together oxidative stress and inflammation, and these two negative effects comes from exhaustive training, or if you are low trained or not adapted, and this training are followed by insufficient recovery, you got the trouble. Because usually literature says, okay, you could be overreach or overtrain. So oxidative stress combined with the high inflammatory response in terms of pro-inflammatory response is an issue. We know that very well. So the essential question, do we have any solution for athletes? I guess so, because molecular hydrogen is a healthy, safe gas with the unique properties such as antioxidant, anti-inflammatory, etc., etc. Me, as a sports scientist, is the most important one, anti-fatigue or ergogenic, okay? Ergogenic effect. And ergogenic effect might be also be linked with the other beneficial properties of molecular hydrogen, such as selective scavenger capacity and also low affinity to other free radicals. This is the most important thing, because so far we are talking about just a selective antioxidant capacity. But from my point of view, it's better to use or to say, hey, molecular hydrogen has a low affinity to other reactive oxygen species, for example, hydrogen peroxide. So there is another advantage of molecular hydrogen. We all know that the hydrogen has a small size and therefore can penetrate very easily into the cell membrane and therefore can actually protect, for example, mitochondria to oxidative stress. This is so also very important, which is link with the ergogenic and ergogenic or anti-fatigue effect. And now let me show you a couple studies which we have done during 5 years. We are running more 5 other studies, but I have just a short time, so I selected three of those. In the following papers, I will show you just 3, and the idea of this paper or this slide was, okay, we tried to challenge ergogenic effect or increasing performance effect of molecular hydrogen to different kind of physical skills. It means endurance, strength, and also repeated speed ability. This is quite good to our group because we all the time kept a similar protocol. We use a similar hydrogen-rich water. So it's good to compare it, okay? And we usually follow randomized double-blind placebo control crossover studies. So, uphill running study, which is quite good and which is linked with the endurance. This correlation shows us a nice, clear result. What we got here? Are you with a low performance? You can expect a more help from a hydrogen. On the other side of this correlation, are you in good shape? You cannot expect that the molecular hydrogen help you a lot because you are in good shape. So this is a very important thing to design it for further studies, because this study was designed as a pre-exercise hydration, just 2 days. We don't know if we supply molecular hydrogen more than 2, 3, 4, 6 weeks. We don't know yet what's happening. It's challenging for us. So this is the main result of this study. The second one was a strength. So we tried to find if a molecular hydrogen has any effect of these advantages that I mentioned before, and we found this. Molecular hydrogen during and immediately after the exercise or strength exercise decrease significantly lactate response. Why? There is lower production of lactate, or there is a higher utility of lactate. I guess that is because of molecular hydrogen can increase a mitochondrial respiration, so aerobic metabolism. And if the lactate is a, let's say, byproduct of glycolysis, and lactate is a preferred substrate for the mitochondria in aerobic metabolism, 1 and 1, we got 2, easy like that. So lactate clearance is significantly higher. How about muscle soreness? We proved that if you try to supply or supplement molecular hydrogen before, during, and also after the strength training session, after the 24 hours, you feel better. You feel less pain in terms of muscle soreness, significantly. And the third finding that actually I like the most is that the lunges, the time, it means a performance of endurance, strength endurance, was higher in moment that our participants use a molecular hydrogen, and differences was about 8%. It's a great difference if you use a molecular hydrogen. The most recent study that has been published is using a molecular hydrogen in repeated speed ability in professional soccer players. So the performance level of these guys was really high. So we right now challenge a molecular hydrogen and its advantages or skills to improve a performance, and what we got. There is a significant decline in a reduction of repeated sprint ability. It means that the molecular hydrogen can mitigate a decline in sprint. Why? The explanation is quite easy, because if you check exercise physiology, repeated sprint ability, more sprint you do, more contribution of aerobic system to produce ATP occur. And right now, we are talking about the molecular hydrogen as a stimulation factor of ATP production by the mitochondria. So 1 and 1, we got 2. And also, there is one thing. Creatine phosphate shuttle is also linked with the mitochondria. So here, we got the performance, which is about 1 or 2.5 seconds. So muscle contractions is covered by ATP-CP. You got it? So it's very easy to explain this effect of molecular hydrogen. So far, I was talking about a pre-exercise molecular hydrogen intake, just acute exposure body to effect of molecular hydrogen. This is a study that I like most, because this one shows very clearly that molecular hydrogen can significantly, tectonically increase your performance, particularly swimming endurance in mouths, more than 3 times. These mouses were pushed each day within 4 weeks, swim, and mouse don't like swimming, okay? So it's very stressful training. And here we got two groups. One group supply hydrogen or supplement it. The other one trained in the similar way, but this mouse drank only a pure water. So this is a clear effect of training combined with the molecular hydrogen. And right now, many of you may ask, how could this dramatic increase in performance could be done? Why? It's almost impossible. And here is an explanation. Molecular hydrogen significantly increased antioxidative capacity of that mouse. Similarly, molecular hydrogen decrease pro-inflammation response, particularly tumor necrosis alpha and interleukin 6. So we can say that the molecular hydrogen in chronic supplementation can coordinate or optimize immune, also a metabolic response during chronic intensive training. So this is very interesting and important conclusion. And what I have to say as a summary, based on our results, I can say that the molecular hydrogen can exert an ergogenic effect in a specific type of exercise and also in specific population. And as I said before, this ergogenic effect might be modified the level of your performance. Better you are, less ergogenic effect can be expected. Another one conclusion is that the lactate clearance is higher if you apply a molecular hydrogen, because the molecular hydrogen defends mitochondria according to stress, oxidative stress, and therefore increase a mitochondria efficiency. It's clear. There are two independent studies that support this suggestion. We have a whole bunch of studies that clearly show that the molecular hydrogen can reduce oxidative stress as well as pro-inflammatory response. So right now, is it time to say, okay, we have a new tool which can defend our bodies against two negative effects of training induced. It means fatigue, chronic fatigue, or overreaching or overtraining, because it's well known that the overtraining can be started with the high oxidative stress in combination with the pro-inflammatory response. Usually, trainers and athletes ask me, how much molecular hydrogen, or let's say hydrogen-rich water, do I intake? I'm usually respond them. From my experiences, at least 1.5 liters at least 2 and 3 days before exercise and also during the exercise. Depends of what you expect from the molecular hydrogen, because you can expect increase of performance or effective recovery. So depends of the task, you have to modify also hydration strategy. And this is a final conclusion. It seems that the molecular hydrogen has no side effects, in chronic use. So molecular hydrogen has no negative effect on adaptation. It means that you can use molecular hydrogen for a longer period of time. Okay, right now we get the evidence about the 4 weeks. So from this place, I would ask if it's kind of challenging for us to prolong this period double time, 3 times, and then check if this study has a right. You know what I mean? So, from my point of view, molecular hydrogen can be as a future game changer, particularly in the sports training. Thank you for your attention.
Coming up next. Cinquin Philippe. COVIDROGEN. Exploration in 2 clinical trials of the clinical interest of hydrogen inhalation and of hydrogen-rich water ingestion for COVID-19 ambulatory or hospitalized patients.
Yes, good morning everybody. Thanks a lot to the organizers for the kind invitation. I'm very happy to have the opportunity to present this work, which is an international cooperation between France. I come from Grenoble, which is the capital of the Alps. Perhaps some of you already know it because it's a good place for skiing and you are kindly invited. And also from Serbia, the team of Belgrade. Well, I will present 2 clinical trials. And first, I would like to remind the context in which this started, because you know that COVID, of course, has a major impact. It's hundreds of thousands, perhaps even now millions of people who were concerned by complication. And yet today, there is only one medication which has proven real efficiency. Basically, it's corticosteroids, which indeed have an efficiency of about 20% and which are very useful. But you also have to take into account that about 10% of COVID patients will develop a long COVID, and this is a major public health problem. Well, about the molecular hydrogen, dehydrogen, I think that you all know how interesting it is, so I can go very quickly, and thanks to the previous presenter for reminding this. And so it's obvious that there is a potential for an interest of hydrogen to reduce the cytokine storm and its severity, which takes the patient to ICUs and then perhaps to death. Just to remind you, I would like to have you consider, oops, no. Okay, I would like to consider you these scales so that we know about what we are speaking. The first clinical trial is targeting what is called mild disease. These are patients that can stay at home. So they may have mild signs, but they can be treated at home. And then we also were interested, we also were interested in this one, which are patients who go to the hospital for oxygen therapy. Well, thank you to Grace, because this slide comes from her very nice paper, I must say. And so she very well explained how hydrogen may be useful specifically in COVID disease. And again, this was also covered previously, so I can go quickly. You have here a list, you have here a list of all the positive effects, and especially enzymes, which are overexpressed and which, as a consequence, have the capacity to fight against the natural story of COVID and to decrease all the negative impacts of COVID. So, first about what we call H2 COVID. We wanted a clinical trial targeting, as I said, moderate patients. So these are patients who receive oxygen at the hospital. So the question we had was, should we start with a phase 1, which is about safety, clinical trial, or phase 2, which is about efficacy? Of course, we all know that dehydrogen is very safe. But at the beginning of the study, COVID-19 was looking at the very complex pathology, especially about lung. So we considered it would not be ethical to go directly to efficacy and that we first had to prove safety. Then we have to take into account safety issues. Well, there is an issue of explosivity. It's a serious problem, and I think it's important in our academy that we discuss about this. How can we comply with the regulations, especially CE regulations about explosivity hazards? There is also, if you use nitrogen, a potential risk of suffocation, so you have to prove that this will never happen. And also, nonetheless, you have to prove the purity of hydrogen. So, for these reasons, we choose a source of certified medical-grade hydrogen and nitrogen, and a standard mechanism of pyrolysis, for instance, do not provide the corresponding certificates. So we turn to Air Products, who is building its hydrogen through electrolysis, and who was capable of providing these certificates. And so we had big battles with a mixture a little less than 4% of hydrogen. And so we had also to design a specific regulator to make sure that the patient can never, even if there is a human mistake, suppose that a nurse turns a valve in a wrong way, it cannot go to more than 1 liter per minute. So you see here the principle. This is the standard line of treatment. And you see here a Y, which connects to the device, so 2BL2, and then this specific regulator in which there is a specific device which cannot give more than 1 liter per minute. And so the purpose of the clinical trial was to demonstrate the safety of this medical device, and more specifically, to estimate the exposure duration limiting toxicity, EDLT. So we had 3 steps. First step was administration for 1 day. We included 3 patients. Second was administration for 3 days, again 3 patients. And then 6 patients for the next step, which was intended to be 3, but we were authorized by the protocol to go up to 6. And we had a problem. But this was a good problem for the patients, because in fact, none of the patients who came to this stage remained more than 4 days, because their clinical status was so much improved that they were discharged from the hospital. So the proof that we have today is that our inhalation protocol, you see it here in the room, is safe for at least 3 days. Well, I said that we do not have, of course, any statistical value of this data because the number of patients is too limited. Anyway, it was a real surprise for our colleagues who are in charge of these patients, because you see here a typical patient, so typical story of a patient, I won't go into the details. See the CRP, very high, 185, and see also the CT with 50% of infiltrates. And then you see that after 3 days, CRP has dropped from 185 to 33, and also the CT has very significantly improved. Besides, look at the literature here, which says you how the CRP evolves over time. And you see that for similar patients, it has a tendency to slightly increase. And look at what we observe. So again, no statistical evidence, but very interesting preliminary results. Now I turn to the use of hydrogen-rich water. This time it is for mild COVID ambulatory patients. So it is a randomized controlled trial, participation of France and Serbia, triple blind, and we included 700 patients. The criteria for inclusion was confirmed COVID infection, more than 18. We started with more than 60, but then we had difficulty in recruiting patients, and so we modified to at least 18, but another risk factor. And so 2 arms. One arm was receiving the tablets from Drink HRW, and I thank Alex Tarnava for this. And you know the mechanism of production of hydrogen. And the primary endpoint was a composite score, which included data about symptoms of worsening, and for instance, dyspnea and fatigue. And of course, if you needed oxygen therapy, to be hospitalized, and of course, dead. We had no death in our series. And then we are still going on because it's a 1-year follow-up that we have put in place in order to be able to assess the impact on post-acute and long COVID. So about the methodology, because this is interesting. We started initially with assumptions. We assumed that we would have a percentage of complication of 50% for the placebo, and that we would have an efficiency of about 25%, which corresponding to 37% of the intervention arm. So this yielded 450 patients. We, in the protocol, had said that we would have an intermediate analysis at the 100th patient. And then we had results which, of course, we were in a blind situation, so only group R1 and B, and we had an efficiency which could be of 19%, but the number of complications had been less than what had been anticipated, 35% as a whole, so we had to improve to 580. And then when we came to the 460 patients, we found again a reduction of the global percentage of complication, which led us to the number of 700 patients, which were included in about 15 months, 433 in France and 264 in Serbia. Now, I'm very sorry because the results were not what we expected. We would have loved, of course, to be able to say that, yes, there was an effect of the hydrogel. In fact, no, we do not have any statistical difference. As you can see, there is 44 and 46. So in terms of our primary endpoint, we have to conclude that we were not able to prove the efficiency. Anyway, we are still going on because, as I said, we have a 1-year follow-up, so we will end up the inclusion of the patient, not inclusion, but analysis of the patient in March or April next year. So what can we learn about this? Probably there is an issue about the dose of hydrogen. We had long discussions about this. We know, and for instance, the Serbian colleagues, Alexandra, Milan Vosec, and colleagues, have proven in a pilot study that there was an impact on inflammatory markers on COVID patients and also on fatigue for 3 times a day of administration. Why did we choose 2 times again a day only? Well, first, because we wanted to be in the limits of the FDA authorization as a new dietary ingredient, which is 2 tablets per day. But of course, it could have been designed differently, and we would certainly get the approval if we were asking for 3 to 4, because we would be able to provide the risk analysis showing that it is acceptable. Now, there is also another issue, which is compliance in general population. Because we observe that, and this is the reason, by the way, why we choose 250 milliliters, which is the minimum recommended, knowing that it would be better to have 500 milliliter. But then, in real life, with many patients over 70, it would not be realistic from the experience that we had. So we think that probably if we had to redesign the study, we would select patients with higher degree of risk of complications, for instance, more than 60 or even more than 70, and comorbidities. As a conclusion, I think that what we have proven here is that our protocol of inhalation, first, is perfectly safe, and this was the primary objective of this phase 1 study. Second, we have proven that the exposure duration limiting toxicity is above 3 days, and we are now convinced that 3 days would be the standard care that would be required for COVID patients, so that's not an issue. And we have very encouraging results. Of course, we would like to be able to launch a phase 2 clinical trial, and we are thinking about this. Please contact me if you could be interested, because obviously this would be a multi-centric trial that would have to be launched. And besides, we are looking and we are working in other domains to use this inhalation protocol for other inflammatory pathologies, because now that we have it at the hospital, we are accustomed to it, we can use it very easily. About hydrogen-rich water with magnesium tablet for ambulatory care, well, we have proven the feasibility and safety of an original randomized clinical trial. I think it's one of the largest, if not the largest, clinical trial with hydrogen-rich water, because we included 700 patients, multicentric and international. And also an originality that I would like to highlight is that we included patients with teleconsultation. This is original and it works. It's complex, but it can be used also for further protocols. Well, as I said, we are considering future research, for instance, in care homes for older people, and perhaps in some selected situations and patients, if we would have to check that they would be able to drink 4 times a day, 250 milliliter, we could propose them this level, or at least 3 times a day. Well, we are working, and I know that many of you are working also, and it's very exciting for me to have these discussions with you in this conference. I think we really have to find innovative solutions to be able to provide ambulatory patients with higher doses of hydrogen than what can be done with this protocol. And we have ideas about this, but many of you outside also have very interesting devices. And last but not least, we are really convinced. We had written a protocol, and we had applied for French funding for a long COVID study. Unfortunately, it was refused. The reviewer said that we had no sufficient rationale, which for us is just crazy, because I think that it's obvious from literature that there is interest. So we are still interested, and I know that some of you are also launching these rehabilitation programs. We would be very happy to cooperate with those of you that would go in this direction. Thank you very much for your attention.
Thank you very much, Dr. Cinquin.
Coming up next, Firment Jozef. The beneficial effect of molecular hydrogen in intensive care is awaited.
Thank you very much again for your invitation. I am anesthesiologist. I am working in clinical department in Košice in Slovakia. And aim of our activities are taking care about patients with failure of vital signs. Consciousness, breathing, circulation. And this is a little bit connected to new era of COVID. And I was not informed about hydrogen in intensive care. But I have only information from internet, and there were a lot of information from Critical Care Society, and this was a new disease for us, for respiratory failure. And Professor Slezak in 2020 year called me and offered this new invention for possibility for treatment of patients with respiratory failure. This was my first contact with this molecular hydrogen. His coworker, Professor Budaj, offered me a machine for production of molecular hydrogen, and another colleagues, as Dr. Šimik, offered me some literature, and these were my first informations about hydrogen. I see that there are a lot of potential activities and for useful this treatment for patients with acute respiratory distress syndrome. Sorry. This picture is famous in this conference, but our aim is lungs, inflammation, acute respiratory distress syndrome, pneumonia, and shock and sepsis and so on. We are focused to the patient with these problems, and we can see that molecular hydrogen has potential for regulation from this subcellular informations for our patient in clinical department. Hydrogen has very strong antioxidant effect, as I am informed from your presentation. And this interaction will be used for very selective potential influences. And we believe that these informations and these activities are very useful in clinical medicine. Molecules that are elevated by hydrogen administration are antioxidants, anti-apoptotic activities, anti-inflammatory activities, and influence to respiratory change during production on molecular high energy phosphates. Interesting is that the human body is influenced with various pathological situations, and this stress, oxidative stress, inflammation, and so on, and inflammation, all these activities are connected with the high production of cytokines, and these cytokines are potential dangerous for human body. According to new definitions of the sepsis, dangerous is not a microorganism, but by dangerous is a response of the macroorganism to these microorganisms. And according to potential of production of cytokines, this patient has severe or less severe sepsis. And here is area how to influence with hydrogen this big cytokine storm to depress response of the patient to the external microorganisms. As we know, this hydrogen is very interesting molecule for clinicians too, not only for you. And for me, it's interesting that here is selective neutralization of most cytotoxic reactive oxygen species. And here is stronger and faster binding to the more active and lower activity to reactive oxygen species that have a signaling function between cells. And probably this is a very useful theory for us for administration of hydrogen in critical ill patients. Professor Okta is a very big influencer for me because I have a lot of information from his letters and from his papers, and this is basal information for new era, probably in intensive care. For us is interesting pharmacokinetics of hydrogen, and we prefer, because we have big experience with inhalatory administration of agents, of volatile anesthetics, hydrogen, oxygen, nitrogen, air, and so on. And this distribution of hydrogen in various organs, previously was mentioned this high concentration, for example, in liver, and probably this information will be used for our clinical application of hydrogen in clinical practice. Another from pharmacokinetics is level of hydrogen during administration of 3% hydrogen or 4% hydrogen or 3% hydrogen, and how fast decrease the concentration in the arterial or venous bloods. There are not a lot of informations about clinical administration of hydrogen, but this is a recommendation for treatment of patient with cerebral stroke, because authors believe that this is earlier recovery of this patient. Interesting is that this patient with Parkinson's disease have two times lower intestinal production of hydrogen, and probably they have lower number of intestinal cells capable for production of hydrogen. This paper is interesting for us as anesthesiologists from point of view of methodology. Aim of this study was a pilot study of administration hydrogen to patient after cardiac arrest. And as you know, this is a very critical situation because patient has risk for development damage of cerebral cortex. And after recovery, patient has usually palliative status and very big handicap for neurological functions. For us, it's interesting this methodology, how to deliver hydrogen to the circuit. This is inspiratory arm, this is expiratory arm, and standard ventilator, which we use for artificial ventilation. And we are interested about inspiratory concentration of oxygen, because oxygen below 30% is dangerous for hypoxic tissue, and we must measure this inspiratory oxygen concentration. And of course, we are interested about hydrogen concentration. And this table has several possibilities how to prepare inspiratory gas mixture to make optimal delivery of oxygen and hydrogen to our critically ill patients, not only for patients after cardiac arrest. This is for general situations. Another interesting is that artificial ventilation, this is artificial activity, artificial aggressivity to the lungs. And patient after onset of high inspiratory pressure, inspiratory volumes, patient has risk for development of ventilator-induced lung injury. And here is this issue was compare inhalation of 2% nitrogen and air, and 2 times per hydrogen with air. And here is show that the patient has much better results of functions of the lungs if patient has in inspiratory gas 2% hydrogen. Maybe in future this will be standard admixture to the inspiratory gas as hydrogen, maybe. Administration of hydrogen and inflammation and oxidative stress on the heart. This is a paper from Slovak co-workers, and here is potential from administration of this hydrogen to prevention of patient with some ischemic heart disease or post-cardiac surgical processes. Another perspective useful is hydrogen therapy with activation of microbial steam in the gut, and hydrogen provide quite good benefit for patients with several diseases and cerebral stroke, endothelial dysfunction syndrome, ischemia reperfusion syndrome. Here is a lot of diseases when we connect in our intensive care. Sorry? Lactulose is sugar which we use as prokinetics in our patients daily. But similar side effect for us is that lactulose produced a lot of hydrogen, and this hydrogen production is probably significant for activity in the body in our patient, and I recommend to this treatment for our patients and to our colleagues to treat not only as prokinetic but as anti-inflammatory agent. Another effect of hydrogen in critical air is not anti-inflammatory effect, but physical effect. And physical effect, this small molecule, is decrease of respiratory resistance. And if patient has asthmatic-like breathing, we can use this admixture to decrease viscosity of inspiratory gas, and ventilation is much easier, and mechanical properties of ventilation is easier in our patient according to these studies. I have some information from China that they have a recommendation for admission of hydrogen to the patient with respiratory failure. This machine was delivered to our department, and we use this machine, but only as experiments with staff, because we have not agreement for administration hydrogen to the patients. This is only for staff, for experiment. Another information from clinical or preclinical medicine is administration of hydrogen with oxygen and nitrogen mixture to the animals during liver resection. This is very useful area, protection of organ transplant tissues, and probably some homeostatic effect similar as preconditioning, and we have experience with volatile anesthetics. And this is last paper as I have. This is probably in theoretical level very good, useful method for treatment. And the last picture is some problems, safety problems in our area, measurement, leak from our tubes, water saturation, dosing, overdose, is it possible or not, optimal concentration, and informed consent in our comatose patients. This is the biggest problem. Thank you very much for attention.
Excellent.
Coming up next, Ghizal Fatima. Effects of molecular hydrogen therapy on circadian blood pressure variability, notably at night.
Effect of hydrogen-rich water on circadian variation of blood pressure. Professor Hallberg, the father of chronobiology, trained Professor Cornelissen, trained Professor R.B. Singh, gave the opportunity to us to learn chronobiology and chronomedicine. Shift work is referred to as any schedule that is irregular or outside the normal daytime hours. Shift workers account for nearly 20% of the global workforce. Further, it is associated with several chronic diseases, including obesity, diabetes, cardiovascular diseases, and metabolic syndromes. Workers have a disrupted biological rhythm which predisposes DNA damage and risk of cardiovascular diseases, including hypertension, diabetes, and cancer. The shift workers causes the circadian rhythm misalignment. It affects the hormonal level and metabolism, changes in meal timing and dietary habit that results in impaired glucose and lipid tolerance that results in metabolic syndrome and gastrointestinal disorder. On the other way, the melatonin synthesis abnormally causes the sleep-wake cycle disturbances that results in neurological disorder, and high blood pressure accounts for increased inflammatory markers that results in cardiovascular diseases. Sleep-wake cycles are associated with circadian rhythms of nighttime decrease in certain hormones and increase in others. Reverse is in the day, which are regulated by exposures to sunlight and metabolism, during day and night, and other lifestyle factors such as nighttime eating dysregulates the circadian misalignment of all these markers. Circadian rhythm regulates the physiological and pathological functions of the heart and also the other organs, causing the high risk of cardiac dysfunction that causes the heart failure and causes the healing and repair mechanism causes lower risk of heart failure. The night shift causes blood pressure variability in nocturnal hypertension that exaggerates morning increase in blood pressure, marks hypertension, chart misor, hypertension, and eclampsia. Meta-analysis of 2 cohort studies that was done on 1,43,410 nurses that was followed up for 10 years. It showed that hazard risk ratio of type 2 diabetes mellitus was most commonly seen in the shift working nurses that was during the nighttime. Variability in blood pressure meta-analysis, 19 observational cohort studies and 17 clinical trial cohorts comprising 46 separate analyses were identified that causes increased long-term variability in systolic blood pressure that was inversely associated with risk of all causes of mortality. Long-term blood pressure variability is also associated with cardiovascular and mortality outcomes over and over the effect of mean blood pressure. The results of blood pressure variability and cardiovascular disease in this meta-analysis are clearly shown in this graph region. Total number of 906 cohort follow-up of 6.3 years among patients with ambulatory blood pressure above goal, the risk of cardiovascular events, and the presence and absence of the nocturnal dipping. Absence of dipping increased cardiovascular event, and in the B section, absence of dipping that increased the renal endpoint. In a cohort study, the Jackson Heart Study, the total sample size was 5,306 over a median follow-up of 14 years. The highest tertile of the individual components of morning surge, including post-awakening systolic blood pressure tertiles 2 and 3 versus 1, were significantly significant. Among Black adults, the component of morning systolic blood pressure surge, but not morning blood pressure surge itself, were associated with increased cardiovascular risk. In a meta-analysis of 38 observational studies, 27 cross-sectional, and 10 cohort studies, the rotational shift workers had a stronger odds of match than the other shift workers. In conclusion, our findings reveal the significant cause of an association between shift work and metabolic syndrome and different effects for sleep, gender, and types of shift work. The association between long-term night shift work and metabolic syndrome. Dipping status, the unhealthy blood pressures, non-dippers less than 10% dipping, reverse dippers rise in blood pressure at night, and extreme dippers more than 20% of the dipping. The circadian rhythm in blood pressure, this is the dipping pattern seen, and in the morning rise pattern seen in the blood pressure in MM and HG. In the night time, asleep, the dipping pattern, and morning rise during the awake time. 24-hour ambulatory blood pressure monitoring, nighttime blood pressures are significantly 10% lower compared to the blood pressure during the daytime. So blood pressure normally decreases from 1 a.m. to 6 a.m. in the morning and then rising with sunrise along with the heart rate. It is possible that nighttime systolic and diastolic blood pressure as well as heart rate may be significantly higher with absence of dipping compared to daytime blood pressures. This phenomena of dipping results from exogenous pattern of activity, stress, and postures during the 24-hour day, as well as due to exogenous circadian rhythm in autonomic nervous and endocrine system. This is a table showing the clinical data among patients with coronary artery diseases. So here the effect of hydrogen-rich water and circadian variation in heart rate after 4 weeks. So before treatment and after treatment with the hydrogen-rich water, heart rate peak daytime, heart rate peak, and heart rate average daytime, heart rate average nighttime were all significantly higher, were all significant associated before treatment and after the treatment with hydrogen-rich water therapy. So effect of hydrogen-rich water on circadian variation in blood pressure. So the systolic blood pressure peak nighttime, systolic blood pressure at day, and diastolic blood pressure peak at nighttime were all significant after treatment in comparison with the baseline data. So causes of circadian misalignment influencing in blood pressure and blood glucose. Rest activity associated changes in the behavior, routine activity, routine and level, consumption of stimulants, timing and content of the meal, emotional and mental stress postures, the biochemical factors associated with circadian disruption, autonomic nervous system, atrial and calcitonin gene-related peptides, renin-angiotensin and aldosterone. In brief, take-home message, night shift work may predispose circadian dysfunction that leads to nighttime hypertension and loss of dipping, and exaggerated morning increase in blood pressures. A treatment with hydrogen-rich water may be useful. Large randomized controlled trial would be necessary to confirm our observation. Thank you, Dr. Helberg, and all of you.
Coming up next, Hancock, John T. Molecular targets of hydrogen in biology, what are they?
Thank you very much, and thank you for the invitation to come here. It's a fantastic place. I've never been to Slovakia before, never been to Bratislava before. A fantastic weekend, so thank you for the invitation. It's great. What I want to do today is to sort of make you think, if nothing else, so just walk through some ideas about what is hydrogen and what is it actually doing. We've heard a little bit this afternoon about that, and I'm not going to argue with anybody. I'm not going to tell anybody they're wrong. I just want you to think about it. What are we actually doing when we give hydrogen to an organism? Before I do that, I just want to say I come from the University of the West of England. We've got two universities in Bristol. Bristol's about 2 hours west of London. If anybody knows the UK, we're to the west. We are the capital of the west of England. It was actually the European city of culture or something a little while ago. It is a lovely city. If you're ever in Britain, it's well worth a visit. So what I'm going to do is sort of make an apology to start with. That I'm a biologist. I'm not a biomedical person. I teach biomedical medicine at my university, but I'm actually a biologist. I trained as a biochemist, and I used to work on rats and human tissues many years ago, but more recently I've been sort of working on plants and all sorts of things. So during my talk, I'm going to be using biology in general. I know this is and I've put it up there, this is a biomedicine conference, but I'm going to be talking about plants, and I don't apologize for that. And I will be mentioning these funny things called bacteria as well. Some of the references I'm going to quote are really, really old. Some of my students come to me and say, I really shouldn't be quoting anything more than sort of 5, 6 years old. Well, I'm sorry, yes you should. I've been doing a lot of reading recently back in sort of the 18th century and things, and I'll talk about that in a bit. Some of the old stuff's really good. We sort of forget what some of these old people did, and we need to go back to that, I think, sometimes. I'm going to start really with an advert, a bit of advertising. We just finished a special issue in Plants in hydrogen, so if anybody's interested, this is just closed, the production and role of molecular hydrogen in plants. It's just closed as a special issue. But I have just started a new special issue, which is redox biology in plants. That opened about a week ago. It's open until June 23, so we've got plenty of time for submissions. So if anybody wants to put in a submission to our special issue in plants, I'll be delighted to have that. I'm also editor-in-chief of this journal, which is Oxygen. The only reason I mention this is MDPI have a voucher scheme, and because I'm editing these, I can waive your APCs for your journal. So if you're a bit strapped for cash and you don't know how to publish your next review or something, just give us an email, because we can get it into plants or Oxygen, because I could waive your APCs if it's appropriate and on scope. just to let you know. So what am I going to talk about today? Well, plants. If you look at plants, and we've just had this thing from the farm, which is great, and but if you look at plants and you treat them with hydrogen, you can see all sorts of effects. The roots develop better, the shoots develop better, the seeds develop better, you get a better crop, seed germination is increased, you get better pathogen responses. If you look at post-harvests, which is really important because a lot of crops are lost in the lorries and ships and airplanes or whatever. If you look at post-harvest vegetables and fruits, if you treat them either with gas or with hydrogen-rich water, then post-harvest is better, they last longer, and they're better in storage. And flowers, if you stick some hydrogen-rich water or you gas your flowers, they will last for longer. And so senescence is reduced. And the reason I say this in plants is if we want to look at molecular targets in biology, then those molecular targets are as valid in a plant as they are in us. I know this is a biomedical conference, but if we're going to look for targets for hydrogen, those targets should be working in plants too, or something analogous should be working in plants too. We can't just sort of say, we're a human, we're unique, we're not, we are just like a plant that doesn't photosynthesize. Okay, so the biochemistry is the same. It's also worth pointing out that when you look at some of these effects, then nearly all the effects of hydrogen, if you want a good effect of hydrogen, it's usually under stressful conditions. And if you look at the presentation we had right up front today, most of those diseases and stuff could be treated as a stressful condition. So hydrogen is working particularly well when an organism or a cell is under stress. And so one of the things we need to do is be able to say, well, if it's working under stress, what is it doing to mitigate that stress? How is it actually working? And so what I want to do today is just to walk through a few targets that hydrogen could directly interact with. And as I say, I'm not claiming anything particularly new here. I just want you to make you think that when you're doing this work, what is it that the hydrogen is directly acting against? And we've heard some of those this afternoon already, but I'd just like to open up that discussion a little bit more. So if we're looking at stress responses, particularly in small molecules which are involved in stress responses, there's a whole range of competitor molecules which we could look at. So what are they doing? So we could look at things like the reactive oxygen species. A couple of people have mentioned those today. So if we look at those, we look at things like hydrogen peroxide. Well, we know that's a signaling molecule. It's a very, very important signaling molecule. It can go in across membranes. It does all sorts of things. It can control gene expression. It can control a whole range of things. So hydrogen peroxide is an extremely important signaling molecule. Superoxide, people say less so because it is charged, won't go through membranes, but actually that's not strictly true because it can be protonated and then go through membranes. And superoxide itself can be quite a powerful signaling molecule, and there's quite good evidence for that. The hydroxyl radical can be seen as a signaling molecule, but in the grand scale of things, probably less so than things like hydrogen peroxide and superoxide. So if we're looking at effects in signaling through reactive oxygen species, probably, people can argue with me over this, but probably the hydroxyl radical is a fairly minor player in that, because the hydrogen peroxide and superoxide and other reactive oxygen species are probably as important or more important. So let's bear that in mind. We think of reactive nitrogen species and we instantly think of nitric oxide. Nitric oxide is actually not just the radical. You could think of nitric oxide as the NO plus or NO minus. They all have slightly different chemistry. But the nitric oxide, hugely important. And we know that from the work in the biomedical stuff back in 1987 when Moncada and his group said that the epidermal relaxing factor was in fact nitric oxide. So nitric oxide we know does a huge amount of signaling and controls a whole range of things, not just in animals. Nitric oxide also works in plants. All these things I've mentioned so far work in animals and in plants, including nitric oxide. Although the existence of a nitric oxide synthase in plants, we could have a whole evening's debate on whether that exists or not. Probably not. Peroxynitrite, again, thought of as a signaling molecule, but in the grand scale of when you're looking at reactive Nitrogen species, probably we're talking here more about nitric oxide than we are peroxynitrite. Maybe that's because we don't know everything yet, but if you look at the literature, that is the sort of perceived wisdom at the moment. And then we have the reactive sulfur species, things like hydrogen sulfide, which is a hugely important signaling molecule. And we produce it, and it does things. It controls things like blood flow, for example. And it's really, really important. And people are looking at therapeutics, so we can actually increase their hydrogen sulfide production in animals and humans and to get better outcomes. And then we mustn't forget things like glutathione, which is there at huge concentrations. In a plant cell, we're talking millimolar glutathione, which is a huge amount of glutathione, which is in the cell, which is controlling whether we're having oxidative stress or the redox of the cell. And so we have to think about that. Now, nearly all these are involved in post-translational modification. So if we take the reactive oxygen species, we've got oxidation. So we could get oxidation of proteins and all sorts of other things. If we look at the reactive nitrogen species, we get nitrosylation and nitration. If we look at the sulfur species, we get persulfidation. So these are all involved in post-translational modifications. It's easy for us to understand that. It changes the modification of the protein. The protein then has a different structure, has a different function, blah, 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 blah. We can see that. It works, okay? It works in our head. But then we look at hydrogen. No, hydrogen won't involve, it can't do that. So it must be doing something else. If it's not involved in a post-translational modification of a protein, like all these things do, what is it doing? I have put a few references at the bottom people might want to dip into at some point in their life, if they can't sleep, perhaps. So if we take these cell signaling molecules, where does hydrogen fit in? Well, I'm not going to argue with anybody that's said something today. I just want you to think about it. Hydrogen peroxide, probably not, although I have seen a paper where somebody added hydrogen to in vitro hydrogen peroxide and it was supposed to have reacted, but then when I talked to other people, they said, no, I don't believe it. So hydrogen peroxide, probably not. Superoxide, we've already heard today, no. Nitric oxide, no. The hydroxyl radical, yes, perhaps, although then you start reading papers like this, which it says there is no reaction between some of these things, particularly peroxynitrite. And if you read that paper, it says those reactions cannot take place. Not saying that's right, I just want you to think about it. And then very recently, a paper came out of North Korea, Kim et al., which was looking at how hydrogen reacts with the heme group. We heard a little bit about that about half an hour ago, 20 minutes ago. But this is a different paper, and they were looking at how hydrogen molecule reacts with the iron of the heme group, and it is supposed to then create a hydrogen radical, which then could go on to react with things like the hydroxyl radical, and that may account for why the hydroxyl radical is a yes and not a yes question mark, because there is some clever chemistry going on in the heme, and we heard about that from somebody else about 20 minutes ago. So if we're going to look at these, the major players in cell signaling have been ruled out. So we've ruled out hydrogen peroxide, superoxide, and nitric oxide. So we've ruled those out as being involved. And what we're now saying is that hydroxyl radicals and the peroxynitrite is where it is all at. And yet they're not the major players that the literature tells us are the cell signaling players. Now, I'm not saying that's correct. I'm just saying we need to think about that. If you read a lot of papers, you talk about oxidative stress and the fact that hydrogen affects the antioxidant capacity of the cell, whatever that means, whatever you want to call the antioxidant capacity. I just ripped out a paper there, which is in post-harvest of some flowers, and if you read that paper, they say that the antioxidants clearly go up if you treat them with hydrogen. Oxidative stress goes down. Now, oxidative stress is a funny thing anyway, because oxidative stress is a redox balance. So we know that if you look at a cell, it has a redox pitch, which is very reducing. And what we're basically saying is if that reducing redox pitch of our cells goes towards the oxidation side, then we're moving into oxidative stress. And that might lead to all sorts of changes in gene expression. Eventually, it would cause necrosis or apoptosis, although there's not apoptosis in plants as such, programmed cell death. And we say that that goes towards the oxidation, and it doesn't actually have to go very far into the oxidation to get quite profound effects. So we're going to, tens of millivolts into the oxidation. We're starting to get profound effects. One of the things I should mention while I've got the stage is we've got oxidative stress, but you can actually go the opposite direction and you could get reductive stress. It is a balance. And one of the things we might think about with our hydrogen research is if we have hydrogen there, which is quite a reducing compound, are we likely to push things not keeping them away from oxidative stress? Are we likely to push them into reductive stress, which can be as damaging as oxidative stress, although if you read the literature, there's very little about reductive stress in the literature. But we need to think about the antioxidant capacity, and what we normally think about is things like enzymes. And if you think of enzymes like superoxide dismutase or catalase, we could think of that in two ways. We could think of the activity going up, or we could think of the amount of the protein going up. Therefore, by definition, the activity going up as well. But are these direct targets of the hydrogen? Almost certainly not. We haven't heard anything this evening to doubt that. These are probably some downstream effect of what's happening. We see this happening, but it's not the direct effect of the hydrogen. So I very naively walked to my university library and I went to get an inorganic chemistry book, and I opened it up, and what they say is that, what do we know about hydrogen? Well, it's very, 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 very small. It's relatively insoluble. It's relatively inert. And none of these is very conducive to us going, oh, that's how it works, because it's too small to be seen by the classical type of receptor. And we know things, lots of receptors are in our cells, but hydrogen is almost certainly not going to be picked up by some sort of classical receptor. It's simply too small. It's not very soluble. But then again, if we think about this little sketch at the bottom, we can easily see short-term effects, but what we quite often hear about, and we've heard about it tonight, is those long-term effects. So what's happening in the arrows, which says, well, the hydrogen has a short-term effect, it does something within a few minutes, but what's happening if you then leave it hours or days? What is happening in that long period? You've taken the hydrogen away. And if you've added hydrogen-rich water, it's probably not hydrogen-rich water anymore because it's relatively insoluble. So it's come out into the gas phase and disappeared. So it's not actually going to be there for very long to have that long-term effect. So what we've got to be thinking about is something must happen in the cell to make sure that that short-term effect is turned into a long-term effect. And what is that? What are we triggering to make that a long-term effect? Because that's what we're recording, is that long-term effect. So you can look at the literature and you think things like hemoxygenase is affected. That might affect things like carbon monoxide signaling and things. So this is an example from a plant. This is an example from humans. I've not seen any evidence in the literature, you can tell me if I'm wrong, that this is a direct target. Yes, it might be affected, but I've not seen anything in the literature which said this is actually how the hydrogen affects the hemoxygenase. This is the chemistry which is taking place. They say, oh yeah, it goes up and down, and that's what you're seeing. But what is it doing upstream of that for this to happen? I've not seen any evidence of that. Please tell me if I'm wrong. So you sit in your office and you think about these sort of things, and it sort of dawns on you that hydrogen is actually paramagnetic, and so could you actually have some effect of the paramagnetic properties of hydrogen? It's possible from a theoretical point of view that the paramagnetic effects of hydrogen may affect nitric oxide, for example. That might then affect nitric oxide's metabolism. That might then affect nitric oxide signaling. From a theoretical point of view, that actually seems to be possible. And so there might well be some effect of hydrogen because it is a paramagnetic compound, and it can flick between its spin states. And we discussed this in a paper, rather strangely, by Hancock and Hancock a few years ago. Evidence? None. Okay? Nobody's ever done any experiments to show this. We're just flying kites here, getting some ideas out there. Probably hydrogen has some effects through its redox state. This is an example from a prokaryotic system where if you take the cytochrome C3 and add hydrogen, you can reduce the iron and you can actually have an effect. So there's a whole stream. If you look at this original paper, that then leads to a whole stream of downstream reactions, which is why you get the effect. I just torn out the one that's pertinent to this afternoon's discussion. So hydrogen does have a redox state, and it could possibly be affecting our cells through that redox state. And if that is true, what are the targets? Well, we've got mitochondria cytochromes, we've got chloroplastic cytochromes, both hugely important, as we've heard this afternoon. Well, not the chloroplastic ones, but the mitochondrial ones in particular. NADPH oxidase, which makes the reactive oxygen species. Quite a lot of our reactive oxygen species either come from mitochondria or the NADPH oxidase. NADPH oxidase is a heme. It's got two iron hemes on board, both which are very reducing. Is it possible that hydrogen is having some effect with those? Nitric oxide synthase is a heme-containing protein, so we might affect nitric oxide synthase activity and therefore nitric oxide metabolism through that. And then we have other heme-containing proteins, for example, guanylyl cyclase, hugely important signaling molecule. It's a heme molecule. If this is true, and it might actually have some effect through redox, potentially, there's a lot of evidence, no evidence for that at the moment, but potentially, if we could get evidence to rule these things out or rule these things in, it would move, I think, it would move this on a little bit. Xenon. Now that has been around, I told you I'll show you some old papers. That's been around since the 1940s, just after the Second World War. So xenon has huge effects. And what does xenon do? Well, if you look at xenon, it's inert. And I've already said that hydrogen is sort of inert. It's not strictly inert, but it's sort of inert. So can we learn something from looking at some of these papers? So xenon is quite interesting because it goes into the hydrophobic pockets of proteins. And one of the proteins which is particularly targeted is the globin family of proteins. And so if you look at some of these, from 1984, we have a Tilton paper which says the cavities in proteins and the xenon structure in myoglobin. And so these people are saying that these inert gases can actually go into the structure of proteins. They go into these xenon pockets and these hydrophobic pockets, and they affect the structural integrity of those proteins. And this is particularly done with the globin family. And then very recently, Marcus Mooley actually emailed me only this last week, because it's now just come out in the archive preprints. It's just not actually published yet, so I hope he doesn't mind me putting it up, because it's in the archive, the bioarchives. And he's been looking at how xenon migrates through proteins, particularly myoglobin. And if you look at myoglobin, it's got 4 xenon pockets, and the xenon migrates between the pockets. And if you have those pockets actually occupied, it alters, well, how the other xenons behave. So it actually alters the structure of the protein. And if you look at the conclusion of that paper, he says, by using xenon, I could prove to you that myoglobin is actually an allosteric protein. It's actually moving because the xenon is actually interacting with its structure. And then you look at some other inert gases. We heard of helium very briefly earlier, but if you look at some other inert gases, we can see that things like argon. I love this title. I love it. I think it's brilliant. A noble but not inert gas. So what is argon doing? It can't react with anything. This is an inert noble gas, so it can't react with anything. And then we're looking at things in brain tumors, in plants. So what is argon doing? Question that I want you to sort of ask yourself is, if argon is doing this, can hydrogen be doing this in a similar way? Can we learn something from the fact that there are these hydrophobic pockets in proteins that inert gases are actually interacting with? And does that tell us something about possible ways of hydrogen acting? Because if we think about it as an inert molecule, does it have some action in a similar way to xenon, the argon, and other inert gases, which we know does something. And if it does, what would it affect? Well, we know that the inert gases have a profound effect on globins. That has a profound effect on oxygen transport, but it also has a major effect on nitric oxide transport, because the globins actually interact with nitric oxide in very clever ways, and that's one of the ways you can move nitric oxide around a body. And therefore, if you can affect the globins through this action, you could actually affect not only oxygen delivery, but you could affect nitric oxide delivery, and that could be quite important. So is this something that we, as a community, is this something that we should be considering? And if we do, then other enzymes, if you look at some of these papers, it's not just the globins, there's a whole raft of enzymes where people have said this doesn't affect globins uniquely, and they'll list loads of other things. So there could be some enzymes involved, there could be transcription factors, other signaling molecules involved, because hydrogen is having a physical interaction through hydrophobic pockets and hydrophobic interactions, which are affecting these proteins. And we've just literally this week submitted this as a sort of review paper to Oxygen, and we've been talking a lot with Jonathan Stamler over in the United States, who has been absolutely brilliant, I have to say, talking to us about it. And I have to thank Jonathan in public for always input into this, because he's been truly fantastic. So I'd be interested to know what you guys think, basically. People know me as a bit of a maverick, and I just wanted to finish on a bit of advertising. I got a sort of a little bit off track recently, and I wrote a book, and I just thought I'd tell you about it for like 30 seconds. It's called Why Elephants Cry. This is a mock-up of the cover. It's probably going to look like this eventually. It's coming out in CRC Press in about a few months' time. And what I wanted to do is sort of ask the question, is if you observe animals, can you predict the weather? And if you can, what's going on? You know, why do spiders invade houses when a storm is coming? Or why do fish disappear when it's getting a bit rough? What is going on? I had great fun putting this together. I really, really enjoyed putting this together. All sorts of wacky stories came out. Really interesting stuff. I'd be delighted to talk to you over coffee about it. But it's coming out soon. And if you want to know, the British, one of the things I discovered that the British, we're brilliant, us British. 60% of the British people think that if they see a cow lying down, it's about to rain. And they truly believe that. Why? Anyway, if you want to know a bit more, I'd be delighted to talk to you about this, or just buy the book when it comes out. Okay, so thank you very much for listening. It was a bit of a rant through hydrogen chemistry. Thanks for listening. Thanks to all the people that are prepared to talk to me about this, and lots of people over the years to talk to me about it. Gracie, I've noticed, has been filming me religiously throughout this over there, has got a poster, so poster 13, if you want to know. Grace is my PhD student working on this. She is funded by this company, Water Fuel Engineering, who are very kindly funding Grace to do a PhD on hydrogen biology. So I'm delighted to take questions. Thank you very much. Okay, so we're in the closing stages of this conference, and I thought we'd have a bit of fun with some history. And I wanted to introduce this gentleman to you, a guy called Humphrey Davy, who was actually knighted. He became Sir Humphrey Davy. And what he did, a little bit about hydrogen and a little bit of history. I don't have a slide. Yes, I do. So Sir Humphrey Davy was born in this region of England, which is called Cornwall. Funnily enough, I was born there too. I am Cornish. I'm very proud of my Cornish heritage. It is actually a minority nation within the UK. So when I sign my census form, I don't actually have to put down English. I could proudly put down Cornish. It is a minority nation within the EU. And so Humphrey Davy was born in a town called Penzance, which is in the far southwest of this county. He then moved to Bristol, which funnily enough is where I now work. So I now live and work in Bristol. So this is nothing, I have not followed his footsteps at all. This is just mere coincidence. So that's where Bristol is in England. Obviously I've missed off Scotland, and Wales is also missing, but never mind. So some of you may know Sir Humphrey Davy because he invented this thing, which was the Davy lamp, or the mining lamp. And one of the problems in mines when Humphrey Davy was active was that there were lots of explosions in mines, and there was a British competition at the time to design something which would save the mines, and Humphrey Davy and his team, he had a small team of people, developed this, which is known as the Davy lamp, and it's been used internationally around the world. It's saved tens of thousands of lives, and I have to say Sir Humphrey Davy is one of my all-time heroes. So he moved to Bristol to this, which is, I did this presentation in rather a hurry, so I nipped on to Wikipedia. I can tell you in a minute why you should not use Wikipedia. But in Wikipedia, it says that he moved to the Pneumatic Institute under this guy who's a science writer in this date, and it's in Bristol. It's now a block of flats. The building still exists, but it's actually apartments in a region called Hotwells in Bristol. You could go and actually see it. So this is why I wanted to talk to you about Sir Humphrey Davy. So in the year 1800, he published this very long treatise on what he was doing in Bristol. And if you notice, he was a superintendent of the Medical Pneumatic Institute. It wasn't called the Pneumatic Institute at all. It was actually called the Medical Pneumatic Institute, so Wikipedia is wrong. And he was a superintendent. He was basically second in command in this Medical Pneumatic Institute. And this was formed just before 1800, and it dissolved roughly. It lasted for about 4 or 5 years, I think. And what they wanted to do there is to develop what was known back then about gases and whether they could be used for medicines. And so it was a whole range of gases that he was using. And Humphrey Davy discovered nitrous oxide, which is laughing gas, and I believe I'm right in saying that he actually named it laughing gas. And what would happen is that lots of very famous people would come down to Bristol and breathe in his funny gases, including nitrous oxide, and they'd be cured of all things. Back then, whatever they were suffering from, they came down to Bristol. Lots of famous people came down to breathe the gases from this Medical Pneumatic Institute. I want to point out 2 things on this slide besides where it was and the fact that he invented nitrous oxide, or at least discovered it. His dates, he was born in 1778. He published this very long treatise, which is about 530 pages. It's not a short thing. He was 22 when he did it. So he did all this work, and he was only 22 years of age. The guy's a genius. He died relatively young in 1829, but in the year 1800 he published this thing. So yesterday, when I was doing other things, I skim-read this, because I did this in rather a hurry. And so he was actually adding, if you read some of the text, I'm not expecting you to read all the text, but if you read some of the text on the left, he was experimenting with hydrogen gas with rabbits. So he was taking rabbits and he was giving them hydrogen gas and trying to work out what the effects were. And so this was done a long time ago. He then carries on. If you look through on page 345, he talks about 2 rabbits of the same breed. It was introduced with nitric oxide, blah, blah, blah. And if you carry on reading, he then introduces hydrogen. They were immersed in hydrogen for half a minute, bloody. So he was working on rabbits. He carried on working on rabbits. He obviously liked rabbits, or perhaps he didn't like rabbits, because obviously most of them died or were dissected. So 2 rabbits were destroyed. It's really hard to read this, by the way, because it's in Old English. So all the S's are F's. So it's really, really quite difficult to read. Even I struggle to read it sometimes, and I wouldn't want to read it out too much because I make lots of mistakes. But the 2 rabbits were destroyed after immersing in nitrous oxide. D was immersed in hydrogen, so he was playing with hydrogen and rabbits. Then he goes on here, he's talking about venous blood and in common air, hydrogen, nitrogen, etc. So he was playing around with human blood with hydrogen back then on page 355. He then goes back to talking about rabbits. So rabbits of 2 years old were introduced to equal parts of hydrogen and nitrous oxide through water. A large and strong mouse So you see the English is a bit odd. The large and strong mouse was introduced to a mixture of 3 parts hydrogen and 1 part nitric oxide, so he was playing around with rodents. It carries on, you can carry on reading this, it goes on and on and on. Then he decided he'd play with lizards, so 2 middle-sized water lizards were introduced, so he's playing with lizards. He also did amphibians at one point, which I couldn't find, but I know he's done it there somewhere. Then he decided to play with fish, so he was using thornbacks, and he talks about what happens to the gills, etc., etc., if you read all this stuff. Goes on and on and on. Then he decided to do insects, so a butterfly was introduced, blah, 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 and then further down it says a large fly became motionless, etc., 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 and all this sort of stuff. So he was playing with insects. He went on to play with snails and worms. Was there anything this guy didn't do when he was 22 years of age? I love some of this English. The English is very romantic at places. I had the curiosity to try whether venous blood exposed to hydrogen retain its power of being oxygenated longer than blood infiltrated with or saturated with nitric oxide. So he's playing with the idea of whether hydrogen is affecting the oxygenation of blood, or whether that's different to what happens with nitric oxide. And then he says over here, the other arrow, the color of the blood in hydrogen did not alter. So he's playing with samples of blood. And this is my favorite part. These guys were mad. They were completely insane, these guys, because they would take gases. They had no idea what they were. And it was only about 24 years before this that oxygen was discovered by Mikhail in Sweden, if you think it was him, or Lavoisier, if you're French, or Priestley, if you're English. Depends who you want to side with. But probably oxygen was discovered in 1772 by a Swede. So they didn't know much about what they were producing in these gases. And he said, well, I decided to breathe it in and see what happened. No idea what it is, but I'm going to breathe it in anyway. And he said, he lost all power of standing, he fell on my back, carrying in my lips the mouthpiece, separated the cylinder, to the alarm of Mr. Patrick Dyer, who was actually there sort of going, oh my goodness, I think I've just killed Humphrey Davy by letting him breathe all this in. So he was playing around, breathing all this stuff in and trying to work out what was going on. And then, if you go through this very, very long document, you get to page 400, and there's a whole section on the respiration of hydrogen. I think this is truly sort of incredible. We are in the 21st century, the new age of discovering hydrogen. Some fantastic work being done at the moment on hydrogen. But if you look back in history, some of these old people that just played around with all sorts of things were playing around with this. And I think it's sort of worth remembering that there's quite a long history. This is 224 years ago, 22 years, whatever it is, I can't do my maths. Over 200 years ago, and people like this were actually doing similar experiments to us. Now, I wouldn't at all say go back to read this and learn very much, because A, it's really hard to understand what they did, and B, I don't think they really knew what they were doing. So I don't think you'd actually learn a lot by reading this, but it's just interesting to note that we are treading on, what was it, somebody said treading on the shoulders of giants. Well, we are certainly treading on the shoulders of this giant, who's one of my all-time heroes. The full paper can be read at that reference. It's fully available online. You could just download it. I did it yesterday. But what I would also say is I was talking to Tyler LeBaron in a coffee break, and he said on his web pages he's got quite a big section on the history of hydrogen. And I said, have you mentioned Sir Humphrey Davy? And he looked at me rather embarrassed and said, I think I'd better go and check. So he will probably update it. So that's it. Thank you very much for your patience. Thank you, Jan.
Coming up next. Qianjun. Nanomaterials, enabled precision hydrogen therapy.
Hello everyone. Thanks for your coming to listen my presentation. I'm Qianjun He from Center of Hydrogen Science, Shanghai Jiao Tong University. in charge of research direction of hydrogen medicine. My topic today is the nanomaterials enabled precision hydrogen therapy and hydrogen molecular target. This is my WeChat. If you are interested in my topic, you can add me a friend. You know, hydrogen has some features, including smallest size, weak polarity, and weak reducibility. That leads to strong penetrability, high selectivity, and high biosafety, so that hydrogen can overcome various barriers, such as BBB and tumor barriers, can selectively neutralize hydroxyl radical, and kill cancer cells selectivity for anti-inflammation and anti-cancer, but does not bring obvious side effects. So, hydrogen exhibits a broad spectrum application in various inflammation-related diseases, but current hydrogen administration routes cannot efficiently deliver hydrogen at the site of disease. Aiming to this issue, we propose to develop functional nanomaterials to mediate hydrogen delivery, and propose 3 strategies for hydrogen delivery, including developed hydrogen carriers, prodrugs, and catalysis for hydrogen delivery. Also, propose to overcome the cone and use the probe for outside and inside cooperation therapy. Recent years, I'm focusing on the emerging field of hydrogen nanomedicine. I will introduce these 4 strategies in this session. First, routine carriers cannot stably load hydrogen at normal temperature and normal pressure, so that they cannot be used for biomedical applications. Here, we found PD nanocrystals can absorb a large amount of hydrogen at normal temperature and pressure, and the photothermal effect enables PD hydrate to decompose into hydrogen gas. Furthermore, we construct a new kind of morph structure to enhance the hydrogen loading capacity of PD. In order to enhance the delivery efficacy, we developed hydrogen prodrugs. Iron is the general hydrogen prodrug, but has low reactivity. So, we reduce iron particle size down to nanoscale to enable the response to weak acid in tumor microenvironment, but its response rate is still low. So, we construct iron morph to enhance the reactivity of iron for quick generation of hydrogen gas in response to weak acid. Moreover, we recognize metal borate and metal silicate could be potential hydrogen prodrugs. Since they have an AB-style structure, we hypothesize we can strip them into nanosheet to enhance the reactivity for acid-responsive generation of hydrogen gas by hydrolysis. Finally, we succeed. We are wondering if we can split water in the body into hydrogen by photocatalysis. The yield of hydrogen should be endless, in great favor of hydrogen therapy. But how to realize near-infrared photocatalysis for all splinting is quite hard, need to meet the following requirements. Moreover, we propose to use harmful chemicals in the microenvironment as a sacrificial agent to help catalytic deletion of hydrogen, realizing combined therapy. Based on this requirement in the bond structure, we designed two types of structures to realize near-infrared photocatalytic hydrogen generation. For solid tumor, there are two levels of barriers to block chemotherapy. The first is dense extracellular matrix. The second is intracellular efflux pump. But hydrogen can overcome both extracellular matrix and intracellular pump to synthesize chemotherapeutics for anti-resistance. Based on this idea, we developed these MOV materials to release hydrogen and DUX, a kind of chemotherapeutic agent, in response to acidic tumor microenvironment. Intracellular hydrogen assisted DUX to accumulate in cancer cells for enhanced anti-cancer outcomes. Finally, we're always paying great attention to hydrogen molecular target and mechanism. Even though we observed hydrogen can neutralize hydroxyl radical, but the direct reaction efficiency is considerably lower. So we hypothesize this catalyst to accelerate this reaction. Recently, we discovered this catalyst is N-porphyrin, is rich at mitochondria and hemoglobin. At the levels of molecule, proteins, cells, and animals, we confirmed it's an excellent catalyst for hydrogenation, especially in the hypershock microenvironment. N-porphyrin can catalyze the hydrogenation of carbon dioxide into carbon monoxide to mediate downstream signaling. We greatly appreciate Professor Sun, Otter, and Zhang to give a highly positive comment on medical gas research. Thanks for your attention. If you are interested in my research, just contact me without any hesitation. Also, you can find more details at this following site. Thank you very much.
Coming up next, Hyspler Radomir. The role of molecular hydrogen as highly bioavailable antioxidant.
Thank you for the introduction. And I would like to speak about molecular hydrogen as an antioxidant. What is first that there is no need for introduction here in this community, but we are especially interested in direct antioxidative action of molecular hydrogen. We do believe in similar or some equation like this one when a major donor of reactive oxygen is hydrogen peroxide, and by some still unknown mechanism it is converted finally into water. Water is very difficult to as a final product, to detect, and great advantage of hydrogen is that as an antioxidant he has no pro-oxidative activity, because pro-oxidative activity is the other side of the coin of every other known antioxidant. And plus the great advantage of hydrogen is of course high bioavailability in both aqueous and even more hydrophobic environment, past everything except metal membranes and metal material. So our methodical approach is deuterium, which is used as a tracer. So we know in the medical field and in metabolism that when we need to examine the fate of any compound in the body, the best way is to use the stable isotope of the compound, or stable isotopically labeled compound, to trace its fate in organism. Due to economical reasons, because deuterium is of course really expensive, we use intraperitoneal application to experimental animals to save the gas. And we use it as well in vitro for monitoring of physiologically relevant reactivity of hydrogen. In second part, I will speak about our experiments using inhalation of mixture of 40% of oxygen, 2% of hydrogen, and the balance of nitrogen. It is because we exercise safety, so this mixture is really safe, and it can't concentrate to higher percentages of hydrogen which could explode. We use it in experimental animals during anesthesia, during operations, and it is possible to use it even in human medical experiments. So experiment number 1, which I would like to show to you the results, was based on rats. We divided them into 4 groups, and there were control groups, endotoxin, hyperoxic and hypoxic group. So we tried to pressure them into higher oxidative stress. 2 milliliters of deuterium were applied into the peritoneum every hour. So the absorptive capacity of rats' peritoneum is about 1.2, 1.3 milliliters of hydrogen or deuterium per hour. So it exceeded the absorption capacity to be used for a maximum. And blood was sampled every 2 hours. Here are time profile of results. I should mention that the measurements of the deuterium enrichment in total body water were determined by Professor Henk Schierbeck from University of Amsterdam. Here we see that it is excess of deuterium oxidized into the in total body water over the natural abundance. The best performed controls. The endotoxin applied intraperitoneally to stimulate oxidative burst in polymorphonuclear cells, and hypoxia worked less and did not stimulate oxidative stress, which could be reacted or used by deuterium. and much less was deuterium oxidation during hyperoxia using pure oxygen, which was supplied to the experimental animals. It was quite great disappointment that probably the mechanism is more complex, and the standard increase of oxidative stress during the hyperoxia is not the target of deuterium action. But definitely the direct oxidation of deuterium was proved by very sensitive method. This is the fraction expression of oxidation, and here are controls, and it's quite similar except hyperoxia group, and usually about 10% of supplied dose was oxidized, which is quite plausible with other antioxidants such as uric acid, which is converted to allantoin into 5, 8, sometimes less, sometimes 10%. The reason why hyperoxia decreased the hydrogen oxidation is we hypothesize that probably it could be the competition with this mutation of iron peroxide complex. Experiment number 2 was based on the hypothesis that we should test these processes in more simpler model, not in the living organism. So we try to look at washed erythrocytes as a very simple cell, and we stored them in transfusion medium containing glucose for 10 days, and we applied ambient air over the erythrocytes and enriched with 2% of deuterium. Low hydrogen peroxide flux was provided by glucose oxidase from Aspergillus niger, and this enzyme oxidize glucose using the oxygen, and it provides low flux of hydrogen peroxide, and it is safe from the action of catalase, for example, or glutathione peroxidase, because it is slow. So continuously we put the erythrocytes under the oxidative stress. And here are the results. So without the flux of hydrogen peroxide, there was maybe little something, but nothing really detectable by even this highly sensitive method. But when we increased the flux of hydrogen peroxide into higher levels, but still really low, so 1 microliter per liter and hour. So the hydrogen peroxide was produced by very little rate. The oxidation of deuterium was increased in this simple cellular model. We had to use large or long incubation periods of 10 days to make it detectable for the instruments, of course. I should remind that deuterium is slightly less reactive globally compared to protium as an ordinary hydrogen, but it's about 10 to 15%. So the method is slightly less sensitive to the effects of hydrogen, but still it's quite usable for these experiments. The most important is that the presence of hydrogen peroxide significantly increases deuterium oxidation in erythrocytes, and it is quantitatively dependent. The more hydrogen peroxide we supply, the more deuterium is oxidized. The exact mechanism is still not really clear. We can't perform it in a tube without any presence of living organism. But we do believe it's somewhere close to Fenton chemistry, so it is close to complex of iron and hydrogen peroxide, close to ferryl radicals, high valent iron, and so on. In second part of this speech, I would like to present effects of ordinary hydrogen on two models. First is erythrocyte protection during storage, because we were interested in erythrocytes, and as a clinical chemist we have plenty of erythrocytes available. So we did collaboration with our transfusionist colleagues in our hospital, and we know that the hemoglobin oxidation to methemoglobin is a great problem for in transfusion medicine, and it does shorten the possible erythrocyte concentrate storage. The currently erythrocytes may be stored for 40 days maximum, and there is significant increase in methemoglobin content in them. So their oxygen carrying ability is decreasing. The great advantage is that polyvinyl chloride bulk is not a barrier for molecular hydrogen, and experiments were done using segments, and these segments are just a little pieces of tubing where the blood is stored in small quantities. It is welded in the segments. The tube is welded together by the heated pliers, and they may be used to examine the blood for compatibility for the recipient. So there was no loss of any transfusion units. We just used the tiny tubes, and we stored them in hydrogen atmosphere. So we asked for extra segments. They were placed in thick glass bottles containing ambient air and 2% of ordinary hydrogen, and they were stored at 4 degrees for 40 days as a standard procedure in transfusion banks. They were opened after the storage time period, and methemoglobin and conjugated linoleic acid as a marker of oxidation of linoleic acid in their membranes were determined. This is to show what is the natural increase in methemoglobin during storage. These are the ordinary erythrocyte transfusion units in our hospital. So after 40 days, there is about from 3 to 9% of methemoglobin. The physiological concentration is below 1%. So we can see that even after 1 day of storage, the yesterday samples, they have already supraphysiological concentration of methemoglobin. And here is the result. We started well because these segments were fresh, just from donors who supplied their blood that day, and in the air stored samples, there was about 5%, and the hydrogen saved about more than 1% of hemoglobin from oxidation to methemoglobin during 40 days. So it's quite effective, because every percent counts, of course. It does protect even membranes, probably more, because hydrogen is more lipophilic. It dissolves 5 times more in membranes, in lipids, compared to water. So it does save linoleic acid in the membrane from oxidation to conjugated linoleic acid, and ratio is quite significantly lower, about half after 40 days again. So it works, and it would work in ambient air as a safe component to protect erythrocytes in intact box. So there is no need to change anything in the technology of transfusion medicine, and it may be it could be the safe concentration of the hydrogen gas may be introduced in the fridges where the bags are stored. And it's quite effective on both hydrophilic and lipophilic markers of oxidative damage. And finally, we had a look at the liver resection and ischemia reperfusion damage, and we checked the possible use of hydrogen on liver resection, which requires clamping of major vessels. Our hospital is one of few centers in the Czech Republic which is performing the partial resection of liver predominantly due to localized metastasis in the liver. So the major vessels are clamped, the whole organ is under ischemia, and the one lobe, diseased lobe of the liver is exceeded. There is risk of residual liver failure, so the residual liver tissue may fail from ischemia reperfusion damage. So we used surgically relevant model, so 12 female pigs of about 30-35 kilograms each, and supplied 40% oxygen or 40% oxygen plus 2% of hydrogen to them during the operation after the onset of anesthesia. There were surgical procedures performed, middle-laparotomy, clamping of hepatic artery and portal vein. So there were complete warm ischemia of left liver lobe for 120 minutes, for 2 hours. And again, there was a reperfusion for another 2 hours, and liver tissue was sampled, blood was examined, and the experiment was terminated. Here are the samples of the hematoxylin eosin taken from the liver, and we may see that there is centrilobular necrosis and ballooning of hepatocytes compared to much larger compared to hydrogen treated left ischemic lobe. Quite interesting finding was that even the right lobe, which was just sitting there without warm ischemia, was protected from the damage by long operation, by anesthesia agents, and so on. So the status of non-ischemic tissue was also better compared to controls. This is the Suzuki scoring, which counts for necrosis, damage of vacuolization in hepatocytes, balloon degeneration, and so on. And we may see that the left ischemic lobe was significantly protected by the hydrogen, and even non-ischemic lobe was protected also by hydrogen contained in anesthesia gas mixture. So it is definitely effective in operation, surgically relevant operation model, and the application in human medicine should be safe and can reduce the incidence of postoperative liver failure, where the significant, and probably even in other tissues where significant ischemia must be employed during the procedure. So, conclusions. Hydrogen is a safe gas in safe concentration. We always exercise safety first. We must be really careful and never forget about the risks of explosion and the risks of hydrogen, because it contains a lot of energy. It is effective and amphiphilic antioxidant, so it's not usual that the antioxidant is working in aqueous and even membranes. There is no barriers for hydrogen, so it diffuses through all membranes without energy and through the whole human body. So we may agree, or we may, without any troubles, we may know that it is in the mitochondria. It is definitely in mitochondria, inner membrane, and so on. It is continuously produced in our bodies by microbial flora, and I do believe that the beneficial effect of vegetable, of soluble fiber, and so on, healthy Mediterranean diet, is carried partly by hydrogen produced lifelong in our large bowels. And it may be used in clinical practice via inhalation, because it's fast and intensively absorbed by the lung, or in local applications where the hydrogen-rich water may be applied. Thank you, and regards from Hradec Králové.
Coming up next, Kolotsayova Barbor. Effect of molecular hydrogen on cardiac surgery-associated acute kidney injury.
Thank you very much for the nice introduction, dear audience. In a few minutes, I want to continue in this topic of the transplantation of the heart. Every surgery, and also every open heart surgery, presents the risk of the complications. One of these complications is acute kidney injury, which occurs around 1% following all type surgeries, but is much more frequently after cardiac surgeries, where the incidence is up to 30%. In addition, incidence of acute kidney injury after cardiac transplantation is up to 70%. Cardiac surgery-associated acute kidney injury is a severe complication and a strong risk factor for death in patients undergoing cardiac surgery. The definitions say that it is a sudden deterioration in the renal function and the accumulation of urea and other nitrogen waste products in the body. Mechanism which influence the pathology of cardiac surgery-associated acute kidney injury is not yet fully understood, but it is suggested that the main role play renal hyperperfusion as a consequence of a non-pulsative low-flow circulation during the extracorporeal circulation, also using nephrotoxic medications which are frequently used during the surgery, and also inflammation and oxidative stress. During the extracorporeal circulation, the blood is in the contact with artificial surface of the ECC machine. What trigger inflammation and the oxidative stress? It was documented that during the first 6 hours of the ECC, the markers of the oxidative stress are significantly increased. In addition, during the ECC, the concentration of free hemoglobin and also amount of the damaged erythrocytes increased. The main role for creation of ROS is the iron accumulated from the hemoglobin release. It affects renal proliferation via peroxide oxidation and lipid peroxidation, and it is suggested that hemolysis and also increased plasma-free hemoglobin may contribute to the pathology of the acute kidney injury after the cardiac surgery. In the kidney, there is a very important enzyme in the tubular cells, which is sodium-potassium pump, or also well known as NAK-ATPase. This enzyme is transport 3 ions of sodium and 2 ions of potassium against their concentration gradients, and it is an active transport, so for this transport this enzyme used 1 molecule of ATP. In the normal kidneys, this enzyme is localized strictly on the basolateral membrane, and it contains from the alpha-1 catalytic subunits and beta subunits, which has a role as a chaperone. From the literature, there are now several studies dealing with the use of antioxidants supplementation during the cardiac surgery to protect the renal tissue. As you can see from their results, many antioxidants or many vitamins were not effective or had no renal protective effects. But on the other hand, I also found that, for example, N-acetylcysteine was effective and reduced the incidence of acute kidney injury. However, in our institute, we are researching molecular hydrogen for a long time. We speculate that maybe this molecule could be protective in the cardiac surgery-associated acute kidney injury. There are 3 simple reasons why molecular hydrogen can be effective. Number 1, hydrogen can convert toxic oxygen radicals to the water. It is the smallest molecule, smaller than any other antioxidants, and can easily and quickly enter the cells and the mitochondria. Hydrogen also triggers an increase of body-owned endogenous antioxidant system, and has also effect on the cell signaling, cell metabolism, and gene expression. In the context of transplantation, it was documented that inhalation of hydrogen was effective during the lung and liver transplantation. On the other hand, hydrogen-rich preservation solutions were very effective during the liver, kidney, pancreas, lung, and other organs transplantation, and these studies shown very promising results. Till now, it was, okay, from previous presentations, you heard about the effect of the molecular hydrogen in the condition of heart transplantation, but so far it was not documented if molecular hydrogen has also renoprotective effects during the cardiac surgery. To answer this question, we used in vivo porcine model of simulated heart transplantation. We used 2 experimental groups. In the first group, we had the pigs which underwent simulation transplantation. Approximately half of hour was preparing of the pigs for this surgery in the deep anesthesia. After that, simulation of the heart started with the occlusion of pulmonary veins, cross-clamping of ascending aorta, and connection to the extracorporeal circulation. Cardioplegia was lasting for 3 hours, and after this time of the cold arrest, clamp was released and the heart was rewarmed. After the 1 hour of the spontaneous reperfusion of the heart was experiment terminated. In the hydrogen group, the pigs were treated with the hydrogen during the anesthesia, during inhalation of the anesthesia, and also during oxygenation in the extracorporeal circulation. The hydrogen was in the gaseous form in the concentration of the 4%. We harvested samples before connecting to the extracorporeal circulation and also after the 1 hour lasting spontaneous reperfusion. This project was realized in the Prague in Institute of Clinical and Experimental Medicine with collaboration with professional surgeries, perfusiologists, and anesthesiologists from Institute of Cardiovascular Diseases from Bratislava. In order to be sure of hydrogen presence in the body, we measured the concentration of the hydrogen with a needle type hydrogen sensor, and I will not describe this graph in more details because you saw it in the previous presentations. In the past years, the renal damage was indicating mainly on the concentration of the uric acid and creatinine in the plasma. These parameters and also calcium, phosphorus, and globulins were significantly increased after the transplantation. In the group of hydrogen peaks, as you can see, we detected significantly lower levels of these biomarkers. We measured also the concentration of the plasma-free hemoglobin, which was significantly increased after the transplantation, but hydrogen didn't decrease it. We also measured the biomarkers of oxidative stress. As you can see, after the transplantation, both of these biomarkers were, after the transplantation, increased, and hydrogen normalized their levels. We performed Western blot analysis in the renal tissue, and as you can see from our graphs, we detected activation of NRF2 KIB1 pathway, which was associated with overexpression of protein expression of superoxide dismutase. Unfortunately, we didn't observe any significant changes in the TNF-alpha. We also activated sodium-potassium pump with the increasing concentration of the substrate ATP. As you can see, the group with the hydrogen has a lower activity of this enzyme in the whole range of concentration of ATP. By evaluation of the kinetic parameters, we detected a lower Vmax value, indicating lower reabsorption of the sodium, and we didn't observe any changes in the Km value, indicating no changes in the affinity to the ATP. Similar results we observed when we activated enzyme with the increasing concentration of the sodium. So again, activity of this enzyme was lower in the hydrogen group, as well as Vmax value was lower without any changes in the K and A value. By immunofluorescence method, we observed alpha-1 subunit, which was expressed mostly in the tubular cells, and in the hydrogen peaks, we observed significantly decreased expression of this alpha-1 subunit. However, electrolyte disbalance is one of the risk factors for the arrhythmias. We checked the concentration of sodium, potassium and chlorine concentration in the plasma and as well as in the urine. We detected that after transplantation, the concentration of the potassium was significantly increased in the plasma of the pigs, indicating higher risk for development of arrhythmias. And the using of hydrogen significantly lowered these concentrations. As well as we detected higher excretion of sodium to the urine in the hydrogen group. In conclusion, we can say that using a hydrogen could normalize biomarkers of renal injury and also attenuate oxidative stress via modification on NRF2 KIP1 pathway. And one of the mechanisms could be decreased renal NAK-TPase activity, indicating decreased sodium reabsorption. I want to thank Professor Sledak and Braňo Kura for excellent collaboration, and also Janka Volkovičová and Daria Kornieva, which helped me with analysis of these samples. And also thank you for your attention.
Thank you.
Coming up next, Kreutzek Milan. Case study of molecular hydrogen as antipyretic and chronotherapy with molecular hydrogen.
And presentation case study of molecular hydrogen in antipyretic and chronotherapy with molecular hydrogen. Please.
Hello, ladies and gentlemen. My name is David Marsalek. I'm the president of H2 Global Group. I would like to thank you, Professor Slezak, for inviting me here, and Dr. Kura. And I'm here today to present not just our company, but also our cooperation with Dr. Krajicek. As he cannot be here today, he's got another presentation in Prague. I'm not a doctor, I'm not a scientist, I'm a business person. I graduated at Dublin Business School in Ireland, and I started to use hydrogen 11 years ago when I met Professor Dusan Mialkovic, and since then he was my mentor, and I learned a lot from him. Because he was my inspiration, I started working in hydrogen from the business perspective. We set up a number of companies as one global group. We created structure. Each company has a specific role in the group. We go by book, however, we still try to do our best because hydrogen is a very new field. We try to do everything on our own, however, we still use an expertise from all scientists and experts all over the world, so we do take an advice when we are creating something new. We have our own team. At the moment, we have more than 10 employees. We cooperate with Dr. Krajicek when it comes to manufacturing food supplements and cosmetics. We have our own company set up with our own team in terms of research, development, and production of devices. And we also do provide education not only to professionals, but only non-professional public. We also cooperate with spas, health spas and wellness, hotels. We do, as I said, we do our own research development, and we cooperate with universities, with other organizations. Our main areas of expertise are healthcare, spa, agriculture, veterinary, health and beauty, and sport. We did set up our own media as well in order to spread the word about hydrogen correctly throughout the world. Now it's in Czech and in English. We are planning to expand into other languages as well. And an inspiration of Japanese leading structure of first hydrogen city in the world, I was inspired to set up our own project called H2 City. And the first H2 City building will be actually, the project is actually now at the stage of planning, but we already have a building and we're going to be changing the building into H2 City, and we're going to be providing quite interesting place to the public and professionals as well. We're also building the first showroom of H2 medical technologies in Ostrava again, but we already have interest from other countries and other cities. We are now planning one of the first projects of using hydrogen for growing vegetables with one of the Czech universities. We are cooperating with media in Czech Republic at the moment. However, we are planning to expand into other countries as well. We do attend some very big events. For example, tomorrow is one of the biggest hydrogen event in Germany. We will be there, of course. Now, at the end, I would like to highlight we shouldn't forget about the greatest scientists who are not here with us anymore. However, we should know that these scientists, helped us to make sure that the hydrogen is well known, because Professor Dusan Mělkovič was the first one in 2011 who introduced a hydrogen supplement into the world. Now I will guide you through the presentation of Dr. Krajicek, because he cannot be here today. I will be reading some parts. Hello, we would like to share with you our experiments with molecular hydrogen as a result of cooperation of two companies, H2 Farm and K2 Farm. The K2 Farm team is led by Professor Milan Krajicek. Throughout the whole experience, we were using two types of devices to measure: gastrolyzer and thrust legs. At one stage, at the very beginning, we were also thinking about creating hydrogen-rich beer or any other soft drink. However, due to the taste of the beer, the project was not successful. Unfortunately, maybe you can try that. Another experiment was held in 2020. It was my own experiment because I became a COVID patient, and I went home to self-isolation, and I started to practice an hydrogen inhalation myself. What surprised me the most was the instant drop in body temperature after it was raised. So I thought, does this mean that molecular hydrogen could be used as an antipyretic? And here's the first challenge, because Dr. Krajicek would like to challenge all of you and give you an idea to another experiments which you can take care of. I started research, and I noticed, and I found several studies that use the molecular hydrogen as an antipyretic, even for the most serious infection or diseases. One of the experiments we were undertaken was how to store a hydrogen-rich water. So we were using and tested both glass and stainless steel containers, and we found out that we can get a higher concentration by having the bottle closed while saturating, and we learned that the electrolyzer from Linke gave the best result at that time. You can actually see it in the front door outside. And another experiments are being held in cooperation with H2 Medical Technologies, and we're now working on researching, developing not just devices but also other equipment. at the moment, and soon we will introduce very interesting things to the public. When testing inhalation and breath hydrogen levels, we soon noticed a difference with the different cannula placement and different ventilation method. The highest breath concentration were achieved by inhaling through the nose and exhaling through the mouth. We achieved another extension by drinking saturated water by 90 minutes from the start of 30 minutes. Now, it's about food supplements. First, we produced a tablets called H2 Forte, and they support the endogenous stimulation of molecular hydrogen production with the help of our own human microbiota. A small amount of curcumin was added as well. This product was later developed further into whole product range of this production basis. Measuring the concentration of the breath usually gives you around 10 ppm. When you're not using anything, any supplement or if you're not drinking water. However, when we were testing these tablets, using 3 to 6 tablets, we got between 40 to 60 ppm concentration using gastrolyzer. The tablets contain trehalose, mannitol, curcumin, patented formula. In medicine, many synthetic drugs are used in various indications which have destructive effects on the microbiota, and as a result, the drop in hydrogen concentration in the breath is easily measurable. We aim to find substances of protective nature to administer hydrogen directly to infections if they are not caused by hydrogen-utilizing pathogens. This is another project we're going to be working on. Now there's more things we're working on together with Dr. Krajicek. A frequent complication of antibiotic therapy is the overgrowth of Clostridia, and we are now finishing development of drug form to suppress their growth. This is very interesting, another challenge for the researchers if you want to undertake another research. An interesting view, it's very interesting, is timing, that's very important. What we learned is administering hydrogen to patients with various diseases. For our therapeutic goal, it seems to us that evening administration is more appropriate. That's when immunity is at its peak. It's a time of renewal and regeneration. Already in the last century, there were studies providing that the administration of cytotoxic substances at a certain time at the day has a much greater therapeutic success. We often deal with MDR, multi-drug resistance. There's an example of study from 2003 showing that afternoon or night administration for cytotoxic agents has far better results than continuous infusion. We also know from the literature that simultaneous administration of molecules. Hydrogen reduces the side effects of therapy without losing the effectiveness of treatment. Now, children. It's quite a big topic, especially for Dr. Krajicek, because he loves children, same as I do. Another example is the treatment of leukemia in children and the difference in survival when marcaptopurin is given in the morning and in the evening. And even here, we see the possibilities of combining with hydrogen. One of the publications also demonstrates the suitability of combining cytostatic treatment with molecular hydrogen. Wow. And a topic that is in the interest of the influence of efflux system of the cells by molecular hydrogen. It can be a limiting factor in oncological treatment. Now, thank you. Dr. Krajicek would like to thank you for your attention, and I believe that we will find many participants for cooperating among us. And hydrogen is an exciting and satisfying topic. So he would like to ask you to email him in terms of cooperation on research.
Coming up next. Kretsi Yakub. Dose response of hydrogen-rich water on a sieved muscle soreness is moderated by age.
So, thank you for introducing me. There is a hydrogen research group at the Faculty of Physical Culture. We are focused on hydrogen application in sport. Here you can see some of our studies. The studies included time in uphill race, time on lunge in resistance training, time in 30-meter sprint, and time to exhaustion on treadmill running. The results are expressed as Cohen's d, and we can see that in some circumstances, the hydrogen provides beneficial effect. It's marked in green. And in other circumstances, the hydrogen provides no significant effect. For example, in one study, the hydrogen provides beneficial effect in lowest runners, but no significant effect in fastest runners. Also, the study in the literature provides controversial results. The molecular hydrogen provides beneficial effect in some circumstances, but not in others. So it's important to identify the circumstances which modify the effect of molecular hydrogen. This information is important for planning an optimal strategy of hydrogen administration. I will show a study, our study, which focus on dose of hydrogen and age of subjects. The study is focused on professional soccer players and evaluated perceived muscle soreness. 38 players was divided into subgroups. Both groups received 1 packet of water before first half and 1 packet of water before the second half, but only group 4 received 2 more packets after the match. So the group 2 received 2 packets and group 4 received 4 packets of water. After a week washout, the experiment was repeated and water was reversed. The muscle soreness was evaluated next morning. Now we can see the characteristic of the study groups. We can see that the only one difference was in the relative dose on hydrogen. The group 4 received approximately 2 times more hydrogen than group 2. In this study, we used a commercially available hydrogen-rich water. This water was produced from drinking water after hydrogen infusion under high pressure. The amount of 1 package is 420 milliliters, and amount of hydrogen is 0.9 ppm. The placebo was obtained from the same manufacturer. The only difference was that the hydrogen infusion was shut down. The muscle soreness, the perceived muscle soreness was evaluated using a visual analog scale. This is a psychometric scale based on 100 millimeters long line on the paper and shared with terms representing the extremes of soreness. As player was asked to mark his actual feeling on the line by marking a line. Yes, it is a subjective tool, but on the other hand, it is simple and non-invasive. We must take in mind that blood sampling is very hard in professional soccer players. Now we can see the effect of hydrogen on mass soreness expressed as mean and standard deviation. In both groups, after placebo, the mass soreness are very close, which is okay. The hydrogen-rich water reduced the mass soreness in both groups. And in group 4, the reduction of mass soreness was greater than in the group 2, but the difference was not significant. More interesting result is on this correlation graph. For group 4, we found a negative correlation of mass soreness on age, which means that older players benefit from hydrogen, and hydrogen provides a greater reduction of mass soreness. We can speculate that it can be due a lower antioxidant capacity in older persons. In group 4, we found no significant correlation with age. Yes, it looks like a positive correlation, but in reality, the correlation coefficient was low and not significant. So we can speculate that the 2 packets after the match was crucial for mass reduction after the match. In conclusion, evaluation and mean values may not provide sufficient information. So please, in future study, please please consider individual responses and look for suitable moderators. Thank you for your attention.
Coming up next, Branislav. Therapeutic effect of molecular hydrogen on the heart during its simulated transplantation.
Good afternoon, ladies and gentlemen, dear colleagues. I would like to start my presentation with one very well-known fact, and that fact is that cardiovascular diseases are still #1 in deaths of the people worldwide. In some cases, some patients need to replace their failing heart with a new one from the donor. They need heart transplantation. So today I would like to talk about the therapeutic effect of molecular hydrogen on the heart during its simulated transplantation. I would like to start also with few information about the history and some statistics according to the literature. First heart transplantation was performed in Cape Town by cardiosurgeon Christian Barnard in almost 55 years ago. This surgery was successful, but patient unfortunately died after 18 days because his immune systems. Next, in this region, in Czechoslovakia, the first heart transplantation was performed only 1 year after the first one in the Cape Town. This surgery was performed in Bratislava according to Professor Karol Šiška. In Slovak Republic, the first heart transplantation was performed in 1998, also in Bratislava, according to Professor William Fisher. And according to statistics, more than 5,000 heart transplantation were performed through the year worldwide, and in Slovak Republic together was performed more than 350 heart transplantations till now. Okay, during heart transplantation, heart is isolated from the body, and during these processes, mostly ischemia and reperfusion processes may affect the function of the heart. These two processes may affect the total success of the transplantation. In case of ischemia, you can see on this picture that mostly a lot of damages are causing, like decreasing of ATP, dysfunction of mitochondria during calcium accommodation inside, or maybe in changing on pH. On the other hand, during reperfusion, you can see a huge production of reactive oxygen species inside the cell. It's continuing ions imbalance in the cells and also changes in pH. Both these processes may lead to the arrhythmia, necrosis, stunning, or microvascular obstruction, and also should be could be failing the operation or surgery. Okay. In our study, when we study the literature, and according to these facts, we searching for some perfect therapy or molecule which will be able to protect the heart against these ischemia and perfusion processes. We found some information about molecular hydrogen, and according to literature, should be a perfect molecule because they have a lot of positive effects on the cells and organism. It is a selective scavenger of the most aggressive hydroxy radical. They easy penetrate to all biological membranes. They have anti-inflammatory and anti-oxidative stress function in the body. So what we do, you can saw this in Professor Slezak's presentation. So we used with pigs, black mottled from Czech Republic, and these pigs are cardiosurgeons clamped the heart of the pigs, and the pigs were connected to extracorporeal circulation machine and was flushed with a cardioplegic solution. After 3 hours of this ischemia, heart clamp was released. Pigs were disconnected from extracorporeal circulation machine, and after 60 minutes of spontaneous reperfusion, experiment was terminated. We measured molecular hydrogen according to with Unisense probe. Developed for hydrogen measurement from a lot of liquids or gas. And we use molecular hydrogen in two forms. We used saturated cardioplegic solution with total concentration of at least 1 ppm, and also in gas form during anesthesia when we applied 50% of oxygen with 4% of hydrogen gas. As you can see on this picture, we measured concentration of molecular hydrogen in arterial blood at least 0.2 ppm in each pig. And here you can see our results. We measured markers of heart damage. We measured troponin, myoglobin, and creatine kinase. As you can see, after transplantation, our group without transplantation, we measured increasing all these markers after transplantation, and pigs with hydrogen treatment have very decreasing values of these parameters. Similar situation we observed also in the levels of oxidative stress markers. We observed significantly increased 8-hydroxy-2-deoxyguanosine, superoxide dismutase, glutathione peroxidase, and malondialdehyde. And in the hydrogen-treated group, we observed significantly decreasing values of all these parameters. Lastly, we also checked the expression of some selected microRNAs. MicroRNAs are short non-coding RNAs with a powerful ability to regulate expression of a lot of proteins in our body. And we selected a few microRNAs causative connection to some cardiovascular disease connected with ischemia reperfusion diseases. We measured microRNA 21, 1338, and 199A And after, in group with transplanted heart without hydrogen, we observed significantly increased expression of all these microRNAs. And after application of molecular hydrogen, we observed normalization effect in all these upregulated microRNAs. On the other hand, we measured also microRNA 1, microRNA 208B, and microRNA 499. These expressions were decreased significantly in all transplanted pigs. And on the other hand, we observed significantly normalization after application of molecular hydrogen. In the conclusion, I would like to say that simulated heart transplantation significantly increased activities of glutathione peroxidase, superoxide dismutase, levels of malondialdehyde, and levels of 8-hydroxydeoxyguanosine. Simulated heart transplantation significantly changes the levels of selected microRNAs, microRNA 1, 208B, 499, and upregulated microRNA 21, 133A, and 199. And administration of molecular hydrogen exerts positive effect when significantly improves all these measured parameters. On this place, I would like to thank my colleagues from Slovak Academy of Sciences, my colleagues from Institute for Clinical Experimental Medicine in Prague when the surgery was performed, and also my colleagues from the National Institute for Cardiovascular Diseases in Bratislava. They are our team of cardiac surgeons. Where without their help, we are not able to realize these experiments. And you for your attention. Thank you very much.
Thank you.
Coming up next, LeBaron Tyler W. ORP should not be used to estimate or compare concentrations of aqueous H2, and in silico and experimental analysis.
Thank you very much. Of course, I thank the presenters, the organizers, and thank all of you for being here. I know it's a long trip for me also, but I know for many of you. So I want to discuss about the ORP. My entitled, should not be used to estimate or compare concentrations of aqueous H2, and this is mainly an in silico analysis, but I have some experimental data as well. So there are many hydrogen water products on the market, and often they're measured with an ORP meter, right? We see people using this type of a representation where we say, hey, the more negative the ORP, the healthier it is, and the more positive, the worse it is. And it's a very oversimplification, and we want to analyze some of this. So you'll see many demonstrations, right, using ORP meters, and there's this hydrogen meter, which is an ORP-based hydrogen meter. Okay, so this is not a true hydrogen meter, but it's based on ORP. However, the question is, what is this ORP meter actually measuring? When you get a negative ORP or a positive ORP, what's really going on? We published an article in Frontiers just recently that discusses this and some of the principles of this type of chemistry. So, as a brief overview, I'm going to discuss some redox half reactions, then the Nernst equation, and then ORP versus pH temperature, some experimental data, and then flow chart and summary. Okay, first we have our half reaction. So you have hydrogen ions, and those are normally supplied by the cathode during electrolysis, and then you form hydrogen gas. Here's a pictorial representation. Again, hydrogen ions plus 2 electrons make hydrogen gas. So this is oxidation and reduction. You start with an oxidized species, hydrogen ion, and then you get hydrogen gas. Now we have various half-cell reduction potentials. So this is when everything is at standard conditions, right? A one molar conditions, or 1 pressure, 1 bar pressure for hydrogen, for gases. And we see in the bold, we have 2 protons and plus 2 electrons, hydrogen gas. The standard potential is 0. It's defined as 0. That's the standard hydrogen electrode, the She electrode. And then sometimes in biology we use the formal potential. So this is when the pH is 7, for example, and that's when it's negative 0.41 volts. So these are half cell reduction potentials. But the question is, like with hydrogen water, you are often measuring water with different pHs, different temperatures, different concentrations of hydrogen. So what would the ORP be? So we use the Nernst equation. And here is simply the ORP, the E, is equal to the standard potential minus RTNF times the log of Q. And then the Q is written from this reaction, which is simply the reduced form over the oxidized form. And so if Q is 1, then E equals E naught. You can do the math. If you look at the natural log of 1, natural log of 1 is 0. 0 times RTNF is 0. So therefore, E naught equals E. Okay, so now we have our standard potential for hydrogen gas. Again, it's 0 volts, defined as 0 volts. And then we have the formal potential, which is negative 414 millivolts. And then we'll use this form of the Nernst equation. And there's different forms, actually. It can be kind of confusing, but we want to talk about activities. So, for example, this one here has showed the activities, the activity fugacity of hydrogen gas. But these ORP meters, they basically are using Henry's law and the Nernst equations combined to get a measurement of hydrogen gas. It's basically how they're used, what they're trying to do, what they're attempting to do. We're going to stick with this equation right here with our analysis. So here is the one we'll be sticking with. I want to pay particular attention to this redox couple, right? We have hydrogen gas and we have the proton, okay? The pH, and P stands for pressure, okay, it's pressure. This is hydrogen gas pressure. This is the pH, or the hydrogen ion, right from this equation. Okay, we can simplify this some more. We don't need to go into all the mathematical details, but if we solve for RTNF, we essentially get this equation right here, okay? 59.16 millivolts times the log of the pH2 plus pH. We can do a demonstration, all right? So let's say that you have water at a pH of 7. You can, and the pressure of hydrogen is 1 bar. So what is the log of 1? It is 0. So 0 times 59.16 is 0. pH is 7. 7 times 59.16 equals 414 millivolts. Okay, so when you have your ORP meter and you put it in the water at pH 7, technically you should get exactly 414 millivolts. Okay, this is how these meters work. However, how accurate are these? Well, just based on the hydrogen gas concentration, this is going from 0.1 milligram per liter to 50 milligram per liter. We have the ORP here on the y-axis, and the x-axis, we're going to 50 milligrams per liter. That's a very high concentration. Okay, you don't really do this in the lab. But you'll see that the ORP decreases by about 80 millivolts. Okay, so it goes down here and decreases by only 80 millivolts, increasing the hydrogen concentration by this much, all right? Now let's look at pH, because that's also in the Nernst equation. So again, y-axis, ORP, and then we have pH from 6 to 11. This is a common range of pH for many hydrogen waters because you have alkaline, ionized water and different things. But look, as you change the pH, the ORP decreases a lot. In fact, this range of pH, the ORP, changes by 300 millivolts. So pH has a very strong influence on the ORP. We could put these together, okay? So here, this is the concentration of hydrogen on the x-axis up here, it going from 0.5 to 2 milligram per liter. This is a normal range we see in many hydrogen water products. This x-axis is the pH. Again, this is a potential range for many products out there. And we'll see this for the hydrogen gas, increase in the hydrogen gas concentration, only 18 millivolt change in the ORP, versus increase in the pH is a 300 millivolt change in the ORP. Very significant. Again, pH dominates. And Why does it dominate? Well, it's because this hydrogen ion right here is derived from the pH, and 1 pH unit is a 10 times change in the H+, right? Also, this term right here is squared, so that's going to also change the denominator a lot. That's why pH has such a strong influence on the ORP reading. And now we look at the temperature, right? Because RT, so temperature and ORP. So remember with H2 solubility, typically, well, this is the y-axis. So as you increase the temperature, what happens to the solubility? Solubility goes down, okay? Now look at this though. This is ORP. You start with 1.96, and as you increase the temperature on the x-axis, the hydrogen concentration decreases, just like you would expect. Hydrogen concentration decreases, but look, the ORP goes more negative. So you can see what can happen where somebody can have a warmer water, for example, and they'll measure the ORP, and they'll be thinking, oh, this must have a lot more hydrogen in it, but actually has a lot less hydrogen because of the influence of temperature, right? Here's some experimental data. It's actually worse, because everything I just showed you was NERTS predicted. This here is what the NERTS equation would predict. But here is an actual experimental data using gas chromatography to get the known hydrogen gas concentration. And we can see that the ORP, the measured ORP, is a lot more negative. In fact, earlier with Professor Botek, he also measured ORP, and he often used a negative 600, negative 700 millivolts, again showing that the ORP is much more negative experimentally than you would be predicted by the NERTS equation. So it's a major problem. So here's a flow chart. You should take a picture of this, of when it comes to a negative ORP. If something has a claimed negative ORP, here's the questions. Does the water have a negative ORP as claimed? No. False marketing. Throw it away. Yes? Is the species producing the negative ORP therapeutic? No. Well, it might be harmful. Because remember, you can have like beta-mercaptoethanol or other substances that could be toxic that can give a negative ORP or give a false hydrogen reading. But if it is therapeutic, then you need to ask, well, is the concentration high enough for it to be therapeutic? You only have to have like 0.001 milligram per liter of hydrogen to get a very negative ORP, especially if the pH is alkaline. So you got to make sure the concentration is high enough for it to be therapeutic. So summary. This is a good summary slide. A factor of 10 change in Q results in a 59.16 millivolt change. So a 1 unit change in pH, or change in the denominator of H plus by 10 times, okay, that accomplishes it, or 100 times change in H2 concentration. Okay, think about that. Change in the pH, 1 unit, has as much influence on the ORP as changing the hydrogen concentration 100 times. Okay, next one, minor deviations from 7, for example, just a half a pH unit, impacts the ORP by 29.58 millivolts, which is as much as the entire contribution made by H2 concentration over the normal range of 0.2 to 2 milligrams per liter. So just minor changes in pH, okay, has a major impact. Delta T of 20 degrees Celsius influences the ORP to the same extent as does a half a unit change in pH. To be a valuable and reliable tool to estimate or compare H2 concentrations, ORP meters require an accuracy of about 1 millivolt. Most of them are like plus or minus 10 millivolts, or even plus or minus 100 millivolts. So again, it's impossible to do. Also, water contains other redox couples, so ORP is not going to be accurate. And again, experimental analysis illustrates measured ORP have even further deviations from predicted. So it is recommended to not rely on ORP to estimate or compare concentrations of H2 in water, even if pH and temperature are controlled, and instead use accurate methods such as gas chromatography or H2 selective sensor, maybe the methylene blue and colloidal platinum, you know, when you can, when it's appropriate. So that is my presentation. Thank you very much, and I will take questions if you have any.
Thank you very much.
Coming up next. Li Q Ye. Hydrogen, life energy.
Ladies and gentlemen, my name is Qianjun, came from Korea. It's my honor to be here today. Thanks you, Dr. Chancellor again, organizing committee. I'm very happy, and it's my honor giving my presentation with this topic. It's very simple, but I think it's important. Before start my story, let me introduce our laboratory work in Korea regarding hydrogen. Yes, for 5 years ago, I opened the subject class, hydrogen medicine, in my medical college. Until now, every year I teach hydrogen medicine to medical students and graduate students. It's very effective, and also announced the Korean broadcasting. And now we are conducting 2 clinical trials to get a medical device certification from Korean government. One is hydrogen inhalation. We are conducting clinical to get effect dementia. And second clinical, as you know, is the drinking hydrogen water increase good jam in colon and effective on constipation and diarrhea both, because improve abnormal fermentation. So we are conducting clinical trial, almost finished. After finish, I think early next year, Korean government will give a certification. Is drinking hydrogen effective on constipation. And I advise many company, institution, and farmer, businessmen also. There are several. This is Hyspler. This is the owner want to increase antioxidative capacity in the best of community best of need is the big capacity hydrogen generator. So I help them install and check the increasing antioxidant capacity of is the big is best of. And for last several years, I visited many farm and met many farmer to guide how to use hydrogen water each plant and how to use. And I felt several times it's very effective. Many farmers said the similar effect: increase lifespan, early harvest, increase sugar content, and increase productivity. This farm I visited many times. Last year, this is more than 10 times. Whenever I visited this farm, they gave me lots of melon also. And you know why I visited this many times? Yes, here. Last year, February, they did a mistake. Spread is the abnormal pesticide and started to dying like this way. There is no method to revive this, and they almost gave up continuous farming. And they heard the story, hydrogen water may regenerate this plant. They sprayed hydrogen water. The same house and changed like this, this June. I felt several times similar effect, but this farm showed very interesting miracle. Is the interesting result. You know, is not only is the revival, their productivity is increased more than 3 times. You know, this is the small house. The area is 800 square meter. This picture they gave me, boasting their product. This is the one house. Only this the 800. One time they harvested 1.6 ton. This is the biggest basket, 86. So I asked them, how much difference is compared to last year. They say every year is the maximum is the 20 basket, but after using hydrogen, they harvest one time 86. So seeing this several times, I realized hydrogen is life energy. And now I can say hydrogen itself energy, life. As you see, when you go outside, there are beautiful trees, the falling leaves. And we are here. I think we are living, the thinking outside is the tree, and we are big difference. That's true. Thinking is outside the shape is big difference. But we know inside the cell, same, almost the same. So hydrogen give energy to living things. And yes, sooner or later, all leaves fall down. And thinking you are remaining continuous, but our body also is changing continuously. As you know, our liver become new one every 6 months. Our hand become new one every 10 years. Same as plant we are. So I thinking and give energy to all living things. That is today my story. There are 3 reasons. This is my opinion. Hydrogen is life energy because hydrogen is the oldest body component for eternal life. Today I want to think together what is and how old we are. It depends on to think. And the second reason, that is hydrogen ion, proton, is life maintaining element. Proton keep pH balance in cell, and it is essential element to produce ATP from the beginning of first cell. It started 3.5 billion years ago until now. It's the key element of our living. And as you know, this is a very strong, unique antioxidant agent, this hydrogen. It expands our lifespan. It's better. So this is my story. Let's see first. 2007, there was a movie broadcast in China. It's very interesting. It's a Korean is 낙엽기근 Chinese, and English name Getting Home. It's very interesting story. It's the 2 men. They worked at same construction site, and they promised each other, if one man die, deliver friend's body to his home. And finally, one man died like this way, accidentally died. And his friend kept his promise, deliver friend's body, dead body, to his home. This is a very interesting movie. You know, this is the Chinese wise saying, 낙엽기근, fallen leaves return root. Fallen leaves return root. This is a general expression regarding life and death. And the same, Bible say, all came from dust and all return to dust. 4,000 years is very reasonable in the time when there is no microscope. Yes, this is true until now. But you can see cell. And now you can see more inside the cell, more inside the atom. We have to define life again and consider what is life over hydrogen. So this is our life. We think I'm my age, your age. How old are we? 13, 14, 15, 16. Yes, generally. If you think like this way, this is generally our life. And this is very natural because in the view of biologists, our life started from here. Yes, cell end is about 60, 70. Yes, we think end is biology, chemistry, physics looks like the same category. It was, but I think it's not a little bit different. You know, we use molecular hydrogen to get effect, biological effect, medical effect. We use molecular hydrogen. And if you think it's more inside here, if you study atomic, you have to study chemistry. And now you can see inside the atomic, what is a proton? That's a combination of many energy particles. In the beginning, there was energy from the Big Bang. And now we hear, it was very difficult to understand what is inside this atom molecule. But now you can see. Yes. If you see our life, our age, if you think from this cell, yes, it's 78, maximum 122. But if you think our age from this atomic inside and this before that energy level, our age is 13.8 billion years old. And that's also true. So I think it's time to reconsider what is life, what is our age. Yes, yeah, this is cell. There are lots of organelles inside. From here, we are big size. There are 3 trillion cells, so it's the compose of our body. And yes, we are old, 78 years old now. But if you think the composition of our body, how old are we? Our body comprises several atoms. Where do the elements of our body come from? Yes, this is true. Most of the elements of our body were formed in the stars over the course of billions of years and multiple star lifetime. And it's also possible that some of our hydrogen is started from Big Bang until now, same hydrogen. Yes, 90% of our body component is hydrogen. It developed from Big Bang. So we can say our age is 13.8 billion years old. And also that's true. Yes, from there, hydrogen until now is maintaining their shape and composing our body. This is academic truth. We are 8 billion years old. Then, how old are you? If you say this is true, we have to define what is life. What is life? Yes, it's very simple. What is living? Non-living, that is. It's very simple. We learned like this way. How about this? What is living or non-living? Is this living or not? Yes, there's no motion, but living. And non-living, but moving. Yes, we can define, yes, some you can. And how about this? This coronavirus, let me ask you, living or non-living? How to say? We learned it's not satisfy cell conditions, so we have to say this is non-living. Yes, non-living. This morning, I asked Dr. Ota. As you know, he is the world #1 mitochondrial researcher. Asked Dr. Ota, how about your opinion? This mitochondria living or non-living? Yes, he said definitely living. But I'm asking you now, living or non-living? According to our background, biology, cell background, this is non-living. We all know, move, work by themselves, but you have to say non-living. Because for a long time, it's not cell, so we have to say non-living. So I'm thinking it's time to change, reconsider what is, only know this is alive, but we have to say non-living. Then, how to define alive, how to life? For a long time, we are saying cell is the unit of life and cell is the living unit. But where is the living part of the cell? Nothing living in cell. All dead material inside the cell. There's nothing. We're just thinking cell is the unit of living things, but nothing inside there is living things. all dead material. Yeah, we say tissue are living because they are made of cell. That's truth. And organs are living because they are made of tissue. That's truth. But how about cell? Where is a living material cell? No, nothing. Just the cell is just entity, just a container containing several organelles. What is living? Inside organelle, they are living. And we combine all this, we call the cell. So I say, cell is not unit of alive. Alive, living things inside. You know, who is the named, coined cell? Robert Hooke first found cell with his the personal private microscope and named the cell. He discovered the first cell. You know, its meaning, cell is not living, just he. Yes. It's the Robert Hooke coined some cell. This small room. He defined cell, just a small room. It's not living. Cell is just a container. Living things are inside, mitochondria, nucleus, all move, work. There's no brain, no neuron, but they are all alive. That's the truth of life. Yes, the scientists say about 3.5 billion years ago, there was a first cell. It is called LUCA. After that, we can explain like this way, yes, we are here. But you don't know how first cell was developed until now. Scientists, there's no clue. There are several theories, yes. As you know, sometimes is the news and TV announced there is some organic material in is the astronaut and other space because it's the clue of this. Yes, this living things started from another planet. That's the reason why we study the finding water and try to find organic material to explain where is the origin of life. But until now, we don't know. And the more difficult thing, yes, we can understand from this, we can explain like this way. But how about inside this? Yes, this organelle is move, having activity. If you see inside this also, there is some lipid protein, they move. If you go inside, there is what is molecule, and then inside there is atom. And there is another inside, 17 energy particle. Yes, here it's very difficult to explain. After that, it's very easy. But before that, you don't know. But most of scientists agreed. Living things started from non-living things. And that's also true. From before, this protocell was made of this, yes, material, protein, lipid, and other things. Before that, and all this move active and combine this and started from here and developed the first cell. This is a planet. All things are working. 2 weeks ago, I think you may saw this the news from TV and newspaper. Yes, it's the quantum entanglement. Yes, 3 scientists got Nobel Award physics 2 weeks ago. They proved though two atoms locate separate, they connected and move together. This is the important is the experiment. So for a long time we thought one atom, but these 2 atoms, quantum, though locate separate far from one the atom, they connected, move together. It proved all atoms move together, work. And after that, they developed molecule and the other things. Everything is to move continuously. Let's see, summarize my story, where is the living part of the cell? This is cell entity. Where is the living things? they move inside. All matter in the cell alive. Yes, work like this way. But we say this is dead. All enzyme, membrane, they move, work like this way. As you see, all alive. Even cytoskelet membrane also, they move by themselves. They alive. But we defined all dead because life is have to satisfy cell condition. Yes, all move like this way. They alive. You don't know. It will take a long time explaining this. As you see, work by themselves, all alive. But we have to say this is all dead. Okay, let's skip. Yes. Scientists say yes, it's containing 100 trillion atoms. All atoms is the component of this cell. All this material is living condition. Our body also is composed of this, is the lots of atoms. If you see one atom in detail, there are 17 energy particles. And it was developed, confirmed by the Sun, is the European, is the research institute. And this final is the result, is the everything is made up of this, is a 17 energy particle. This is the component of atom. Just we think is the atom is the minimum, but inside there are lots of energy particles. Until now, scientists discovered this is the basic unit of living things. From here, yes, started everything in all universe. So is the George Wilde is the Nobel laureate, is the yes said like this. I have lived much of my life among molecules. They are good company. And there are two great men in physics, quantum physics. Schrödinger, have you heard about Schrödinger? And Einstein. They explained what is life exactly in view of physics. Schrödinger is wrote very famous book. He got also Nobel laureate Schrödinger. Schrödinger cat is very famous. It's the world best famous cat is Schrödinger cat. Yes, he defined and wrote the book. What is life? He defined matter and energy seems granular structure and so life. He defined life is matter and energy mixed. And Einstein also is explained like this. Everything is energy. This is not philosophy, this is physics. Sometimes we forgot what we are. Sometimes we think we are here and universe there. Einstein said like this. We are part of the whole which we call the universe. But it is an optical delusion of our mind that we think we are separate. This separateness is like a prison for us, our job. Enlightened people, we are one part of universe. If you think we have a body, it's comprised energy particle. Yes, everything is alive, even this mic. And here, you know, is the lunchtime. I drank water containing high concentration calcium, magnesium. It will be some part of my body, bone. Where is the origin of the mineral? It's underground stone. We drink this and will be some of my part. And someday we'll go back again, stone. And someday we'll intake. That is our body. As you see here, our body started from here. First material in universe from the Big Bang, this is proton. Hydrogen ion is the first material. And some of this material we are containing here now. We all know from the Big Bang until now, energy is same. Yes. So you can say we are as old as 13.8 billion years old because we are containing hydrogen. And second story, the proton, another name, hydrogen, is the key element maintaining, regulate pH balance in our cell, and also is the key element producing ATP. Yes, to live, we have to eat. Whenever we eat something food, we check calorie. It means calorie we have to eat to produce electricity. It's the equivalent like this. Whenever we eat, we have to produce to live. So mitochondria is called powerhouse of the cell. To produce ATP in mitochondria, there is a special device here, proton pump. Now it is called molecular machine. Without this, it's impossible to produce ATP. Whenever produce one ATP, need proton. Yes, this is proton. Yes. Whenever produce this ATP, need 4 proton. Without this, we cannot produce ATP. From the beginning of first cell, proton was key role maintaining our life. Yes, this is movie is showing the producing ATP and yes. Okay. My last story, it will finish 1 minute. Yes, we all know what is hydrogen. The smallest antioxidant point, small size compared to other antioxidant, because it can easily go inside the cell and the mitochondria is the strong, is the good point. There is the importance of hydrogen. There are lots of antioxidants. Why we give importance small size? It can go easily mitochondria. There are many antioxidant enzymes and non-enzymatic, but there is no hydrogen because hydrogen is the mechanism of antioxidant. Mechanism of antioxidant giving electron to radical. This is hydrogen. So until now, hydrogen is just the mechanism of antioxidant. But now hydrogen became independent as a unique antioxidant. So many years we conducted, very interesting. Drinking hydrogen water decrease ROS in blood. It means extend our lifespan. And also is the drinking hydrogen water compared to other extend our lifespan. So I'm thinking hydrogen is life energy and hydrogen itself life. Thank you for listening my story.
Coming up next, Lu Jiang Kang. Hydrogen medicine, a rising star in gas medicine.
Hello everyone, this is Jiang Kang Liu from China. I'm very glad to attend the meeting, and first I would like to give the congratulations to the first conference of European Academy of Molecular Hydrogen Research in Biomedicine. Also thanking Professor Jan Slazak for his kind invitation I'm very sorry I cannot come in person, but I think I can enjoy this meeting similarly as you all. Today I will talk about hydrogen biology and medicine, a rising star in gas biology and medicine. 2 years ago, I was invited to write a review, Hydrogen Medicine, a rising star in gas medicine. The first gas is oxygen. This is the most widely studied gas in our world. You can see in 2020, there are 45,990 papers published. This gas is so popular because it got the 2019 Nobel Prize. The second famous gas is nitric oxide. You can see in 2020, there are 7,143 papers published. It's so popular just because it got the 1998 Nobel Prize. The next one is the medicine. In 2020, there are 2,066 papers published. And EV carbon monoxide, there are 1,594 papers published. Another gas is hydrogen sulfide. It becomes popular in recent years. In 2020, there are 908 papers published. The last is hydrogen. You can see it's only become popular in recent years. Even the 2020, the most papers a year, only 200. Of course, the hydrogen is a new star for human health. And the great contribution was made by Professor Michal Alta's team. They published the famous paper in Nature Medicine. They showed low concentration of hydrogen is effective to prevent the damage in the brain and also quite safe. They conclude the mechanism as hydrogen as hydroxy radical selective antioxidants. Now, it has become common knowledge. But the question is, hydrogen hydroxy radical has short life, high reactivity. It is the strongest of the most powerful oxidants. It's unselectively and indiscriminately ranked to every type of molecule found in living cells. So, scavenging hydroxy radical is difficult and not an efficient strategy. In addition, hydrogen is only a very mild reducing agent or antioxidant. As we know, mitochondria are both the source and target of reactive oxygen species. Therefore, the best antioxidant is the one which can target mitochondria. We propose a mitochondrial nutrients concept. It suggests mitochondria need nutrients. If they are deficient in nutrients, there will be oxidative stress and decrease of the antioxidant defense, will lead to accelerate the aging process, increase the risk of disease, and enhance the progress of disease. On the other hand, if mitochondria have sufficient nutrients, all of this process will be reversed. How can these mitochondrial nutrients work? First, on the cellular level, they control or regulate the quantity. Each cell has certain number of mitochondria. If too many, the mitochondrial nutrients will regulate the degradation system. If too few, mitochondrial nutrients may regulate the biogenesis process, then keep the mitochondrial homeostasis. The second level, that means on mitochondrial quality. The mitochondrial nutrients may regulate the enzymes, proteins on the mitochondrial outer membrane, inner membrane, and also the matrix. We use the hydrogen gas producing product called calcium hydrate, CCH. It prevents high fat diet-induced fat liver. It protects the mitochondrial structure integrity. It also prevents the mitochondrial complex activity and also the protein expression. And it also prevents the liver mitochondrial function decrease. In another study, we found hydrogen gas inhalation improves cardiopulmonary resuscitation in rats. Hydrogen gas inhalation increases the rat survival rate. And it recovers the mitochondrial complex 3 activities in rat cortex. Because Dr. Harman proposed the theoretical theory of aging in 1950s. So, all the people think the ROS are bad, antioxidants are good. So, antioxidants become very popular in the last 70 years. But gradually, scientists understand, first, ROS are not only bad, but also good as important signaling molecules. Second, antioxidant treatments do not extend lifespan so far, and too much antioxidants may also be harmful. Therefore, scientists change their direction to study the endogenous antioxidant system in our body, mainly our NRF2 KEAP1 phase 2 enzyme system. Because NRF2 KEAP1 system regulates a lot of antioxidant and cell protecting target genes. Scientists have found many activities of NRF2 KEAP1 system. We found hydrogen gas producing product CCH can increase the NRF2 KEAP1 antioxidant enzymes, their nuclear translocation, and stimulate the KEAP1 system antioxidant enzymes. We also found many scientists found hydrogen gas may have the activating effect on the NRF2 system. Therefore, we propose that hydrogen may be an inducer or an activator of NRF2 KEAP1 phase 2 system. But very interestingly, most of the activators of the NRF2 system are electrophilic. That means most are oxidants, like hydrogen peroxide, like HAE, but hydrogen is a reducing product. So apparently they are not working on the 1, 2, 3, 4 classes, but they may work on class 5 or class 6, but we really don't know. Or it may be work by one of these pathways. Now we are under extensive studies now. So the hydrogen is a potential and promising mitochondrial nutrient because it's anchored by different pathways. Therefore, we think the minimum volume and maximum penetration capacity of hydrogen molecule make it ubiquitously super rare and promising. Then we think the hydrogen biology medicine becomes a new area as a rising star in gas biology and medicine. Hydrogen biology mainly studies the physiological effects of the hydrogen molecules in animals, plants, and microorganisms. And medicine mainly studies the pathological situations. Yeah, I would like to give thanks to my colleagues and students in my Institute of Qianjun University. Last but not least, thank you all for your attention.
Coming up next, Long Jiang Gang. Molecular hydrogen, a novel mitochondrial nutrient.
Hello everyone, so it's my great pleasure to be here to attend the hydrogen conference, and thanks all the organization committee members to make this meeting happen. And my topic today is hydrogen, a novel mitochondrial nutrient. I'm Jiangang Long from Qianjun University. Here's the self-introduction. So I'm interested in mitochondrial degeneration study and therapeutic intervention in neurodegenerative diseases and mitochondrial dysfunction-related diseases. So here's my email address and my web page. And also today's topic is mitochondria. So as we all know, mitochondria is a powerhouse in cell. When we intake oxygen, actually consumed in mitochondria to oxidize nutrient to produce ATP. The byproduct is CO2 and water. So in diet, the glucose, fatty acid, and amino acid actually transform to acetyl-CoA in mitochondria. Then TCA cycle and followed by electrotransporting, performing the oxidative phosphorylation to produce ATP to power the cell. So important function of mitochondria, except red cells and some terminal differentiated skin cells, most somatic cells has mitochondria. In each cell, 100 to 10,000 mitochondria per cell. So, for example, here's mitochondria in cardiac muscle. This is a fiber, this is a tuber. Between the fiber tubers, lots of mitochondria, located inside the cell. So to power the cell for cardiac muscle contraction and relaxation. Another example is, for the sperm can swim or running. This capacity due to the mitochondria in the tail of sperm. So if we give a close look of the sperm tail surrounding the flagella axon, this is mitochondria to power the tail to swim or run. Besides the ATP, produced by mitochondria, mitochondria also has another byproduct that is reactive oxygen species. So this ROS also produced by mitochondria. So let's have a close look of a fragment of mitochondria in the memory. For, as we know, mitochondria complex 1 and the complex 3. When some electron goes through the 1 and the 3 may leaking from the inner memory to matrix or to inner memory space to form superoxide. This is the one very important free radicals. So mitochondria is both the source and the target of ROS. So mitochondrial dysfunction is involved in various diseases, like in diseases in nervous system, heart, liver, kidney, et al. And we can conclude that if you want to make your body healthy, you need to make your cell healthy. But actually, you need to make your mitochondria healthy. So the question is, how to make your mitochondria healthy? This question already lots of laboratory and researchers to confirm that the first strategy or measurement is exercise. So how to exercise make your mitochondria healthy? Because exercise can activate PGC1 alpha induced mitochondrial biogenesis. So make your mitochondria healthy. And the second way to make mitochondria healthy is dietary restriction. So this study was already performed on alligator, mouse, rat, and also monkey. Can make your mitochondria work more efficiently. And in our group, we propose the third way to make your mitochondria healthy is mitochondrial nutrients. What's mitochondrial nutrients? That indicates that a group of nutrients beneficial to mitochondrial function, integrity, and rescue mitochondrial decay. So here are some subgroups of these mitochondrial nutrients, including antioxidants like CoQ, lipocacy, energy enhancers, cofactors, and some nature products. All these chemicals or nutrients we confirmed can target to mitochondria and rescue mitochondrial decay. So the most novel mitochondrial nutrient we think is hydrogen. As we know, this hydrogen, Dr. Osawa did some early work, and also in China, Dr. Song Xuejun did the first paper in China, published the first hydrogen paper in China. And in our group, we also did some studies. For example, we treated APPPS1. It's a double transgenic AD mouse model, and treated with hydrogen water. We found that hydrogen water shows some gender different cognition beneficial effect. For the females, greatly improved on cognition, but for males, did not show beneficial effect. So this is first study, and second study, we use a cardiac arrest model of rats. Here's the survival rate of this rat model. If this model treated with general treatment, the survival rate is around 40%. But if plus hydrogen inhalation treatment, the survival rate will increase to almost 80%. And our third study is use hydrogen storage pounder. The rat model is a high-fat induced obese rat. So we use this pounder, if compared with hydrogen-rich water. Here's a hydrogen-rich water. If you open the lid, the hydrogen level decrease soon. But the storage powder in solution can last a longer period to release hydrogen. And if treated the rat with this hydrogen storage powder, the gas the rat breathes out, you can measure the hydrogen level much higher if compared with the hydrogen-rich water treatment. So in this rat model, we found that hydrogen can improve rat insulin sensitivity. Here's the glucose, blood glucose level, and the OGTT. This powder can greatly decrease the glucose level, and also improves half-a diet induced fatty liver. This is fatty liver induced by half-a diet. If treated with hydrogen storage powder, it's get much improved. And here shows our recent reports, some in English, some in Chinese, also some patents on hydrogen study. And we think the questions in hydrogen research field, two questions. One is the click RCT studies are very few in current study, so need more RCT study to determine the dose and the effect of hydrogen. And the second question is how to intake hydrogen efficiently. We think need to prepare some product has higher level of hydrogen and also can be reserved for longer time. So for first time, we in our group did RCT study. We select 100 volunteers. These 100 cases, all impaired fasting glucose cases, and we treated with hydrogen-rich water or normal water. Here's some ethical evaluation and volunteer recruit, and also some manuals. And we found that if treated with hydrogen water, exactly decrease the glucose level after 2 months treatment. And so we think molecular hydrogen is actually a novel mitochondrial nutrient. There's 3 reasons. One reason, hydrogen is a endogenous component, and so it is very safe. And second, hydrogen has a moderate reducing poverty, can sandwich extreme toxic free radicals. And the last one is most important. The hydrogen, has a smallest molecular weight, so it can easily access to cell inner memory. Hydrogen can go through the mitochondrial memory to mitochondrial inner memory and matrix to quench the free radicals in mitochondria. So this is why we think hydrogen is a mitochondrial nutrient. And here's some plate of our institute. One is Center for Molecular Hydrogen Medicine, and also we cooperate with Douglas Wallace. We established an institute for mitochondrial and epigenetic study, and also cooperate with NASA, has established a joint laboratory. In our university, we also have an institute for mitochondrial biology and medicine. So finally, I'd like to thank Professor Song Xuejun, Professor Cai Jianming, Professor Qin Shucong, and also our school director, Professor Liu Jiankang. And here's our group. So thanks again for the organization committee giving me this opportunity to show my study. Thank you.
Coming up next, Lube Stefan. Hydrogen versus graphene, similarities and pitfalls in the applications of two progressive materials.
Ladies and gentlemen, first of all, I would like to express my gratitude for excellent organization of this meeting. I would say nihil obstat. Dear Professor Slezak and your team, my compliment. And this was probably the most important message, but I will continue with the presentation hydrogen versus graphene. My background is nanoscience, nanotechnology, everything with prefix nano, including graphene. And this is my first contact with hydrogen therapy community, but we discussed this problem with Jan Slezak during last years because we had parallel grant supported by Ministry of Education and we fight it with shoulder by shoulder with bureaucracy so we could exchange some ideas, and the idea was born that hydrogen could be compared with graphene. Both of them are very important and progressive materials of the near future. I would need, where is this pointer? Oh, thank you. So, the first decade of 21st century brought us two important inventions. Graphene flakes, the thickness is this monoatomic layer, thickness 0.34. The exfoliation was performed by two Russian scientists working since that time at the Manchester University, Guy Novoselov, and perfect and interesting properties of graphene caused that 6 years later they were awarded by the Nobel Prize in Physics. 3 years later, Ochta et al. Drew attention to the healing effect of molecular hydrogen. If you look at the length of the hydrogen molecule, you understand that also this entity belongs to the nano or picotechnology area. Therefore, they could be also compared. And up to now, I think more than 100 diseases were reported to be able to improve or to suppress using hydrogen therapy. At the left side, you see the hexagonal structure of graphene monolayer. Graphene is monolayer of graphite, exfoliated from the surface of graphite, and on the right side you see the well-known molecule of hydrogen. Next message is back to simplicity. You remember the discoveries of elements were followed by study of reactivity, binary, ternary, quaternary compounds, alloys, composites, mixtures were studied, were prepared, and we got into very complex area with millions of products which could not be examined, and the solutions were, practical solutions were chosen randomly. Now we see the return or some examples of the return to the simplicity, that means to nanostructures, to macromolecules, for instance, fullerenes, and other results which was awarded by Nobel, molecules, atoms, and so on. And it would be interesting to mention or to point to the vision of Feynman, which was proclaimed in 1959 at Caltech seminarium, where he made the statement that the principles of physics don't speak against the possibility of maneuvering things atom by atom. And this way, the idea of nanominiaturization and nanotechnology was born. Graphene showed amazing properties, extreme high strength, more than steel, conductivity, thermal conductivity better than diamond, extremely large surface, that means extremely large reactivity, and so on. And analogously, interesting properties appeared with hydrogen, obviously, first of all, in medicine, but also in other areas, because there is little of this element in our present atmosphere. So, which are the analogies? Both substances are used in elementary form. This means these materials are stable, there is no degradation. This guarantees repeatable properties, and the results could be interpreted within the framework of basic laws of physics and chemistry. Raw material resources are not limited. Both substances belong to biogenic elements, and due to small size, less than 1 nanometer, they easily penetrate cellular and other barriers in the body. And due to these advantages, both materials find many applications. These are applications of graphene. 35 of them are shown in the circular diagram. I cannot go to details. You may see there automotive sensors, transistors, aerospace, and so on. The angle of that segment is proportional to the amount of the respective applications. And when we speak about hydrogen, apart of its application in medicine, we have output to pharmacy, to food storage, to agronomy, to sport science, and many other fields. Some of them were reported these 3 days at this conference. Publication activities from the paper by G during the decennium 2007 up to 17. And I have also constructed this diagram. I have used Scopus. The search string was hydrogen and therapy in title, abstract, or keywords. And you may see that increase of publication activity is exponential. The time is shown on the vertical axis, and the number of publications at the horizontal scale. So you, if you would move it 1 quadrant to the left, you can imagine that there is an exponential. Well, administration of molecular hydrogen in medicine, more time mentioned at this conference, but I would only point to the sources of hydrogen. Yesterday in the poster session, or a day before yesterday at the poster session, I have seen interesting poster with proton membrane, electrolyzer. There are many of possibilities, tank, but very important and very progressive seems to be storage hydrogen as a fuel, as a solid fuel within the metal hydride, and also graphene is a challenger in this area. Risk of explosion, as you may know, exists if the concentration in air is over 4%, and Firment, our colleague Firment, mentioned leakage of hydrogen from instruments for tubes. Please remember this fact, and I will show in next few minutes our graphene sensors for measuring such leakage effects. Now, potential of graphene in hydrogen therapy. First of all, storage media, metal hydrides, graphene. Gives safety and regulation of dosing. Metal hydrides are based on light metals like lithium, beryllium, natrium, and so on. Unfortunately, only metal hydride from these examples which I have shown fulfill so-called Department of Energy limit, where the fuel content should be more than 6.5 weight%. So this is a limit which was formulated for energy area, but I will use it also for the comparison in hydrogen therapy. Pure graphene does not fulfill these demands. With red figures, you may see that at 10 megapascals, and even at cooling up to 250 degrees of centigrade, we reach only 6.43%, but situation may be improved when graphene is combined with metals like lithium, aluminum, zirconium. In the case of aluminum, we have the gravimetric storage density 13.8, which is 2 times more than is the DOE target. We have produced in the Institute graphene sensors for monitoring of hydrogen. These sensors are so they were prepared for the sake of hydrogen energy and hydrogen as fuel, but they could be used also in hydrogen therapy, because you may see in the figure that we are able to measure at least between 10 ppm and 1000 ppm, but we can extend this interval down and up as well. The sensor is very cheap, and the sensitivity of hydrogen also for therapeutic application is satisfactory. The material was prepared by sonication of expanded mild graphite. And graphene as carrier for hydrogen targeted delivery. Let me mention that in graphene, each atom is connected to 3 other atoms. These are bonds, and the last electron is free because it constitutes the electron gas. Due to this electron gas, the electronic conductivity is very high. But unfortunately, we had not free or dangling bonds on the graphene planes, and we find them only at the graphene edges. This pointer, yes. So we have deposited palladium nanoparticles 7 nanometer in diameter on the graphene flakes, and you may see that the distribution of particles follows the edges of graphene flakes. So it is possible this way, using these dangling bonds at the edges, to prepare the transport carrier combination of graphene with palladium, also to the targeted delivery of hydrogen, because as it was shown yesterday in the first of the Chinese cluster papers, the idea is that palladium will react with hydrogen, and this way the hydrogen is transported to those area in body which is important for us in that moment. Maybe one of last slides, Gartner cycle. New technologies follow so-called Gartner cycle. It has important nodes. Number one, start of new technology, peak of inflated expectations. Then we go through the valley of disillusion to the slope of real growth and the plateau of productivity. And in this moment, I would say that both graphene and hydrogen therapy are already on the slope of real growth. This follows from clinical and preclinical tests of hydrogen therapy, from many applications in the industry of graphene. So they are moving to the real plateau of productivity. Well, I will come to conclusions. In the paper, we point out the certain analogies of both materials. It is not surprising that research of these topics has similar course, because these analogies were displayed. The number of them is 4 or 5. This means that the both materials follow exponential growth of paper, similar character of Gartner cycle. And thanks to that, hydrogen research can avoid mistakes which were made with graphene. Graphene has been overhyped. I was compelled to skip that slide. Graphene also may be helpful in the hydrogen application as material of hydrogen sensor, as storage medium, and as transporter for targeted delivery. And it can also provide a model of roadmaps which are important for fundraising from domestic and European sources. Thank you for your attention.
Coming up next, Kurt Lucas. Development of an effervescent hydrogen generating tablet.
Yeah, thank you very much for the introduction. So we developed a hydrogen tablet too, but I do not see us in competition with the commercial ones. So it was an academic task, and you will see. So the outline of my talk is I will tell how it came to the tablet, and then I will present potential new applications for hydrogen, at least to my knowledge. So I used to work in industry until 2010. In 2010, I was head of a patent department, and I then acquired an allergy against the emission of laser printers. I had really severe problems with my respiratory tract and inflammation and rash of the skin, and I suffered from chronic fatigue. So I had to quit my job and was at home, and I had time, so I studied about 1,000 publications around the topic, and the outcome was finally that cinnamon, and especially cinnamon aldehyde, can antagonize the toll-like receptor 4, so you can really suppress this part of the immune reaction, and that is what we showed in the Max Planck Institute afterwards. And the other thing that I discovered is a circle, the toll-like receptor radical circle that consists of cytokines, DAMs, ROS, and the toll-like receptors. But here, today I'm talking about the hydrogen, so I was able to cure myself with cinnamon extract with the allergy, what we also could show in mice later. And I was also suffering from the chronic fatigue, and there I got in contact with Michael Maes. So Michael Maes is one of the leading scientists in chronic fatigue, and there are two hypotheses about what causes fatigue. One series thinks about oxidative stress, and the other about autoantibodies. So finally, Michael Mass treats his patients with NAC and acetylcysteine. But during this time, I read the papers about hydrogen from Professor Ota and other papers, and I decided to go for the hydrogen. And indeed, after 8 weeks of drinking hydrogen-enriched water, I overcame my chronic fatigue. Okay, how to produce it? We also use magnesium and vitamin C. And the problem, if you make a tablet, you have to separate the magnesium because it's sensitive to oxygen and water. And the ascorbic acid has crystal water in it, so you always have to get the ascorbic acid away from the magnesium, so you need a filler. So in the first instance, I took milk sugar. And here you see the personal evolution. In 2011, I just used magnesium with this small spatula to get about 30 milligram, some vitamin C. Then later in my kitchen at home in Hamburg, I had a tablet press, and at the Max Planck Institute we had a small production, and we had a 6-fold tool there to produce the tablets. That was all not very satisfying, so we started a cooperation with the Institute for Pharmacy in Mainz, and I hired Moritz Roche as a PhD student, and he had the knowledge of this 700 pages book, How to Make Tablets. And now he made, for 3 years, many optimization steps of the tablet. So the choice of the right filler is very important. That has an influence of how much of the hydrogen is produced, how much the tablet, how fast the tablet disintegrates, partially or completely. Then he made a lot of tests on tablet hardness. So if you want to sell a tablet, it's important that it is hard enough. And our biggest problem was the lubricant. So if you are working with a machine and a high throughput machine, you have the powder that you press to a tablet, you need some grease. And the standard grease is magnesium stearate. And if you use this together with magnesium under high pressure, it melts and covers the magnesium so that you do not have a full reaction, and you get gray foam on the water of the tablet, of the dissolved tablet. Then he further made research on the pore size of the tablet, and everything so finally was optimized. You can read all what we have find in this paper. So Moritz published this paper, and yeah. So finally we got a tablet. It's a little bit bigger, like this. It is not as strong. You see it? Hopefully. It does not make so much hydrogen as a commercial tablet. But anyhow, it's oversaturated, so it's more gas than you find there. Okay, from the beginning on, we cared about the regulations of the European community. So every step we do in the tablet is in accordance with the laws in the European community, and there is a white list for food supplements, what you are allowed to put in, and everything else is what is not on this list you cannot put into the tablet. And our tablet is in accordance with those regulations. Yeah. Okay, finally some of my personal experience here. The signs of inflammation are redness, swelling, pain, and heat. And I observed in many cases, or in cases, that after the drinking of the hydrogen-enriched water, swelling disappeared within hours, really dramatically. Yeah, then I myself was affected by a kidney stone. I had to went to hospital. Memorizing that it is anti-swelling, I took a lot of hydrogen tablets to the hospital, And I got rid of the pain within hours, and after 2 days I could leave the hospital. So that is a single case, but that is a potential application which might work, so clinical verification is needed. And another observation is that the drinking of hydrogen-enriched water causes urinary urgency in many cases. I asked the people, indeed, after 10 to 15 minutes after consumption, several people, or many people, report that they have to pee. And is this possible? Is there an explanation for it? Yes, it might be, because we have the renin-angiotensin-aldosterone system, RAS, of the kidney and then in the hormone system. And this is highly sensitive to reactive oxygen and nitrogen species, so it may make sense that that there's a linkage. But therefore also clinical verification is needed. No, go on. Okay, so finally let me thank you. I especially want to thank Professor Slezak for the organization and the invitation, and Professor Ota to bring the knowledge of hydrogen to me, what really improved my life. Any questions?
So thank you for perfect timing.
Thank you.
Coming up next, Mark Swaimai. From Energy to Evolution, Hydrogen Metabolism in Eukaryotes.
Dear Professor James Lizak, dear guests and Ivy expert, I'm from Beijing University of Technology. First of all, I would like to congratulate the first conference of the European Academy for Molecular Hydrogen Research in Biomedicine. I'm very grateful to the organizing committee for my invitation. The topic I'm going to share with you today is about research on the biomedical mechanism of hydrogen, that is, from energy to evolution, hydrogen metabolism in eukaryotes. The mechanism is always one of the hotspot issues of particular concern to the hydrogen medicine researchers, and I will introduce some progress of our team in this regard. Recently, the preprint version of our paper on wound healing was online. In this study, we got many new discoveries, which is quite an exciting result. So let me make a brief introduction about it first. Wound is a very common and high-incidence pathological state. Some reports have shown that hydrogen play functions in wound healing. Our study adopted a full-thickness dorsal skin defect mice model and found that hydrogen can significantly promote wound healing and initiate a novel pattern of nitro-moist wound healing. First, the wound healing speed and quality were greatly improved, with very little scar formation on the wound site. Second, many discussions have been focused on whether hydrogen has a dose effect. When we compare the high concentration of hydrogen with the low concentration, dose-dependent healing effect were observed, and the 66% hydrogen performed better than 5% hydrogen. And at least in this study, we proved that hydrogen has a significant dose effect in the process of wound healing. Third, by evaluating the 33% oxygen treatment, we revealed that the healing effect of high concentration oxygen on the healing was equivalent to that of the control group, but inferior to the hydrogen treatment. Fourth, it's previously believed that the main reason for hydrogen to promote wound healing were antioxidant and anti-inflammation. Our study found that hydrogen can reduce inflammation and tissue damage. At the same time, we added an NEC treatment group to evaluate a possible role of ROS cleavage in wound healing, and the NEC group showed a similar healing effect to that of the control group, but quite far behind the hydrogen group. Fifth, persistent daily treatment is required for the full benefits of hydrogen. The abbreviated hydrogen treatment for the first 3 days only obtained a similar healing effect to the control group and was far inferior to the persistent 11 days hydrogen treatment group. We know that the first 3 days are in the inflammation stage. The above points suggested that hydrogen is the main factor to promote wound healing. Antioxidation may not be the cause of hydrogen function. So the above points suggest that hydrogen is the main factor to promote wound healing. Antioxidation may not be the cause of hydrogen functions. So it's necessary to find other mechanisms besides antioxidation. Our further study uncovered that hydrogen can activate stem cells and collagen deposition. Although there were several reports showing that hydrogen promotes collagen production, most of them just use the myosin stain to check the total collagen deposition. In our study, we found that after hydrogen treatment, a large number of different kinds of collagen, such as collagen 1, 3, 70, and so on, were produced in different locations of the skin, especially in the proximal wound. This indicates that the skin may recover to a younger state, leading to faster epithelialization, which is similar to the scarless wound healing mode in fetal period. There's no doubt about the important role of stem cells in wound healing, but whether hydrogen has any effect on stem cells during this process has not been studied. At present, there are 2 studies on the relationship between hydrogen and stem cells. One is an in vitro study, which found that hydrogen prolongs the in vitro lifespan of MSCs without losing differentiation potentials. Another animal study suggests that hydrogen can protect stem cells from radiation damage by resisting free radicals. In fact, these results have little to do with the characteristics of stem cell itself. In our results, we prove that hydrogen can activate stem cells in vivo of mouse model. We found that hydrogen can promote the activation and differentiation of epidermal stem cells as well as hair follicle stem cells, and it has special temporal characteristics. I think stem cells will definitely become another hot topic in hydrogen biology. Meanwhile, the movement function and proliferation activity of fibroblasts and epithelial cells are also greatly improved by hydrogen. In this movie, the fibroblasts treated with hydrogen. The movie shows fibroblast cells treated with hydrogen. We can see that its moving distance is twice that of the control. The studies further show that the role of hydrogen is not only a simple antioxidant, from the activation of stem cells to the boost of collagen deposition, especially the promotion of cell activities. Hydrogen has shown different powerful effects on different types of cells, which cannot only explained by antioxidation. Therefore, we believe that although hydrogen can resist oxidation, the role of hydrogen is far more than antioxidant. We need to uncover the mechanism of hydrogen functions in different aspects. There are some interesting signs, and one of them points to the origin of life. At the earliest time, 40% of our globe is hydrogen. Actually, the Earth was rich in oxygen for a very short time. Eukaryotes arose roughly 1.8 billion years ago. It means that the first 1.3 billion years of eukaryote evolution took place in low oxygen and high hydrogen conditions. It's quite conceivable that if our high life came from the ancient hydrogen-rich Earth, it must have been stamped with hydrogen, which is also the key to the evolution of life, and we wanted to be able to look for this stamp in high life. Hydrogenase catalyzes the conversion of hydrogen into protons and electrons, which is in turn produce hydrogen. Hydrogenase allow molecules of hydrogen that are very difficult to cleavage to react under mild conditions. There are many microbes can metabolize hydrogen by hydrogenase. In humans, the number of gut microbes is 10 times higher than human cells, so gut microbes have a huge impact on health. Among them, hydrogen is an important intermediate in energy metabolism, which relies on hydrogenase to produce hydrogen and use hydrogen for energy exchange. Our team also studied the effects of inhaling hydrogen and drinking hydrogen water on gut microbiota. It's found that drinking hydrogen water had a significant effect on gut microbiota. Next, we want to know whether higher organisms have the ability to metabolize hydrogen. We have just seen that hydrogen can activate stem cells, promote collagen production, and cell migration. It means that hydrogen has a dramatic effect on eukaryotic cells. I want to provide a new perspective which focuses on the cell membrane. The cellular membrane system includes plasma membrane, mitochondrial membrane, ER membrane, etc. Cell membrane play an important role in cell life. There are many channel proteins and electron transfer systems on membrane surface. In higher plants, membrane electrochemical potential gradient is closely related to various biological functions, including ion transport, signal transduction, nutrient uptake, cell growth, and intracellular pH homeostasis. The hydrogenase activity of cell membrane during plant seed germination was determined in our study. The purified plasma membrane was also used to explore the potential hydrogenase activity, the ionic transport. During the seed germination, we found that hydrogen could significantly promote the elongation of the hypocotyl. The length of the coated cell was significantly increased after hydrogen treatment. According to the acid growth hypothesis, the elongation of plant cell can be promoted by proton secretion. To determine whether the elongation of hypocotyl was caused by the changes in proton fluxes, the roots were soaked in the hydrogen-rich solution, and the proton fluxes of hypocotyl were measured using AMT technique. The results show that the proton fluxes were significantly enhanced by hydrogen treatment. It has been reported that hydrogen can improve salt tolerance. In our study and the salt stress, both of the proton and the sodium ion fluxes were reduced by hydrogen treatment, while hydrogen has no effect on potassium ion. Another good model for detecting ion flow is neuron. Next, we studied the effect of hydrogen on excitation and nerve conduction in the brain. The production of the action potential is due to ionic transport across the neuronal membrane. Some of the important ions involved in the electrical signal transfer process are sodium ion, potassium ion, and the calcium ion. The changes of the neuronal action potential in slices from rat brain were determined by using pentagram technique. After hydrogen treatment, significant change were observed in the threshold voltage action potential interval. An increase in resting membrane potential and the threshold of nerve cell burst action potential were also observed. This evidence indicates that hydrogen treatment could significantly reduce the excitability of neurons. Hydrogen may regulate the excitability of nerve cells by changing the charge difference between the inside and outside of the cells, or directly affecting the opening or closing of sodium and potassium channels on the surface of nerve cells. Due to the sequence similarity between hydrogenase and the complex one of the mitochondrial and bacterial respiratory chain, hydrogenase has been proposed to work as an ion pump. The mechanism of energy conservation by proton and sodium ion translocation has been well studied in hydrogenase. To seek the hydrogenase activity, we explore two membrane systems, the plasma membrane and the mitochondrial membrane. The hydrogenase activity of plasma membrane during plant seed germination was determined. The purified plasma membrane of the hypocritical of V-red eta were used to explore the potential hydrogenase activity. The results showed that both hydrogen evolving and hydrogen uptake activities existed in plasma membrane vehicles. Mitochondria is another focus of our attention. During the cellular respiration, protons are pumped out and then go again into the matrix and finally produce ATP. Previous studies showed that the structure of mitochondrial compound 1 is similar to that of hydrogenase. Why the mitochondria has hydrogen metabolic activity remains unknown. The hydrogen evolution activity has been reported in higher plants during seed germination. We found that the purified mitochondria in higher plants can produce hydrogen gas. Hydrogen evolution could be inhibited by rotenol and some other mitochondrial inhibitors. Hydrogen evolving activity was also found to be closely related to mitochondrial metabolism. This evidence indicates that hydrogen evolving activity may exist in high plants mitochondria, which is closely related to metabolism. This evidence indicated that hydrogen evolving activity may exist in higher plants mitochondria. In the study of animal model, we found that hydrogen treatment had a significant impact on liver metabolism of healthy rats, and the change finally focused on mitochondria. In C6 glial cells, we found that mitochondrial membrane potential was significantly increased after hydrogen treatment, indicating that hydrogen might induce significant changes in mitochondria, which may contribute to its profound impact on cell metabolism. Brief, life originates in the hydrogen-rich environment in Earth, indicating that hydrogen is an important bioenergy material. The change between hydrogen, proton, and electron is essentially energy changes, which will affect absorption of nutrients and ionic transport, thus affecting the whole cell metabolism. Molecular hydrogen may exert its effects at the level of very basic biological process, which may be multi-targets. Its impact on life is very profound. There are still too many unknowns about the mechanism of hydrogen. I hope there will be more progress in the future. In the end, I would like to express my thanks to the research team in BGOT. That's all. Thank you for your attention.
Coming up next, Metalin Vladimir. Hydrogen inhalers, principle, design and safety features.
So fortunately we are two here because I'm not a self-chairman. First of all, I would like to thank organizers, particularly Professor Slezak, for inviting me to this very nice event. As you can see, I will talk a little bit about the principle and the problem of certification and safety features of hydrogen generators. It means the inhalers, so machines producing hydrogen for inhalation. So I am CEO of the Linked company, which we founded 7 years ago. But at the same time, I am still professor at Charles University. I'm a physicist and working in the field of development of catalysts for water electrolyzer and fuel cell. And also the company has that as a goal, so the Linket, because everybody is asking why this strange name. This is nothing with the animal, this means the thin catalysts. Catalysts with low content of precious metal. Very short introduction. So the company Linket is mainly now producing the test benches. It means the testing system for manufacturers who are testing fuel cells and electrolyzers. This is our core business. We are selling that mainly abroad. 95% is go for exportation. This system are quite sophisticated because there's a lot of electronics, sensors, and computer control, which means that with this knowledge we are able also to go for some special devices or to customize the system. Other branch of our activities is for development and manufacture of water electrolyzers, of the PEM water electrolyzers. We are making electrolyzers mainly for energetical purposes, means formation or fabrication of now very popular green hydrogen, which means hydrogen which is produced from renewable sources. And so we can scale the electrolyzers in a different way. So if it's not very well. The top, this is a small electrolyzer which is used in machine for inhalation. Below you can see electrolyzer which we are exposing here. And at the bottom, this is the bigger electrolyzer which is producing 70,000 or more than 70,000 liters of hydrogen per 24 hours, which means 55 liters per minute. Okay, we are also producing systems for education, so-called science educational kits. This one is showing how electrolyzer works. I think that this would be useful not only for schools but also for laboratories where hydrogen and hydrogen generators works, because it can be used for nice demonstration. This system has been selected by the Ministry of Foreign Trade of Czech Republic, and it will be used also as a humanitarian aid to Africa. We already delivered few kits in Benin, so this is something which also we are proud of that. And now this is the most connected to this talk is the inhaler and hydrogen water maker, which is so-called the duo effect, duo system, because it can be used, or it is used for rich water hydrogen production as well as for inhalation. This system is also exposed here. The standard volume which is produced is 300 milliliter of hydrogen per minute. I think that it would be useful to show how this machine works. You can see the scheme here, which is similar in all similar system, all hydrogen generators using for medicine. The basic parts are, this is the water tank. The water is turning through the electrolyzer. There is a small pump. And here on the anode, so the water split to hydrogen and oxygen, and hydrogen splits to proton electrons, and hydrogen is going to the cathode, and oxygen is returning back. So it means that there is this power supply, and the output, there is some water separator, because all the time, due to the permeability of the membrane, the hydrogen is wet. It contains the droplets of water which should be removed. But in our case, we use this borosilicate bottle as a water separator, which means that we are producing the hydrogen-rich water, because the hydrogen is bubbling through the bottle here. And now a little bit of more electrochemistry, how PEM electrolyzer works. So in the central part, this is the membrane. The membrane, and it's quite funny that if you check the different e-shops all the time, they are repeating that there is the DuPont membrane. which is information which costs nothing, because DuPont is chemical factory or big consortium producing different chemical systems. They are producing the PEM membranes under the name of Nafion, which are ion conductive. But there are other manufacturers. There are, for example, Fumatech from Germany and others. And also, even in Nafion, we can have the simple one, which are not very performant, or very sophisticated one. So it means that to say that there is the DuPont membrane as a proof of the quality, this information has zero value. So the membrane is coated with a catalyst. The water is going through the flow field, is split on iridium catalyst until proton. Proton are dragged through due to the power supply here. So we have the electron is going here, and we are forming hydrogen, which is going out. So this is the principle of PEM water electrolyzer. And now, of course, the problem is that if you want to sell it, we need certification. In case of these simple machines, we need two certifications. The first one is for electrical conformity with regulations, European regulations, because we have the power supply here. And so we need some testing or testing or certification authority, which is recognized by the European Commission, which can perform the test. And it is quite complex work, because at first we have to measure the emission of electric field, which the system is emitting through the network, through the electrical grid. After also we have to measure the radiated field. It means the emission of electromagnetic radiation outside, and there are some thresholds, and the system should pass both. After, the second step is the so-called immunity, because the system should be robust. It means that even if it's submitted to sparking, to discharging, to electromagnetic external field, and so on, it should be stable. And again, so it's measured, there are the limits, and the good certification authority give you the complete certificate with curves, with frequency dependence on field, and so on. And at the end, so we have the list of European norms, and the system complies with requirements which are given in this European norms. So this is for electricity. Other certification is important for this, because we have the system which is potentially explosive. We are producing hydrogen, we are producing oxygen. This is something which cannot be removed, because this is the principle. So it means that it's necessary to have the risk analysis in order to avoid or to minimize the risk of explosion. And so again, there are different steps. If we see the system, for example, like this one, so the violet is this zone, so-called zone 1, which is a part which are inside, where potentially it's possible to have a mixture of oxygen and hydrogen in case of some failure, which means that the certification authority is just giving some advices how to minimize the problem. And other zone typically is here, because at the end of the hydrogen, for example, nacelle cannula, we have the hydrogen going to air, and by principle we are producing explosive atmosphere, and depending on the volume, on the flow, and so on, the size of this zone 2 can be different. In our case, it was calculated that it's 10 centimeters, which is typical for all small inhalers, and this is something which cannot be avoided, which means that we have to put in the manual that not possible to smoke, it's forbidden to smoke, it's forbidden to work with open fire, and so on, because it is written, so the manufacturer is covered. Because if somebody is during inhalation smoking, it starts to be only his problem. And also, Depending, there are also some requirement for the size of the room, because the size of the room should be connected to ventilation. The smaller room, bigger ventilation, and so on. So this is other part of the certification. And of course also there are identification of all possible sources of explosive atmosphere. And if you satisfy of that, the manufacturer, because can just make a sticker that the system is conform to requirement, and it's possible to put the CE mark. And if we want to go to the next step is for clinical testing, so it very helpful if the system already has this standard, this CE certification. Now I would like to show one thing which probably everybody knows. That very often we have the product which are produced in China. We have very similar mark, but this is not a CE mark, this is the China export mark. And you see the difference. The difference by eye, you cannot see that on the system. And the problem is that the first one it means European technical standard, but the problem of the China export, that nothing is not connected with European standard. It means that this China export mark doesn't mean that this is the CE certificate. And we have checked in different products which we have seen, and it really very often, so you all the time, you see the mark of China export. And there is a high risk of confusion, because it's very similar, you can, why. And which means that, for example, if somebody is selling that by hoping that this is the CE, but this is the China export, it can have a problem. And the last part is very, very rapidly. What in our case of our company, our goal, or what we are targeting, is to go to clinical tests, because only in that case, the system which is manufactured in Europe can be competitive with systems which are manufactured in Asia with a big amount. And also, I think that is very important to have at least one system which is really clinically tested as a medical device. So it's very complex regulation. Mainly the basic steps, we have to determine whether the device can be used as is written by the manufacturer. We have to determine and verify the clinical benefits, which is probably the most challenging part of this clinical testing, because it should be shown that it has really positive effect, and it's and the system definitely it should be also set or shown how all potential risks are minimized, and what are the acceptable risks with regard to the specified benefits that the product is intended to achieve. Okay, so I would like to thank you for your attention. Our expertise, as you can see, it's to use our benefits, our knowledge from fuel cell and water electrolyzer manufacturing, and to transform it to production of these devices, which hopefully in 1 or 2 years would be certified as a medical device. Thank you very much.
Coming up next. Medvedev Oleg. Personalized approach to the use of external molecular hydrogen in medicine.
Dear gentlemen, ladies, gentlemen, I would like to touch the topic that is not quite often under discussion. And as a pharmacologist, I know that there are no drugs in medicine that 100% efficient. In all the drugs, you will find certain percent of non-responders. And it attracted my attention to understand what could be the factors that can decrease the effectiveness, efficiency of molecular hydrogen. So it should be important for personalized administration of hydrogen. Okay? So we know different ways of administration. We just heard about this in previous presentations in an opening lecture of Professor Otta. I would like to mention on the right side, here, with the latest technology, with swallowable capsule, investigators in Australia could measure the concentrations of hydrogen along the gastrointestinal tract. So what was shown? That when the patient or volunteer consume low-fiber diet, concentration of hydrogen not very high, like 0.5% in a column. But when the patient uses normal level of fibers, you see hydrogen concentration is much higher, and here it's shown around 1.5%. So its concentration is a column of our internal hydrogen. It exists in a large column. Okay. So I tried to find in literature the number of results of studies, clinical studies, experimental studies, where the percentage of non-responders will be mentioned. Great problem. I almost did not find. I have found only one article that was published quite recently in year 2020. And the authors in clinics use hydrogen-rich water, concentration 0.8 ppm, so it's quite effective concentration, 4 milliliters per kilogram, 3 times a day during 12 months. And they studied the rejection of stem cells in kids. So 75% were responders, and they lived much longer. 25% did not respond, and they died within 10 months. So it was a proof that for hydrogen, like for any other active substance, there are certain people who are not responding. So what are the reasons for that? How we can explain this, and what should we do in this respect? Okay? So I would like to mention another point, that for study internal hydrogen, it's well-known and well-developed method of measuring concentration of gases in expired air and breath. It's used for many years, many decades by gastroenterologists for determining, you see, SIBO. And what is important, that hydrogen and methane are produced only in a gastrointestinal tract. So when we know concentration in expired air, it's a reflection of situation
in the gut. Okay. So how we can compare now concentrations that we can reach with exogenous hydrogen and endogenous hydrogen that is produced by microbiota? I show you the results of a series of articles. This is one. It was several of those. And take a look. This blue line shows the concentration of hydrogen after drinking a glass of hydrogen-rich water. It works. It's absorbed. It goes through the liver. It goes with the venous blood to the lungs and expired. And here is concentration. So this concentration shows the mean concentration of this gas in the venous blood. Now, what happened when such persons drink a glass of milk? Not very impressive. It depends, you see, on lactose deficiency mainly. How much of lactose will reach large intestine. But when they used so-called hydrogen-producing milk, so where food fibers were added in such milk, we saw a huge increase in hydrogen is much higher than and much longer. So if we will calculate the quantity, amount, you see this is the total amount that we can get from the glass of hydrogen from water. And here is the amount that, that was generated in our large intestine. So that's why it's very important to understand what is the relationship between internal hydrogen and external hydrogen. We think we need to think about this, and it was the reason why we performed several. You see, it doesn't move. Can you? Yeah. So, what is important now? For producing hydrogen, the most important thing is consumption of complex carbohydrate, mainly food fibers. Why? Because they are not hydrolyzed in a small intestine. They reach large intestine where microbiota is and where fermentation produces hydrogen together with well-known short-chain fatty acids that are active, that are good, that keep our barriers, and so on, a lot of nice things. So now what happened with this hydrogen that is produced? Some of it goes through the liver, so it's absorbed into the blood, to the portal vein, and excreted through the breath. So its portion we can measure. But in large intestine itself, there are stealers, there are consumers of this hydrogen. And the most important of them, methanogens. And during methanogenesis that produced by archaea, they are not bacteria, they are another group of microorganisms. But for each molecule of methane, they consume 4 molecules of hydrogen. So when we measure methane in expired air, it means that a lot of hydrogen were initially produced, but some of them were consumed by methanogens. Okay? So that's why it's crucially important to understand how much of hydrogen in expired air in breath and how much of methane. Because in this case, we can calculate what was the original volume or quantity of hydrogen that was produced originally. Okay? So this, I underline this equation. So how the methane is produced? Here picture what is happening in microbiota. And we see that hydrogen is produced for creation methane with 3-methylamine. It's produced from hydrogen and CO2 by archaea called Mentanobrevibacter smithii. And this is the main component producing methane in humans. So this is the most important part. And also there are additional parts, but this is the most important part. So this microorganism consumes hydrogen and produces methane. Okay. So what are the latest information about quantities or concentration of gases that are produced in our intestine? So the latest meta-analysis published in 2021 shows the composition of colonic gases in healthy human participants. Okay? So H2, number of participants where we can measure hydrogen is just 40%. Not so much. But almost 60%, they produce hydrogen and methane. What are the concentrations? The mean values maybe not very impressive. Yeah, almost 3% of hydrogen. But I remind you, we hear during this meeting concentrations of 2% during inspiration produce a lot of things, good things. We trust in this, it's fine. But internally, in average, we have higher in intestine that also absorbed into the blood and produce the same effects because hydrogen from internal sources and hydrogen from external sources are the same molecule, H2. Okay? What is even more important, that methane is produced in 2/3 of patients or humans. Mean concentration is very high, 14%. And that means that a lot of hydrogen were produced before to give this amount of methane. A lot of hydrogen were stealed by this microorganism. Okay? But what is also important, that concentration of hydrogen changes in a very wide ranges. You see, it could be up to 86%. So, up to 90% of all the gases in intestine could be hydrogen in some patients. I have a personal friend with whom we are working in this project. And this special guy, when we measure with gas chromatography, constantly shows more than 100 ppm of hydrogen. A lot, a lot. I have 5 ppm and he has more than 100. So we're very much different. So, and you see the range of changes are very high. That's why up to now, we don't have normal, so-called normal values for hydrogen because we are so different. It's not like to determine concentration of glucose or you say any other biomarker. With hydrogen, it does not work. We are too different and it shows here. So let us try to understand how we can check it and what could be done and to whom we should administer exogenous hydrogen. Okay? So these are results from a very good gastroenterology lab in Los Angeles. It's a group of Professor Michael Pimentel. It's the ranked second gastroenterology department in the United States. And they showed that when they analyze effects of lactulose. It's a substance that goes to the large intestine, fermentized, and produces gases, yeah? So in some people, there are 3 groups of people, and they have a lot of data. They collected this during several years. After administration of lactulose, and that's typical standard test in gastroenterology, you see we have increase only in hydrogen. Fine. But another group, we can determine only methane. Methane is rising, hydrogen is not rising. How we can understand this? Our explanation is the following, that in these people, so many of methanogens that they consume all the hydrogen that is produced. So it's produced, but all of it produced was consumed by microbiome. That's why we can measure only methane. And final group, they don't produce hydrogen, they don't produce methane, and of course this is the best group for administering exogenous hydrogen. Hydrogen-rich water, inhalation, and so on. What to do with this group? So we tried to investigate this, and we have developed quite elegant, to my mind, system where in awake rats we can separate expired breathed air from this chamber, but we don't use the flatus, okay? Because in humans we have to separate this. In flatus, concentration of hydrogen in percentage, and in breath it's ppm. So that it's different in millions. It's completely different levels. So, and we used very good chromatography from gas chromatograph from Japan. Unfortunately, Professor Maminoda is not here. She is on a program. And I would like to mention that we are grateful to her because she helped us to contact this Japanese company. They unfortunately don't speak English and so on. A lot of problems, but finally we got it. We got it, we use it, and it's fantastic. We need 1 milliliter of air, and we measure all these substances. Fine. What we did later, the first series of experiments, we had 5 groups of rats, 10 rats each. And the idea was, let us try to stimulate the production of hydrogen. In this case, we used fructooligosaccharides in different concentration, 5% of calories and 25% of calories. So our idea was to stimulate production of hydrogen. And 2 other groups with antibiotics, we wanted to decrease production because it's inhibition of microbiota. So, and we measured the release of hydrogen and methane. What we got? In all the 5 groups, we got such correlations that the higher concentration of methane, the lower concentration of hydrogen. So when methane exists, this microorganism consumes hydrogen. We are getting less hydrogen in all the, and it's a summation of all the previous results. You see that it's a quite high correlation, positive, negative correlation. The higher concentration of methane, the lower concentration of hydrogen. So we did another series of experiments. And the idea was, let us try to use different food fibers, because we know from literature that different food fibers produce different effects. And we were lucky to find nurseries for rats. One group of rats had a high hydrogen production, and another group of rats had high methane production, and the difference is like tenfold. So, two producers, we got these rats, and they're a real getty model of the situation in humans, like it was shown by Professor Pimentel in Los Angeles. So we have a model of patients in Los Angeles, but in the laboratory at Moscow State University with rats, exactly the same. What happens? You see group of low methane producers. We administer lactose, hydrogen rise up, goes up, methane a little bit. We use different types inulin and another food fibers. Situation really is the same. In animals who are high methane producers, we're getting increased to the same substances, the same alive rats, fantastic, good rats, but they are models, already models. We see the increase of only methane. We didn't observe any rise in concentration of hydrogen. So again, we can explain only in one way, that internal number of this microorganism consumers of hydrogen is so high that when we stimulate production of hydrogen, they take all the hydrogen and produce methane. Okay? And you see these correlations in low methane producing rats really does not exist. So where, when it's low, additional initial concentration of methane, it will not increase during stimulation. But in high methane producing rats, we see high correlation. So the higher methane, when we add fermentable food, methane will be higher. Okay. And finally, this article was published this year. These studies again in Mark Pimentel lab in Los Angeles, they showed that they could measure methanobrevesmisi load, so the number of this microorganism is positively associated with a single exhaled fasting methane level. So the higher the initial methane level, it's enough one measurement in fasting state. In this case, okay, yeah, I'm finishing. So final two slides. The key issue for personalized medicine is finding the criteria for early identification of patients who can be responders and non-responders to each therapy that apply to hydrogen as well. And our working hypothesis is that we hypothesize that exogenous H2 will be high in the organism with lower level of endogenous hydrogen, with a lower antioxidant defense. What is important, that we assume that screening of the subject on a level of methane production will improve the efficacy of administration of exogenous hydrogen. And single measurements of methane level in breath in fasting condition is enough for recognizing high producers of methane. So these two groups will be a focus for administering hydrogen. And we expect that efficacy of hydrogen will be much higher because the internal level is very low. When it's high, it's more than we can add from outside. And this is our group of young scientists who did most, and we work at Moscow State University. And we are ready for cooperation, and we'll be happy if we will find in this meeting, in this conference, new partners to continue to work in this area. Thank you very much.
Coming up next, Nazarov Eugenie. Experience in the use of molecular hydrogen and a mixture of hydrogen nitric oxide in heart surgery under conditions of artificial blood circulation.
Dear members of organizing committee, thank you very much for opportunity to make report in this wonderful congress. The topic of my presentation, my report is experience in the use of molecular hydrogen and a mixture of hydrogen and nitric oxide in heart surgery under condition of artificial blood circulation. This work is development of our research cycle of use the medical gases in surgical treatment of acquired valvular defect using the cardiopulmonary bypass. In the first part of this research, which I presented in Bratislava 2019, it was shown that molecular hydrogen using in artificial lung ventilation apparatus has a cardioprotective effect, which expressed in 20% increase in the value of ejection fraction of the left ventricle of heart. A twofold increase the probability of self-restoration of the heartbeat after connection the operated heart to the circulatory system. Decrease markers of lipid oxidation and blood plasma DIN, triene conjugated and shift bases. Significant increase 2-3 DFG in the postoperative period, which is sign of anti-hypoxic effect or hydrogen on endosome. The purpose of the second stage of work was to study the possibility to joint use of the medical gases in operation of this profile. At the second stage, a mixture of nitric oxide and hydrogen was used. Nitric oxide is already used in cardiosurgery as a vasodilatation factor. There is also some scientific evidence of cardioprotective effect of nitric oxide. However, the nitric oxide is very toxic substance, and toxic also due to the formation of peroxynitride. The peroxynitride radical is destroyed by hydrogen. It is a well-known fact. Thus, the purpose of this second stage was the study possibility to use hydrogen as an antidote to nitric oxide. We must believe that it is easily reach result, because hydrogen can eat this toxic substance. The study involved the 88 patients suffering from NYHA class 3-4 heart failure and receiving surgical treatment in the form of correction of acquired heart valve defect. patients was divided into 3 groups: control, nitric oxide group, and nitric oxide plus hydrogen group. The parameters of the gas mixture used in this experiment are shown on the slide. Boson Konica, device boson, this Konica Medical Engineering Odessa and Tanox Medical Department of Nuclear Center of Sarov. Devices were used as source of hydrogen and nitric oxide. Both devices are autonomous in terms of gas sources. The source of hydrogen is distilled water, and the source of nitrogen for nitric oxide synthesis is air. The cardioprotective effect of medical gases was assessed by the plasma level of the cardiospecific protein troponin A. Normally, only traces of this normally only traces of this substance exist in the blood. But after a perfusion of operated heart, the level of troponin rises sharply. And nitric oxide has a pronounced protective effect on the myocardium, and also effect of enhancing the by hydrogen. The cardioprotective effect of nitric oxide and hydrogen mixture is especially evident in the time of completion of the operation. It can be seen from the slide that the most important parameter of the work of heart, the volume of blood injection from the left ventricle during contraction return to the normal level. This is very important. It's the main tools for estimated actions, some substance to the myocardium. They illustrate the protection action. I present the data for illustrated for the antioxidant action nitric oxide and hydrogen. As well the data of the reduction of erythrocyte aggregation by the medical gases at the different stage of the operation. So we can do conclusion that the use of molecular hydrogen has a synergetic effect of nitric oxide during the cardio operation. It had an adjuvant cardioprotective effect through limitation of activation of lipid peroxide process and reduced erythrocyte aggregation. In additional protective effect of the substances on the myocard was manifested by maintaining stable value of myocardial contractility, significant decrease of content of troponin, and in the post-operative period, and improving the clinical outcomes of the operation. In conclusion, I would like to reveal a little about the place of hydrogen in the family of medical gases. This interesting questions because we have ozone therapy, hydrogen therapy, xenon therapy, carbon oxide therapy. There are many kinds of using of medical gases in the modern medicine. But we must remember that it is family, all these substances family of medical gases. And we must understand which place of hydrogen in this family. I will try to explain it, what I mean in my point of view. Medical gases include nitric oxide, carbon oxide, carbon dioxide, hydrogen, hydrogen sulfate, ozone, xenon, and other inert gases. Medical gases, regardless of their chemical properties, have related spectrum of therapeutic activity. It is very strange from pharmacological point of view. For example, on slide shows the therapeutical spectrum of 3 medical gases: oxidizer, ozone, reducer, hydrogen, and inert gas, xenon. As can be seen, this spectrum is same. Strange. Another property of medical gases, with the exception of hydrogen, is pronounced toxicity. Xenon. Xenon also toxicity substance because xenon reversibly disrupt a nervous homeostasis. The therapeutic property of toxic medical gases like ozone or xenon are satisfactorily explained by the conditional reflex homologous hypothesis. In a nutshell, the essence of this hypothesis is that toxic gases have not own therapeutic effect and are toxic at any dosage. The therapeutic effect of these gases appear as the mirror protective reaction of the toxic effect. This reaction is essentially unconditional homeostatic reflex. Unconditional homeostatic reflex. Congenital homeostatic reflex. And if we call this unconditional reflex periodically, it can be tuned to the conditional homeostatic reflex and cause long-term remission of disease. Here is an example how ozone therapeutic effect appear as a result of protective reaction of its toxic property. So we see on toxic property and we can predict which therapeutic reaction will appear because it is very tightly linked properties. Another slide shows how the therapeutic effect of xenon is formed from the toxic profile of it. The hypothesis of homologosis is detailed in my poster presentation. I invite you to get acquaintance with it during the poster session. This hypothesis is based on the special rule of neuroendocrine system in the mechanism of action of medical gases. The HRV test is a good indicator of influence of the all substance on the autonomic system. Do you know this cardiointervallogram? So we measure 500 cardio pulse and measure time between one pulse and another pulse and provided spectrum analysis, free analysis of this curve and receive. There are many characteristics of hormonal influence and influence of parasympathetic system and sympathetic system on the heart. It can be seen in the slide. The nasal inhalation of hydrogen with high dose, high flow rate of hydrogen, 1 LPM, 30 minutes. For 2 days causes inhibition of heart rate regulation by the autonomic nervous system registered by HRV. This effect can be overcome by the work of homeostatic system, but the cost of this overcoming is twofold increase the stress index of heart, working of heart. That is a toxic effect. Thus, hydrogen, it is should be for any physiological active substance has a range of overdosing, in which it can exhibit mild toxic property. I must say that from my point of view, the negative effect of hydrogen in the case of overdose is regenerative stress. Regenerative stress is very often happen if we use antioxidant in overdose regime. My worrying about the hydrogen overdose apply only the inhalation method of use. In case increase the percentage of hydrogen above 2% in hydrogen air mixture. Okay, overdose with drinking water or infusion of saline is not possible because the amount of hydrogen dissolved in water is very small. In general, it is last prompt. In general, we believe that the hydrogen is a legitimate member of family of toxic medical gases, ranking last in the toxicity series. Thank you very much.
Thank you.
Coming up next. Noda Mami. Modulation of endocrine system by hydrogen gas.
Dear friends and colleagues, I'm very sorry not to be able to attend the conference on site. Before my presentation, I'd like to pass the message from Dr. INTRAOSSEOUS, the president of the Japanese Biomedical Society for Molecular Hydrogen. His message is wishing you a heartfelt congratulations on your launching of the European Academy for Molecular Hydrogen Research in Biomedicine and organizing the first conference. I wish you all the best in your research progress and health from Japan and look forward to meeting you all in the near future. A bit more information of the Japanese Biomedical Society for Molecular Hydrogen, JBSMH. We are an academic organization that brings together researchers and students from many institutes, universities, and companies in Japan. We promote advancement of research in all branches of medical and biological research on molecular hydrogen and encourage the interchange of information. We contribute to society through the pursuit of learning and research on molecular hydrogen. We organize an annual conference each summer. This summer it was the 11th meeting and approximately 30 presentations were given. Again, we hope we will see each other in the near future. Now I'd like to talk about modulation of endocrine system by hydrogen gas. Since the co-author is from Ukraine, having a difficult time, I put the color of Ukraine on my slides. My talk consists of 3 topics. The first topic is about medical gases, especially ozone, xenon, and hydrogen. There are many medical gases which are used for therapy, starting from nitric oxides and oxygen. The research on their working mechanisms got the Nobel Prize in Physiology or Medicine in 1998 and 2019. There are even noble gases such as xenon, krypton, argon, and helium. I'd like to discuss three gases, ozone, xenon, and molecular hydrogen, which represents three types of substances: typical oxidizing, inert, and weak reducing agents. These three medical gases can manipulate the neuroendocrine system. With the repeated administration of the gases over time, these modulations become a predictable consequence of conditioned homeostatic reflexes, resulting in regulation of physiological activity. Interestingly, high and low dose of these medical gases have opposite effects. High concentration of these gases show signs of oxidative reductive stress, and low concentrations of these gases show remarkable therapeutic effects. We reported that seemingly different medical gases have a common effect in the paper shown here. This table shows the spectrum of physiological activity of xenon, ozone, and molecular hydrogen. Although they seem to be quite different to each other, they have remarkable therapeutic effects except the question mark parts. As the reason of these common features, I like to focus about these medical gases and the endocrine system as the second topic. We propose the maintenance of homeostasis by these medical gases. As you know, homeostasis is the property of a system within an animal in which a variable, such as the concentration of substance in solution, is actively regulated to remain very nearly constant. And it is very important for health maintenance and disease treatment. To maintain the homeostasis, there are three important systems: autonomic nervous system, endocrine system, immune system. Among them, we are focusing on endocrine system in this presentation. There are three hypothalamic pituitary axes. One is HPA axis, mainly regulates body's reactions to stress, controlling the final chemical of HPA axis, cortisol. There is also hypothalamic pituitary thyroid axis, responsible for regulation of metabolism and adaptations to stress by regulating the level of thyroid hormone. The third one is hypothalamic pituitary gonadal axis, which mainly regulates reproductive and immune system. If we focus on hydrogen and HPA axis, there is a paper shown here, increasing the resilience to stress in mice. Repeated inhalation of mixed hydrogen-oxygen gas significantly decreased both the acute and chronic stress-induced depressive and anxiety-like behaviors of mice by blocking the stress-induced increase in the serum levels of corticosterone, adrenocorticotropic hormone, interleukin-6, and tumor necrosis factor alpha. Another example has published recently. In this work, rats were treated with hydrogen water or 4% hydrogen gas for 2 hours every day for 6 months. And then gene and metabolite analysis in liver and serum were performed. As the systemic effects, significant decrease in body weights and visceral fat were observed. The noticeable effect for us is the increase in plasma noradrenaline, which enhances lipolysis. From the previous work, we can say that hydrogen inhalation is more effective for HPA axis control, for suppression of stress hormone, and for increase in fat metabolism hormone, by stimulating sympathetic nerve. On the other hand, drinking hydrogen water causes 6 different cognitive benefits in Alzheimer's disease model mice. Due to the attenuation of the decline in estrogen receptor, and brain-derived neurotrophic factor levels in female Alzheimer's disease model mice, more amelioration of the brain oxidative stress and inflammatory responses were observed, consequently leading to less cognitive dysfunction in female. Hydrogen also induces gastrointestinal hormone. Drinking hydrogen water induces brain-gut connection, or I would say stomach-brain connection. We published that drinking hydrogen water induced neuroprotective ghrelin secretion in mice. Drinking hydrogen water induces ghrelin secretion from the stomach. Ghrelin is known as an appetite-stimulating hormone, but it is one of the growth hormone-like peptides and have neuroprotective effect, especially for dopaminergic neurons. The receptor for ghrelin, GHSR, is robustly found in substantia nigra pars compacta. Both mRNA level and plasma ghrelin levels increased after hydrogen water drinking for more than 4 days. Since hydrogen does not reach to the brain by drinking hydrogen water, it seems that hydrogen in drinking water acts indirectly for neuroprotection. Therefore, it is reasonable to consider that ghrelin is a messenger of hydrogen water-induced neuroprotection, though it is limited to a Parkinson's disease model so far, and there seem to be other ghrelin-like hormones as well. On the third topic, on how do medical gases regulate endocrine system, to be honest, we have only hypotheses at this moment. For example, conditioned homeostatic reflex, or so-called homologosis. This illustrates the systemic therapeutic effects of medical gases and the effects of hormones that are activated by the action of medical gases. For more information, please take a look at the poster number 10 by Professor Nazarov. Thank you for your attention, and I really hope the end of the war in Ukraine as soon as possible.
Coming up next, Ota Shigeo. Development of hydrogen medicine and its mission for the future.
Hi, good afternoon, everyone. At first, I appreciate Professor Slezak and Dr. Grant for this organization. Thank you very much. And I'm very honored to be here as a pioneer of hydrogen medicine. I want to talk on the initiation and development of hydrogen medicine. And I want to emphasize the mission of hydrogen medicine for the future, especially for aging society. At first, I would like to introduce my background. My background is mitochondrial medicine. Mitochondria produce energy, and at the same time, mitochondria produce reactive oxygen species, which damage our body and lead to various kinds of disease and accelerate the aging process. So we are thinking that how to organize production of reactive oxygen species. Mitochondria release electron under the condition of producing ATP. And the leaked electron combined to oxygen and convert to superoxide. And superoxide convert to hydrogen peroxide and then hydroxylogical. We have a protection system for loss, but if the loss is increased, this oxidize lipid and protein and the DNA, leading for the mutations. But the story is not so simple because some loss are physiologically important and give us several benefits. For example, superoxide and the hydrogen peroxide function as regulators for cellular signaling. So, and we found that hydrogen react only hydroxylogical and nitrous peroxide, but did not superoxide and H2O2 and NO, suggesting no adverse effect. This picture shows original data, and one dot means one single cells in culture. And we can visualize each specific reactor species by using the specific fluorescence dye. When we look at the superoxide and NO and H2O2, the signal was not changed even in the presence of hydrogen. But in the presence of hydrogen, the signal for hydroxylogical was decreased. And also, hydrogen protects the cells against the damage by superoxide. In this case, hydroxylogical was produced in phantom reaction in the cell. And the red color means a dead cell, and green indicate the living cells. So in the absence of hydrogen, the upper the panels, most cells were dead. But in the presence of hydrogen, most cells are alive. We are very surprised to see the results. And then we published a paper as Professor Slezak introduced, and it was 2007 May. And I mentioned hydrogen in this talk. This means molecular hydrogen and H2 or hydrogen gas. Hydrogen can be dissolved into water up to 0.8 millimolar. And this means 18 milliliter per liter under 1 atom. Over 15 years, 2,000 articles have been published. And there are several methods to ingest hydrogen. The simplest method is the inhalation of hydrogen gas. And the most benefit method is drinking hydrogen water and supplement to generate hydrogen in stomach. And we can inject or eye drop H2 saline. And the alternate method, we can transfer hydrogen through the skin from H2 bath or H2 cosmetics. Or in addition, hydrogen was produced by intestinal bacteria. And when we see the gas chromatography, we can detect the incorporation of inhaled hydrogen gas in blood. And A means artery blood, V means venous blood. And we can see the hydrogen concentration dependent increase, and also we can see the difference between artery and venous blood. This means the difference maybe contribute to our body. And also we can detect the hydrogen and by oral administration, and we can monitor the hydrogen concentration by using the system. We are sorry for that. And we can detect the hydrogen in the liver, maintain 40 minutes or so. And recently, Professor Sano's group used a pig. This is very expensive, and they can examine the hydrogen concentration in blood in the general vein and the portal vein and the internal carotid. And we can see that the hydrogen can be maintained for 1 hour for considerable concentration. We know that 2% of the hydrogen gas is best. And also, during 4 hours, 40 minutes or to 1 hour, and hydrogen maintained about 2% in the liver. So subsequently, a lot of people studied the hydrogen medicine. It turned out hydrogen function as antioxidant, but have a lot of function, multiple functions: anti-inflammation, anti-allergy, and hydrogen stimulates energy metabolism, and also function as anti-cell death, and also regulate autophagy and regulate microRNA. So there are huge role of hydrogen. So I did not expect such an expansion due to the lot of scientists in the world. And then we know that molecular hydrogen has a strong potential for a wide range of fields, from healthy people to patients with serious disease. So hydrogen potential for the therapy or treatment for serious disease, and hydrogen may function as a prevention, and hydrogen protect radiation and mental care and health care, sports exercise and beauty, and also agriculture, because plants are living cells, and also animal is constituted of living cells. So there are so many fields. And I want to talk on especially the mission of hydrogen medicine to overcome serious issues in the future. Post-cardiac arrest and advanced cancer, metabolic syndrome, dementia, and infection and cytokine storm. In this case, we are interested in the COVID-19 infection. At first, I want to talk on inhalation of hydrogen gas for ischemic reperfusion injury, because ischemic reperfusion injury induces a strong oxidative stress. This includes cerebral infarction, myocardial infarction, and post-cardiac arrest. And when we see the hepatic ischemic reperfusion, and damage was improved depending on the hydrogen concentration. And I think 2% of hydrogen gas is best. And it is important to emphasize that there is no effect by helium. So this means small molecule is not effective, but only hydrogen is effective. And also, we want to emphasize that This can be performed under the one atom. We need not special apparatus for treat with a higher pressure of hydrogen gas. And this is the first experiment for the application of hydrogen gas. And after the cerebral infarction, after 1 day, we can see the effect of hydrogen. And we can see the serious, clear result. White region is dead cells, and the red region is composed of living cells. So we can see the clear result. And also after 1 day, and neurological score was improved, and body temperature was improved, and the body was recovered. And also we confirmed that reduced the regions of oxidative markers. We confirmed the level of oxidative markers was reduced, and the microglia was reduced as an injury marker. And then afterwards, we performed the randomized clinical studies. It was published in 2017. It takes 10 hours. And we can see the clear result in MRI and efficient rehabilitation and neurological improvement. And this was performed in Nishijima Hospital, and the patient scale is 20 patients, and 20 patients without hydrogen, totally 50. And then we are moving to effect on resuscitation in post-cardiac arrest. It is important to reintegrate into the society of the patient. And this was performed animal experiment. If you see the animal illustration, this is an animal experiment. And if you see the illustration of a doctor, that is a clinical study. We can distinguish by the illustration. And after the post-cardiac arrest, if the rat inhaled hydrogen gas, we can see the clear difference in this picture. And also survival rate was improved. And the control, so only 31% is alive, and the hydrogen group, so 69% of animal can be alive. And this is nearly the same improvement with low temperature treatment, hypothermal treatment. And also, it is important, and the hydrogen can protect the brain, and we can see the we can see the clear improvement in motor activity and memory activity. We can examine the memory ability. And also, we can see the decrease in pro-inflammation cytokine. And then this treatment was approved by Japanese government in 2016, November. And the result by a multi-centers randomized double-blind placebo-controlled clinical trial will be open this year, maybe at the end of this year in United States. And we are moving to the effect on metabolic syndrome. And we use DBDB mouse, mutant mouse, which cannot be regulate their appetite and overeat, and induce diabetes and overweight. And we can see the result in fat, internal fat. This blue region is internal fat, green is subcutaneous fat. And we can see the decrease of fat area measured by CT scan. And that is important. Control and hydrogen mice are the same amount of diet and drank the same volume of water. In addition, it is important that control and hydrogen mice behaved with the same motor activity. So hydrogen can stimulate the energy metabolism. And hydrogen decreases body fat, glucose, insulin, triglyceride, and increase FGF21. FGF21 is an energy metabolism regulatory hormone released for the liver and the muscle. And we can see the decrease in fatty liver. And for the clinical study, this was performed a Japanese company, and first author, Nakasone, belonged to the company. And this is important, that is, they focus on the oxidative stress enhanced group. They separate two groups with a higher oxidative stress group and lower group. In the higher oxidative stress group, hydrogen water decrease DMI and waist size and hip size and hip sarcasmus and waist sarcasmus and the total fat area. This was performed by randomized clinical study. And then we are moving to our brain and aging. And I think that it is difficult to cure or treatment of the aged disease because these were caused by multiple factors. But hydrogen has multiple functions: antioxidation, anti-inflammation, and anti-cell death, and stimulate the energy decline. So up to now, most people use single effective medicine. And so it is difficult to overcome the dementia or the age disorders. For the animal experiment, we stressed by restaurant stress, pushing the mouse in the small gauge for 10 hours per day and continue 6 days per week, and for finally 6 weeks. We are sorry for the animals. And we can see, and the long-term restraint is known to enhance oxidative stress in the brain and lead to memory impairment in the previous experiment. And we found the hydrogen water group and improve the memory ability. Additionally, this is one method, but additionally these results were confirmed by the different two methods, water maze and the passive avoidance test. So we could confirm the improvement in the memory decline. And also, hydrogen water stimulates adult neurogenesis impaired by restraint. Impaired and adult neurogenesis is one of the causes of depression. So, and we made a dementia model by using the ALDH2 deficient mouse. And we can see the improvement in memory ability. And also we can see the protection against the decline of the by the neurodegeneration. We can see the difference in the number of the living neuron, C and D. We can see the clear result. And it is very important. And we performed from 8-month-old mouse. This means adult. Even after the adult, hydrogen water, providing hydrogen water is effective for the memory impairment. And then clinical study. This was performed collaborated with Tsukuba University, Asada's group. And in this case, we focus on the ApoE4 group, sub-analysis. ApoE4 genotype increase oxidative stress. And then we can see the improvement of hydrogen for the memory decrease. And we see the red one, it's a placebo, and blue indicate the hydrogen group. And this, we can see the improvement by 3 points. And if we compare with our medicine for release of a symptom, and in this case, about 1 year, 2 years, and effect was nearly and disappeared. So, and then we performed, in this case, in this case, it's not Alzheimer's disease, but pre-dementia conditions, MCI, mild cognitive impairment. This is a preclinical study, but they are going to decline their memory ability. In this case, this is a severe patient with Alzheimer's disease. They continue to inhale the hydrogen gas for 2 years. And they improved in fecal incontinence. And this is a serious symptom for Alzheimer's disease. And at the same time, we can evaluate the activity of neuron using diffusion tensor imaging. Diffusion tensor imaging is, in the case of active neuron, water within the neuron moves along the neuron bundle. So we can estimate the direction of movement of water. We can estimate the neuron activity. And then, after 2 years, we can visualize the improvement of the active neuron. That way. So, and then I want to emphasize here, and it was open question because you may know that there are serious discrepancy between the chemical reaction and living cells. Because reaction constant with the hydrogen radical is very low in aqueous solution. But we can see the clear result in decrease of hydrogen radical. Why? We don't know why. For 15 years. But recently, Professor, his group discovered the hydrogen target molecule, hemagin, kind of the hemine. And it was reacted with hydrogen and convert to hydrogen radical to water. And then at the same time, CO2 convert to CO. And the CO is known as a signal transduction effectors. So we can understand why the hydrogen is so effective in the living cells. Even the aqueous solution is hydrogen reaction is very slow. This is a breakthrough discovery. So I'm very pity. I'm very pity. It is pity that I couldn't meet Professor He. I want to say congratulations. If he is listening to this lecture, I would say congratulations for your breakthrough discovery. And finally, I want to talk on molecular mechanism. So antioxidation and signal transduction is not a separate phenomenon. I think the antioxidation linked with various kinds of signal transduction. For example, in this case, energy metabolism stimulation, anti-inflammation. We want to know how to replace the expression inflammatory cytokines and how to activate the energy metabolism. And this is hydroxylradical react with unsaturated fatty acid to lead the free radical chain reaction to accumulate lipid peroxide. When we can detect the lipid peroxide by using the fluorescence dye. And this shows only 1.3% hydrogen gas suppresses the accumulation of lipid peroxide. As you say previously, 2% is optimum conditions. And we know that 1.3% is also effective in clinical study and animal experiment. So under the culture cells, also hydrogen function even if 1.3% hydrogen to inhibit the accumulation of lipid peroxide. And at the same time, we know the hydrogen suppress the calcium signaling decrease. And also, hydrogen suppress the translocation of NFAT, which is a transcriptional factor, into the nucleus and CZ. And lower panel, yellow was decreased, but this is not decreased, but distributed widely. So we finally we want to conclude that in the absence of hydrogen, OX-PAPC function as a mediator for calcium signal transduction, but OX-PAPC modified by hydrogen inhibit the calcium signaling, result in the decrease of these cytokines. And so when we change the gene, see the change in gene expression, we can see the transfaction, transcribed by NFAT or the calcium signaling involved transcriptional factor. And finally, I want to explain how to stimulate the energy production. And the end product of lipid peroxide is 4-hydrogen non-NR. Hydrogen non-NR function as a signal mediator. So hydrogen suppresses the formation of 4-hydrogen non-NR and converted signal transduction to kinase and FOXO1 and increase the PGC1 alpha and then increase the FGF21 and at the same time this hydrogen increases several enzymes involved in fatty acid metabolism. So this is a scheme of this one. And also, we insert the hemagene in the slide. So the hydrogen convert the polyunsaturated fatty acid in the presence of hemagene, and also calcium CO signaling. There are huge open questions. So I want to, in future, I want to overcome the serious issues in the aging society. And there are several outstanding advantages of hydrogen. In most, hydrogen works in most organs with multiple functions with no adverse effect with good efficiency. So now we are expanding the hydrogen society, including energy, health, and foods. This is a major contribution. Thank you very much for attention.
Coming up next, Pekhanova Olga. Nitric oxide, from the beneficial effects of the solo molecule to combination therapy with molecular hydrogen.
Ladies and gentlemen, dear colleagues and friends, today I would like to speak about some beneficial effects of nitric oxide molecule, and at the end I would like to mention some connection of nitric oxide and molecular hydrogen in the condition of metabolic syndrome. I believe that everybody of us are quite familiar of nitric oxide molecule. Of course, this is the gaseous molecule with 1 ampere electron. That means that nitric oxide is free radical, which very short lifetime, less than 3 seconds. Nevertheless, nitric oxide is a very important signaling molecule in different physiological and pathophysiological conditions within cardiovascular system, central nervous system, in locomotion, immunology, and different other processes. Nitric oxide is produced with different nitric oxide synthase isoforms. Probably the most important concerning cardiovascular system and metabolic diseases, endothelial nitric oxide synthase is the most important. Nitric oxide synthesis consists of 2 subunits which share reductase and oxidase domains, and zinc which stabilize the subunit of nitric oxide synthase molecule. Probably this picture of nitric oxide synthase is more attractive than the previous one. During the conditions with metabolic syndrome, there is the increased production of free fatty acids, which may activate the ceramides, lead to increased production of ceramides in the cells. Ceramides thereafter activate NADPH oxidase, which produces more amount of superoxide anion, which may lead to increased activity of nuclear factor kappa B, and thereafter the subunits of nuclear factor kappa B penetrate to the nuclei and activate several pro-inflammatory genes, including inducible nitric oxide synthase. Ceramides may also inhibit ACT, which lead to decreased phosphorylation of endothelial nitric oxide synthase, and then production of nitric oxide decrease. This may even worsen the conditions of metabolic syndrome. What we know from our previous experiments is the fact that the successful treatment with metabolic syndrome is always accompanied by increased activity of endothelial nitric oxide synthase. For our study, we use different models of metabolic syndrome, including Sukkerets and also obese Koletsky rats and different others. And among the golden standard of treatment of metabolic syndrome, obesity and other aspects of metabolic syndrome, statins actually are 3-hydroxy-3-methylglutaryl coenzyme A reductase inhibitors and belong among a class of lipid-lowering medications that reduce illness and mortality in those who are at high risk of cardiovascular diseases. Of course, statins have different side effects, among which the most important is muscle weakness. In our experiment, we use simvastatin, which was loaded to polymeric nanoparticles, and to prevent the muscle weakness, we use also the combination of simvastatin with coenzyme Q. As you can see there, the treatment of obese, spontaneously hypertensive rats led to decrease level in triglycerides after the treatment with simvastatin and also with combination, and also to decrease level on low density lipoprotein. This decrease in triglyceride and LDL was accompanied by increased level of nitric oxide synthase activity in the aorta. You can see there the treatment with simvastatin and also with combination with coenzyme Q increase the activity of nitric oxide synthase. Moreover, it increased also the expression of endothelial nitric oxide synthase after treatment with both simvastatin and the combination. So, this successful treatment and lipid lowering was accompanied with increased nitric oxide synthase activity. However, among the patients, there are many who do not tolerate statin in any dose, and in this condition, some natural products which are rich in different polyphenolic compounds may be used. In our experimental studies, we have used cornelian cherry and Lonicera caurelea. Concerning cornelian cherry, we use two types, Corallovi marca and Val type. Both are very rich in total polyphenols and especially anthocyanidins. You can see there that treatment with Corallovi marca and also Val type led to decrease level in cholesterol. You can see there after treatment with Val type, and after treatment with Corallovi marca, the LDL was decreased as well, as you can see there. This treatment at the same time caused the increase in nitric oxide synthase activity, not in the heart, but in the aorta. This increase was really significant after the treatment by both cornelian cherries. Then we would like to know also the mechanism how endothelial nitric oxide synthase may be increased. As you can see in this first picture, after the treatment with Corallovi marca, we were able to see the increase in endothelial nitric oxide synthase isophore, which may be behind the increased nitric oxide synthase activity. However, concerning Val type, we were not able to see the increase in endothelial nitric oxide synthase expression. Val type, however, increased expression of superoxide dismutase and decrease expression of NADPH oxidase. That means that decrease production of free radical is the result of the treatment with biotype. And concerning these results, we concluded that different mechanisms are responsible for the increase in nitric oxide synthase activity. And last but not least, Lonicera caerulea, the treatment of this natural product also led to decrease in total cholesterol and decrease in low-density lipoprotein. At the same time, nitric oxide synthase activity was increased in the aorta. We didn't see the increased expression of endothelial nitric oxide synthase. However, treatment with Lonicera decrease expression of NADPH oxidase and also nuclear factor kappa B in the aorta. So it decreases also pro-inflammatory factor. So to conclude, the successful treatment, as I said, is always accompanied with increased nitric oxide synthase activity. And from the literature, we know that treatment with molecular hydrogen may lead to decreased production of free fatty acid and then to decrease accumulation of ceramides in the cells, and then NADPH oxidase is not activated. That leads to decreased production of reactive oxygen species. But when reactive oxygen species are already produced, molecular hydrogen may act as a scavenger and also inhibit the ceramide, and then endothelial nitric oxide synthase may properly produce nitric oxide and physiological conditions may be stated. So the treatment of molecular hydrogen during the conditions of metabolic syndrome may be really very beneficial. Actually, it has been already published that drinking molecular hydrogen-rich water decreases thiobarbituric acid reactive substances in urine and serum LDL cholesterol levels, increases antioxidant enzyme superoxide dismutase and HDL cholesterol, and improves HDL function in patients with potential metabolic syndrome. That's why we can suggest molecular hydrogen as the supportive therapy in the treatment of metabolic syndrome. I would like to thank you for your attention, and I believe that next time we can meet in person, and I wish you a successful and nice meeting. Bye.
Coming up next, Petrova Markantova Zornitsa. Heuristic and other pitfalls in clinical application of molecular hydrogen in Europe.
Ladies and gentlemen, dear colleagues, it's a great honor for me to stay here and share my thoughts with you. I'm a medical doctor, and my specialty is geriatry, which is a healthcare for elderly people. And my patients are usually 65, 70 years and more. In the same time, I have my private practice in the Modern Doctor Society, where I use non-conventional methods of therapy, such as molecular hydrogen, for example, but also natural medicine. I work in a hospital as a geriatrics in the long-term care department, and I was invited to be a chief doctor in the department of one of the biggest hospitals in Austria or in Czech Republic. In the same time, I am a member of the International Association of the Medical Gas Therapists, where I present Czech Republic with hydrogen and ozone, so I have two toys for playing. As a medical doctor, I will talk about hydrogen from the opposite side, from the side of the user, from the side of the one who wants to have it in his hands and do something and see other kind of results than you have in your studies. My hydrogen history is already for 10 years. And even from the very beginning, I was trying to use the principles of the quantum mechanics and take the plate with the matter and put the both ends together, the practical and the scientific one, and make a tie there and use them. So, how can I move it? As a clinician, what I need so that I can work, because I have people, I want to work with my patients, pigs and rats are cute and I prefer to play with them. I need a reliable source of hydrogen. I need a source, in whatever type, that I know how much hydrogen I have, I know exactly how to apply it, and I'm able to count what result I will have from this. I need this source to give me a measurable amount of hydrogen, because I'm a doctor, and I need to know how much hydrogen I apply to my patient. So I can count for a person of 70 kilos and for a person of 130 kilos. And I want to know how to count how much I need to give him. Then I need a workplace, hospital, clinic, private practice, whatever, where I can do it, where I am able to do it and where nobody can throw me out, but I will do it on legal basis. In connection with this, I need a permission to use it. This means that I need that hydrogen or anything else would be approved for use for people in the way that we saw in 2016, it started to be in Japan, next year in United States. And this is something that I want to have on my workplace, that nobody may come and tell me, this is not like artists, you cannot do it, go away. So, what about health ministry and the other organs of the healthcare departments and everything around it? In order to get it, besides anything else, I need enough usable scientific evidences. Like, I'm really enjoying this conference because I am like academic type, and all this basic research that I see here and listen here and learn from it is for me like living water that I go inside. But I need such kind of evidences that may lead me to something that I can use in my daily practice. And I don't know if last or least, but acceptance by the colleagues is one of the factors that is really taking part in the world when you have something new and you want to apply it. I'm working on my working place now for 6 months, no, from June. And on the last place where I was before, I was told that if I mention anything about molecular hydrogen to my patients, I will be fired the same day. Which was told by my chief, who is my colleague, also medical doctor. after he was talking also to the chief of the doctor's unit. So this is about the acceptance of the colleagues. How I can do anything and go out with anything when everybody around me, especially the people who are above me, are mocking and kicking out. So these are the basic things that anybody needs when he is in front, on the first line, have like people in the hands, there are sick people, and I can just go through my department and say, here, hydrogen would be super, and here will be a good one, and here we can have this wound healed. Okay. Ozone and xenon are two gases with a similar history like hydrogen. The last 2 years were very interesting, and I found that it actually was very active time. And I had two great revelations. The first one was that people really usually do not behave like people to the fellows. So all illusions that I had about humanity fall down. And the second one was that ozone was also a great thing, and I just studied ozone therapy, and I used fully the 2 years for education. And my paper for my geriatric exam was about the xenon anesthesia in elderly people. I chose the topic exactly because I think that nobody of the committee knew anything about it. It was like my my revenge. I chose a topic like it's absolutely foreign for everybody. So, what's the situation with them? Because they're good comparison. Ozone this is very, very like short. Analgesic, anti-inflammatory, but by different possible means. It's immunostimulants, it has antibacterial, antiviral activity in vivo. You can use it in many ways. Also great like additional therapy at oncological therapy. You can use it like infusion, instillation, bathing, injections, and so many things. Ozone Society has a disposal studies on human samples for decades or over many illnesses. The truth is that xenon, ozone, and hydrogen are historically, let's say, at the same age. The studies for all these gases started about the same time, like plus minus something, but the hydrogen study are nothing new, really. And still, these gases have absolutely different life afterwards. Many companies produce ozone generators as medical devices, not just wellness or anything, but they really use it like medical devices, and they're used in medical facilities. I don't see the colleague from Hradec Králové, but we were talking about ozone. He said, yeah, our radiologist, he is making these injections, you know. And it's very good, you have no pain afterwards. And no problem, you just go to the hospital and get ozone injection. But try to get hydrogen injection. So, this is one device for dental therapy, another one, this is autochemotherapy, a big one, and and another one. This is the one that stays out. I like it, this is the one I use, and here you have a hole for ozone, and here you have for hydrogen, so you can do both if you want to. And this is what I like, and you can do different types of whatever you want. It's a good toy, I love it. Xenon. It is good analgeticum, it is good anestheticum. This is why I use it for my paper. It's a good adjuvant therapy also for cancer treatment, and it's very good in unleaning from drugs and cigarettes. It has also a big volume of studies, and it's approved for medical use in Russia, USA, and 17 European countries, where it is used also for anesthesia. This is a British anesthesia device, Russian one, a German one. So another case that has similarly long history, but totally different fate, which is pity for me. And I bought this for the hydrogen, so please help. Much more often, all these gases are used by non-medicals, rather cosmetic studios, which I think is a really pity. I mean, especially in Czech Republic, suppose it's similar in Slovakia and the countries around. And I think that these gases primarily belong to the hands of medicals. I think it's a shame if somebody just takes it and showers somebody and says, you see, I am a great something. So, what do we have? Do we have enough usable scientific evidences? Someone has to tell what is enough and what is not. Someone who knows what is enough. Do we have reliable source of hydrogen? How many different devices we have? Mostly they are not suitable for medical usage, because we don't have any definition of hydrogen. We don't have any way to apply the hydrogen in a, let's say, medical way in the field. If I go to the hospital now, how I can take, let's say, hydrogen, put it in a saline and give it to the patient, or how I can put it to the saline and wash their wounds. I don't have this opportunity. A source with measurable amount of hydrogen? None. A workplace, hospital or clinic. I told you about my talks in the previous workplace. It was the city hospital. And on my new workplace, I am lucky. It just came to me by itself. It's a private hospital. And when I was talking with the director, when they called me if I would go and work there, I get the offer directly from him to start and use ozone for my patients on my department. So I tried to say also something about the hydrogen, but I could see that he has never heard about it, seen about it, and I will have to educate him in this manner. So what about making hydrogen also a medical gas? And approve it. Short story of the oxygen. Oxygen is a medical gas, everybody knows it. We all use it for many, many years, but it was not legally a medical gas until, I don't know, 15 years ago in Czech Republic, but it was used in ambulances, in hospitals, and everywhere. And suddenly someone said, hey, we have to put it in the law because we use it, so we have to give this envelope also. So they made it officially medical gas, and the result was that it became like 3 times more expensive. Nothing else. No the terms, no the ways, only the price. And even now, if we want to use xenon or ozone, the patients have to pay. For people who are from out of our countries, we have the insurance system that usually covers the usual health care. And this is not part of this coverage, so a person has to decide that he wants or she wants to pay for getting any treatment. And the question is if it is really good, because if we have a cheap and easy way to make them better, it will be actually for the health insurance company also cheaper to have him on hydrogen or ozone. And all the same questions. What about health ministry, and who knows how to push on them? Because I was on a meeting where someone from the trade ministry was, and I said, like, what is he doing here? He is not from anything else, even from far like reliable to the health. And how to make the goodwill of these people so that they let us work with the hydrogen. A colleague had to put the hydrogen like a trace element in his mixture, and not to write when he conducted his study that hydrogen is in the mixture, but only mention it like a trace element. Otherwise, he would not be able to conduct the study. Like Amazonian shamans will have better conditions for life and work, I think. Well, and the question is how to take our colleagues to our side. This is maybe more for afterwards when we sit at the brewery and talk about it and maybe find some way. And thank you all for the possibility to see you and share my thoughts with you. As I said, usually I come here with some cute story like the dog with the acute autoimmune syringomyelia who started to walk in 3 days because we gave her really a big amount of hydrogen, or some post-COVID syndrome and operation after it, and maybe some good dementia story. But I think if we can find some way to improve this part of the job, it will be really great. Thank you for attention.
Coming up next, Pokotylo Oleg. Relationship between molecular hydrogen content, ORP, pH and water mineralization in thermoses ionizers generators H2 living water.
Dear ladies and gentlemen, my name is Oleg Pokotylo. I am professor. I am from Ukraine, and I am glad to welcome you in this difficult time in Ukraine. I am glad to welcome you to the great FEST conference. Thank you very much for your invitation from organizing committee, and special thanks Professor Jan Slezak, and in finish my report I have which tradition in Ukrainian conference gift for dear professor, and the topic of my speech is a relationship between molecular hydrogen content, ORP, pH, and water mineralization in terms of ionizers generators, H2 living water. Excuse me. Help me, please. Thank you. One of my sentences is written on this slide. This is my quintessence about drinking water. Is my philosophy, is my ideology. And please listen or read. The quality of your day depends on the amount of water you drink per day. And the quality of daily consumed water determines the number of days of your life. And how important it is, how it works, I will reveal in my presentation. We studied 6 different mineral drinking waters. There are most popular drinking waters in Ukraine. It's Morshinska, Truskavecka, Vishnevecka, Buvette, Bonaqua, and Carpathian Fontaine. Thermos ionizer generators, living water we use for the research. This is device. Is only autonomical. This work without energy, and the basis work is chemical interaction between water and the road take place. This device work like nature. This alloy is only magnesium. And in this study, we determine as pH, ORP, total mineralization, and molecular hydrogen content in the investigator water before and after retention, 30 minutes, 1 hour, 12 and 36 hours, the test waters in the thermos ionizer generator living water. We receive interesting and I think important result. When the water, please next. Okay. When the water of Carpathian Spring is kept in the thermos ionizer, the pH level increased after 36 hours and increased from 7.7 to 9.1. At the same time, the ORP change from plus 220 to minus 520 millivolt. That is the water become catalyte. The overall mineralization also slightly changed after 36 hours. A very important indicator for in the content of molecular hydrogen. During the experiment is indicate increase by 0.95 ppm. The next water we study is Truskavecka water, and the slide showed that after 36 hours, the pH also increased from 7.2 to 8.2. The ORP decreased also from plus to 220 from minus 583 millivolt, and total mineralization slightly decreased. And most importantly, the molecular hydrogen content was 1.08 after 36 hour retention in the thermos ionizer generator water Truskavecka. Morshinska water is the most popular in Ukraine, maybe not only Ukraine, as it water from the famous Morshin resort. As can be seen on the slide, after 30 minutes of keeping in this water, in the thermos ionizers generator living water, ORP quickly decrease to minus 172 millivolt, and after 36 hours from 318 millivolt. And also, after 36 hours, the molecular hydrogen content increased to 0.72 ppm. Next water which we research is Vishnevetsky water, and after 36 hours of retention in the thermos ionizer generator, and increase in pH from 7.9 to 9.7 after 36 hours, and also when which you see the ORP indicator decrease from plus 236 millivolt, and after 36 hours to minus 136 millivolt. And the molecular hydrogen content in the end experiment in this series was 0.8 ppm. pH in the water born aqua after retention in the thermos ionizer generator also increase to 8.5, 9.5 after 36 hours, and ORP in this water decreased to minus 430 millivolt, and you see the mineralization slightly increased after 36 hours, and also increased content H2 in the waterborne aqua after retention in the thermos ionizer to 0.94 ppm. And the last water which we research is buvette water, and as can you see, pH level also in this water increased about experiment, and after 36 hours was 9.8, and also the decreased ORP or redox potential from in the start from plus 111 millivolt in the end from the end experiment was minus 400 millivolt, and maximum indicator in this series experiment was in content hydrogen molecule in the water buvette after 36 hours, and its indicator was 1.28 ppm. So, when we tested water kept in the thermos ionizer generator living water for 36 hours, the following is established. The first, change in pH to the alkaline side by from 1.5 to 2.3 units. The second, repeat and proposed to reduce ORP by from 500 to 700 millivolt. Honorably change in general mineralization, and the next quick and distinct saturation of water with molecular hydrogen up to 0.7 to 1.2 ppm. So this thermocyanizer generator living water is able to autonomously and quickly transform water from a positive ORP to a negative one that is make is a catalyst and electron donated water. At the same time, water is intensively saturated with molecular hydrogen as a result of a chemical reaction with magnesium. There is also a change in pH to the alkaline side. Thus we receive living water. And in the end, I want to repeat this is my sentence. Please read and remember. And thank you very much for your attention. And I wish you gesund and peace. And I know what is it peace, and I know what is it war. And I believe maybe next or maybe in next year or through 5 years in Ukraine also maybe conference of hydrogen molecule. Then Ukraine is a very great, very big country, and today we have very difficult time. And I thank you for my head, which all person who help Ukrainian people, who believe in our victory. Thank you very much, and welcome. Welcome to the Ukraine, the country of free people.
Coming up next, Ravindjarova Tanya. Molecular hydrogen potentiates beneficial effects of hypoxic post-conditioning against ischemia reperfusion injury in isolated rat hearts, a novel cardioprotective intervention.
So in my talk, I would like to share with you some, first of all, I would like to thank the organizers for inviting me to this excellent meetings and the possibility to share with you some of our results concerning the effect of molecular hydrogen on different cardiovascular parameters. Do you hear me? Is it working? This microphone. Okay. So, we all know that early restoration of blood flow in the ischemic myocardium is the only prerequisite of heart salvage. Otherwise, it will die. However, reperfusion of the ischemic myocardium is also associated with massive production of reactive oxygen species, ROS, and that leads to so-called ischemia reperfusion injury with different manifestation. The most severe is myocardial infarction. And of course, there is a great progress over the decades in the interventional cardiology and surgery, but there is still a need to search for novel approaches that could address regeneration of the myocardium after ischemia, reperfusion injury. It is known that antioxidant therapy attenuates the damaging effect of reoxygenation, induced free radical formation, but it may also abrogate metabolic reactions and cell signaling. So, more or less known, well, actually it is known for 30 years, the concept of so-called innate cardioprotection or endogenous cardioprotection. It is based on the principle that, it is based on the principle that adaptation to moderate stress, different kinds of stress, increases resistance to subsequent long-lasting injury. The phenomenon is called ischemic preconditioning. Well, brief episodes of ischemia or hypoxia prior to sustained ischemia, and it is the most robust protective intervention. However, its application, and it is known, it is observed in all animal species and tissues, but unfortunately, its application in humans is limited to planned or elective operation only, first of all due to technical reasons, and then to unpredictable occurrence of acute myocardial infarction and short-term duration. This is not working. Pointer. Okay. Okay. And the duration of ischemic preconditioning is rather short, and it is also the limitation of utilization of this intervention in human medicine. And therefore, more beneficial effect is afforded by brief episodes of reperfusion, reocclusion just after long-term ischemia, just at the onset of reperfusion, and this phenomenon is termed ischemic post-conditioning. Molecular mechanism of both ischemic preconditioning and ischemic post-conditioning involve moderate generation of ROS that play a very important role in activation of cell signaling leading to cardioprotection. The aims of our study were, okay, first of all, molecular hydrogen reduces oxidative stress due to its ability to react with strong antioxidants such as hydroxyl radicals and peroxynitrite radicals without disturbing metabolic redox reactions and cell signaling mediated by nitric oxide radical and superoxide anion and also H2O2. So our study was designed to explore the cardioprotective potential of hypoxic post-conditioning against ischemia perfusion injury in isolated red hearts. And furthermore, we wanted to test the possibility to potentiate the effect of hypoxic post-conditioning by molecular hydrogen by using oxygen-free buffer saturated with hydrogen, and the heart resistance to ischemic perfusion injury was assessed based on the determination of the size of infarction, recovery of left ventricular function after ischemia, and occurrence of severe reperfusion-induced ventricular arrhythmias. So this is the picture showing our setup. Experiments were performed on isolated lung and of perfused heart, which were placed in special lung and of apparatus, and after stabilization, the hearts were subjected to global ischemia and reperfusion. It is seen here. This is after stabilization, then ischemia, and then reperfusion. We measured contractile function by a balloon which was placed in the left ventricle of the heart. So we measured the difference between systolic and diastolic pressure, which is called LVDP, left ventricular developed pressure. We were also interested in the size of myocardial infarction, which was determined by staining with tetrazolium chloride. It is shown here, and these white places, white parts are infarcted or dead tissue, where the rest tissue is living or area at risk, which is not damaged. So post-ischemic recovery of function that I mentioned, also the rate of contraction and rate of relaxation, plus and minus DPDT marks. We were also interested in severe ventricular reperfusion arrhythmias, especially in the most severe form, like ventricular fibrillation. And it was measured by using arrhythmia score due to the most severe form of arrhythmia, which occurs in each individual heart, ranging from 0 to 5 points. And this is the protocol, or general protocol of post-conditioning. After stabilization, the hearts were subjected to 30-minute ischemia, and then during reperfusion, at the onset of reperfusion, they were subjected to 4 cycles of 1 minute re-ischemia. And we measured, after that, they were perfused further 2 hours, and we measured arrhythmias, functional recovery, and infarct size. So this is to show you also the protocols. You see that 30 minutes global ischemia, then perfusion with standard Krebs-Henselite buffer, which contain all necessary components like oxygen, CO2, and other ions, which are glucose, which are necessary for heart perfusion. And then we had also perfusion with hypoxic buffer, where there were no oxygen or CO2. It is shown here, and it is hypoxic post-conditioning. And then finally, we used perfusion with hypoxic buffer, which was saturated with molecular hydrogen every 3 days, and we measured the concentration of hydrogen in this buffer, and it was approximately 0.3 millimole per liter, which is quite sufficient. And here you can see the results. This is the effect of hypoxic post-conditioning and hydrogen treatment on the size of myocardial infarction, which is shown here, white color. And you can see that hypoxic post-conditioning significantly reduced the size of infarction in the control experiments, but combination of hydrogen and hypoxic post-conditioning even more reduced the size of infarcted zone, and it was even more effective in comparison with hypoxic post-conditioning. Here you can see the recovery of function after using this intervention. Left ventricular developed pressure recovery. You can see here that at the end of the protocol, the recovery of LVDP in this combined protocol was significantly higher than in the controls, but not in hypoxic preconditioning. What is important that this effect was observed in 5 to 10 minutes of reperfusion, because this time is very important for generation of free radicals. So at that time, this effect was also observed. As for the diastolic pressure, at the end, there were no differences between these two interventions, but they were both significantly better, lower than in control hearts. It means that the heart had a better ability to relax. So this is the rate of contraction, and here, and the rate of relaxation. And you see that the rate of contraction was significantly induced, significantly increased only in combination of these two interventions, because the hypoxic post-conditioning alone increased the recovery of rate of contraction, but it was not significant. And the rate of relaxation, here we could see that both hypoxic post-conditioning and combination of these two interventions was very protective, and especially in combination, this recovery of relaxation was recovered nearly to the baseline levels. And recovery of coronary flow, which we also measured, was also significantly increased by both interventions, but it was more increased by the combination of these two interventions. So molecular hydrogen seems to amplify the effect of hypoxic post-conditioning. And this is the slide shows the ventricular fibrillation during the perfusion. This is the most severe form of arrhythmias, and you see that the incidence was significantly lower in either in post-conditioning or in combination of these two interventions. And also the duration of ventricular fibrillation was significantly low, but only in combination of this intervention. And accordingly, when we calculated the arrhythmia score, it was also significantly reduced when we used both interventions, not with hypoxic post-conditioning itself. And I would like to say something about mechanisms of molecular hydrogen. So besides antioxidant effects, molecular hydrogen modifies activities of MAP kinases, CAM kinase, pro-survivals, PI3, AKT cascade, and expression of anti-pro-apoptotic proteins and inflammatory proteins. And therefore, besides antioxidant properties, molecular hydrogen can exert anti-apoptotic, anti-inflammatory, and cytoprotective effects, and therefore it is involved in processes of cell death caused by apoptosis, necrosis, and necroptosis. And all this leads to cardioprotection against ischemia, reperfusion, injury. And in conclusion, I would like to say that hydrogen treatment may have a potential to enhance the effectivity of post-survival interventions, such as hypoxic post-conditioning, preservation of physiological ROS production involved in cell signaling, is the advantage of molecular hydrogen over other antioxidants, which may blunt anti-infarct and anti-stunning effects of pre- or post-conditioning. And therefore, hydrogen treatment may have a potential to be used in clinical practice to improve prognosis of the patients in reconvalescence after infarction, or also larger cardiosurgical interventions such as bypass grafting and others. And I would like to thank my collaborators who participated in this study: Marek Zaleszak, Branislav Kura, Jan Graban, Veronika Farkasheva, and Jan Slezak. And it is supported by, the study is supported by different grants, and I would like to thank you for your attention.
Coming up next, Shen Wenbiao. Hydrogen agriculture, from farm to fork.
Ladies and gentlemen, my name is Wenbiao Sun from Nanjing Agricultural University, China. And my topic is hydrogen agriculture from farm to fork. In fact, I introduced my university first. There's 4 campuses. So also the total number of faculty and staff members, nearly 3,000 people. And I will introduce my major is biochemistry. My research interest is the plant gaseous molecules, including hydrogen gas. In fact, this presentation divided into 3 parts. The first part is the introduction. In fact, healthy agriculture is the foundation of the human health. Reducing soil pollution, improving the yield and quality of the crops, and providing healthy foods for peoples are major scientific concerns faced by worldwide agriculture. In fact, from the geology views neglected hydrogen factor. In fact, the geology scientists show there's a lot of places can produce the hydrogen gas, and the concentration is near about 10%. I mean, in fact, there is natural gas. And hydrogen energy is another challenge for all the people. It has been widely used in chemical industry and now is energy vehicles. And the price of the hydrogen gas is relatively cheap, became cheaper and cheaper. And the safety is, in fact, there's no problem. And also hydrogen gas is the most important element in the universal. And in the long years ago, there's 3% of the hydrogen gas. But in fact, the biological effects of hydrogen gas have been neglected. Since, for example, in the plants, scientists can discover that plants can produce hydrogen gas, but they don't know what's the function of the hydrogen gas produced in plants. In fact, here is the hydrogen gas by geological chemical cycles from the soil, from the nitrogen gasification, and soil uptake, and biomass burning, and the fossil fuels industries. There are also cycles. Hydrogen biology, in fact, is a new discipline that studies the biological effects and molecular mechanism of the hydrogen gas. Hydrogen agriculture normally is using hydrogen-rich water or hydrogen fumigation, or maybe the hydrogen-producing materials to improve the yield and the quality of the products of agriculture, forestry, animals, husbandry, and fishery. So there may be the 4 important botanical responses. The first is the regulation of the growth and development and quality. The second is post-harvesting preservation and the reduction of the pesticide residues. The third is the improvement of tolerance against stresses. And finally is the improvement of the resistance of the animals. Approaches for hydrogen deliveries including 3 forms. First is gas, the second is liquid, and third is solid. And so I'll introduce the progress of my laboratory. My laboratory is maybe 10 years ago, we focused on hydrogen functions in plants. And in the last 2 years, we also found hydrogen container materials can also have the botanical effect. There's, in fact, articles related to hydrogen agriculture. There's a lot of publication, and scientists from Canada, from the Netherlands, from the Turkey, from the Australia, they also have the publications. And the second is the mechanism and application of the hydrogen agriculture. And in fact, the hydrogen can be used as gaseous signal molecules. It can react with any other molecules, signal molecules, such as loss, such as NO, natural oxide, carbon monoxide, CO, and the hydrogen sulfate. And in fact, in this year, and scientist Qianjun also proposed that ferrous poisoning, toxins related by sensors of hydrogen molecules. And micro-RNAs and it's also target proteins. There also may be another possibility. The involvement in hormone signaling pathway is also involved. It's also involved, including ABA, ethylene, oxine, and GA. And in fact, there's a practical application of the hydrogen gas in agriculture, including 3 parts. The first, the improvement of the yield and quality. Here we see we're using the rice as research materials. In fact, we proposed a scientific question: does hydrogen-rich water irrigation improve the rice yield and quality? We are very happy as we obtained the positive result. You see, compared with the control, the hydrogen, the nanobubbles, rich waters, they have the positive effects. And the molecular mechanisms are also finished. We're using the qPCR to check any other possibility. And also, the most important is decreased the cadmium's contents. The cadmium contents was decreased by hydrogen-rich water. The lily is another choice. The lily, you see, please, from these figures, you will see the left is control, the right is hydrogen-rich water treated groups. We found that hydrogen-rich water improved the yield and prolonged the shelf life of the lily. Okay. And the mechanism is most important. Besides antioxidant machinery was stimulated by hydrogen water, then another important mechanism that is the increased ratio of the unsaturated fatty acids to saturated fatty acids. And in fact, this is the strawberries. We also obtained the similar positive results. And compare with the control hydrogen-rich water, in fact, these hydrogen nanobubble-rich waters increased the total volatile compounds around about 100% in comparison with the treatment with or without fertilizer application. And the molecular mechanisms are also evaluated. We're using the qPCR analysis, and this publication was published in Food Chemistry in this year. And also tomatoes are also the similar results. And the dragon fruit, you see here is the up line is control, and the here line is the hydrogen-rich waters treated groups. So it increased the yield of the dragon fruit, and the contents of the vitamin C and sugars were also increased. And the regulation of the pesticide residue is another important practice. We found hydrogen-rich water. In fact, hydrogen-rich water can promote the degradation of the pesticides in tomato. But most important, without influence, is antifungus activity. And the molecular mechanism is the BR, the BR signaling. The universal response, we also detect it's the universal response in edible plants, including rice, including rapeseed, including Chinese cabbage. And also improvement of the food preservation was also carried out, including the kiwi fruit, tomatoes, grapes, and other fruit and vegetables. The butter production was also used. Okay, scientists using the wash the butters with hydrogen-rich water. They found that this treatment can reduce the formation of the biogenic amines and produce the high quality butter. And modifies atmosphere is another choice, including grapes, kiwi fruit, Chinese chives, and eggs. They also have the positive results. And reducing the atmosphere packaging, they also can be used hydrogen gas. The experiment shows that hydrogen is a potential gas for atmosphere's modulation. Incorporations of hydrogen gas into the packaging atmosphere can extend the shelf life of foods. And the juicy processing can be used hydrogen gas, the positive result, and also including fruit drying. And the post-harvesting preservation of the cut flowers was also carried out, including lily loss. There's the similar positive results. And this hydrogen storage materials, mechanism dihydrides, also can be used. The downstream, the molecules including the nitric oxide NO and hydrogen sulfate, they also have the publication. So the final section is prospectus of hydrogen agriculture. In fact, the Canada scientists using the hydrogen gas firstly, but it's relatively not suitable for the practical application in agriculture. So the solution is maybe a choice. The hydrogen nanobubble water combined with the nanobubble technology that has been used, and since with the high hydrogen concentration and long residual times in water in solutions, is suitable for water and fertilizer integration system, good safety, simple operation. Hydrogen modified atmosphere is also can be used. It can be used, but be careful. The concentration of the hydrogen gas should be less than 4%. It's very important for its safety. And the difference in plants' sensitivity to hydrogen gas was also evaluated. We gave the reviewing papers published in the last years, the different plants and the different the concentration ranges of the hydrogen gas. So the most important prospect that is we need a greater breakthroughs of relevant mechanism. The most important that is hydrogen production and its mechanism in plants. Hydrogen agriculture industry chain from farm to fork. You will see from farm to table to maybe the hydrogen gas plus household applies. In fact, this some of result I provide is we will thank you National Science Foundation of China. We also thank you Air Liquid and other companies. Thank you. Thank you for your attention.
Coming up next, Shogienova Ludmila. Hydrogen inhalation in rehabilitation program of the medical staff, recovered after COVID-19 infection.
Спасибо большое, уважаемые леди, джентльмены, уважаемый президиум. Позвольте представить вам сообщение, доклад на тему использования водорода в реабилитационной программе пациентов, перенесших COVID-19.
Okay, ladies and gentlemen, I would like to introduce my report to you. The topic of my report is hydrogen inhalation in a rehabilitation program of medical staff recovered from COVID-19 infection.
Основной проблемой пациентов, перенесших COVID, является постковидный синдром.
The major problem of the patients who survived the COVID-19 is the post-COVID syndrome.
У 8 пациентов, перенесших COVID, у одного обязательно будет постковидный синдром.
One out of every 8 patients will have a post-COVID syndrome after COVID-19 infection.
При этом 20 пациентов с COVID-19 постковидный синдром продолжается 12 недель, а у 2 и 3% продолжается до 12 месяцев и более, так называемый long COVID.
In 20% of COVID-19 survivors, symptoms of post-COVID syndrome are presented up to for 12 weeks, and in 2.3% of survivors, it can be presented up to 12 months.
Патогенетической причиной, патогенезом развития постковидного синдрома является васкулопатия, которая связана с непосредственным повреждением эндотелия капилляра, вену, так называемым развитием эндотелиита.
Vasculopathy is the main pathogenic feature of post-COVID syndrome, and it's caused by direct damage to endothelial cells in capillaries and venules.
Целью нашего исследования было изучить эффективность и безопасность применения водорода у пациентов с COVID-19, перенесших COVID-19 в постковидный период.
The aim of our rehabilitation program was to study the efficiency and safety of inhalation therapy of the hydrogen with the survivors of COVID-19 patients.
Основные вопросы, которые мы перед собой ставили, это эффективность и безопасность, оценка клинического состояния пациентов на фоне применения водорода, а также транспорт кислорода, дисфункцию эндотелия, влияние водорода на протеом конденсата выдыхаемого воздуха и на оксидативный стресс.
You can see the goals of our rehabilitation program. We wanted to investigate the clinical manifestation of prolonged COVID-19, study oxygen transportation, vascular endothelium function, proteome of exhaled breath condensate, and oxidative stress.
Значит, в исследование вошли 60 пациентов. Все пациенты были сотрудниками нашей клиники, то есть врачи, в возрасте старше 18 лет.
60 patients, they all are physicians from our clinical hospital, participated in our study. They all were older than 18 years.
На момент исследования у них у всех был отрицательный тест на коронавирус, ПЦР-тест.
They all had the negative test on COVID.
И у них в анамнезе имелась перенесенная пневмония с ковид, подтвержденная на компьютерной томограмме, более 1 месяца.
They all had viral pneumonia older than 1 month after they finished this disease, and they all have oxygenation index more than 300.
У всех пациентов на момент исследования индекс оксигенации составлял больше 300.
Я же сказал.
Дизайн исследования. После рандомизации 60 пациентов были разделены на 2 группы. Основная группа 30 человек, которая получала ингаляцию водородом через 90 минут, и вторая группа, контрольная группа, которая получала витамин С и витамин D.
We divided 60 patients into 2 groups. The main group, which were inhaling hydrogen for 90 minutes per day, and the second control group, they were receiving vitamin C and vitamin D.
Данное исследование было проспективным, параллельным, контролируемым.
It was comparative, parallel, and prospective study.
Мы изучали гемодинамику, транспорт кислорода, маркеры воспаления, также эндотелиальную функцию сосудов, оксидативный стресс и функциональный тест 6-минутной ходьбы.
Our study includes study of hemodynamics, oxygen transportation, markers of systemic inflammation, endothelial function, oxidative stress, and functional test. It was 6-minute walk test.
2 группы, основная и контрольная, были сопоставимы по возрасту, полу, боди-массы индексу, частоты сердечных сокращений и пульсоксиметрии.
Both groups were very close to each other from the point of body mass index, heart rate, and SpO2.
На данном снимке представлена фотография пациента во время проведения ингаляции. Вы видите, все пациенты, наши сотрудники, они сидят, получают ингаляцию из аппарата через носовую канюлю, непосредственно ингаляция происходит в носовые ходы.
This picture shows how the procedure took place. You see that all patients are sitting and they're taking inhalation, they're taking hydrogen from the device through nasal cannules.
По результатам исследования, значит, мы получили такие изменения. Изменился
индекс.
Нет. Признаки эндотелиальной дисфункции. Значит, уменьшилась скорость распространения пульсовой волны в основной группе достоверно, и изменилась индекс RI, индекс, который отражает тонус мелких сосудов.
What we received the reliable reduction of signs of endothelial dysfunction, which was estimated by pulse wave speed velocity, and small vessel tone has been detected during the study. Pulse wave SI has reduced and small vessel tone has increased.
На данном слайде представлена капилляроскопия ногтевого ложа до исследования и после ингаляции. Вы видите, что исходно отмечается низкое количество активных капилляров. После ингаляции количество капилляров увеличивается, они становятся более расширенными и улучшается кровоток в них, скорость кровотока.
Here you can see the example of capillaroscopy of one patient before hydrogen inhalation and after. As you can see, initially there was a little number of active capillaries, and after the therapy of hydrogen, the number of active capillaries has increased, and blood flow speed in capillaries has also increased and improved.
Интересно изменение маркеров воспаления крови. Мы видим, что достоверное снижение лейкоцитов и достоверное повышение лимфоцитов, отражающие иммунную систему пациента.
Here you can see the changes in inflammation markers. You can see that number of leukocytes has decreased and number of lymphocytes has increased.
Транспорт кислорода. У всех пациентов исходно отмечается улучшение транспорта кислорода, повышается парциальное напряжение кислорода и сатурация артериальной крови.
There was a reliable improvement of oxygen transportation with all patients. PO2 in the main group has reliably increased. Arterial blood saturation has also reliably increased.
Очень интересный показатель был лактат крови. У всех наших пациентов, наших сотрудников, был повышен лактат. И на фоне ингаляционной терапии в основной группе происходит достоверное снижение уровня лактата. При этом уровень лактата достоверно снижается и относительно первого дня с основной группы, внутри группы, и относительно тех результатов, которые получены в контрольной группе.
Initially, all patients had high lactate level as a sign of metabolic changes. During inhalation period, there was reliable lactate concentration reduction by the day 10 in the main group, comparing with the day 1 inside the main group and comparing with the day 10 in the control group.
Интересный показатель шунт крови. У всех пациентов исходно отмечался высокий шунт, который отражает нарушение вентиляционно-перфузионного соотношения. При применении водорода происходит снижение уровня шунта, то есть отражает улучшение вентиляции и улучшение перфузии в легких.
All patients had originally the very high pulmonary shunt. As a result of hydrogen inhalation, the pulmonary shunt has decreased, and that is the evident result of lungs ventilation and perfusion.
Шестиминутный тест. У всех пациентов исходно отмечалась скрытая гипоксемия, которая проявляла себя на фоне нагрузки. То есть на фоне нагрузки снижалась пульсоксиметрия. Конечно, это отражалось и на снижении толерантности к нагрузке. Ингаляция водородом позволяла повысить толерантность нагрузки за счет улучшения транспорта кислорода, за счет повышения ПО2 и снижения уровня лактата.
And there were very good results in 6-minute walk test. At the beginning, all patients had signs of covered hypoxemia, which was manifested during exercises. All patients had reduction in pulse oximetry, which resulted in low tolerance to physical exercises. After hydrogen inhalation, the oxygen transport has improved. As a result, the distance covered within 6 minutes walk test has significantly increased.
Всем пациентам мы проводили исследование конденсата выдыхаемого воздуха, и было отмечено, что исходно и в основной группе, и в контрольной группе нарушен уровень протеомных белков в норме. Происходит сдвиг нормального его содержания. Особое внимание на фоне ингаляционной терапии происходит восстановление белкового состава. И вот мы особое внимание уделили альфа-1 антитрипсину, который исходно был низкий, что свидетельствует о частого развития пневмотораксов у пациентов с COVID-19. А на фоне ингаляции водорода у нас происходило снижение уровня альфа-1 антитрипсин.
We have examined the exhaled air concentration and protein profiles. Initially, proteomic proteins in both main and control group were damaged. Hydrogen inhalation has improved proteomic proteins in exhaled air of the patients. Special attention was paid to alpha-1 antitrypsin. It was at a very high level at the beginning of the study with all patients. and that is the serious risk of pneumothorax. After the inhalation, the number of alpha-1 antitrypsin has significantly decreased.
Таким образом, ингаляционная терапия водородом, она является эффективной и безопасной, улучшает транспорт кислорода, происходит снижение парциального напряжения кислорода в артериальной крови, снижение шунта и снижение уровня лактата в артериальной крови. Происходит восстановление толерантности к нагрузке, происходит также снижение эндотелиальной дисфункции, снижение маркеров воспаления крови, и водород блокирует анаэробные процессы, которые блокируют анаэробные процессы. А также восстанавливает протонный белок, который способствует ремоделированию легочной ткани.
So we found that hydrogen inhalation is a very effective and safe method in rehabilitation for COVID-19 survivors. It changes the oxygen status, reduces pulmonary shunt, and reduces blood lactate. Also, we found that the exercise tolerance has increased. Vascular system response improved, signs of vascular endothelial dysfunction were also decreased. And we also found that blood biomarkers of inflammation included low leukocytes counts and high lymphocyte counts. So it's really safe and positive results that we received during our test.
Спасибо за внимание.
Thank you very much for your attention.
Coming up next. Singal Pawan K. Vitamin C mitigates doxorubicin-induced nitrosative stress.
Thank you very much, Professor Nazarov. And I would like to begin by thanking the organizers, excuse me, particularly Professor Slezak and Kura, for the invitation to participate in this exciting science, new science, or relatively new science, and also the hospitality which Bratislava is known for, or the Heart Institute is known for. That's airport to airport, and I really appreciate it. I'm going to switch gears a little bit. Rather than using molecular hydrogen as the antidote, I'm going to use vitamin C. I won't disappoint the hydrogen lovers, because this will be the really playing field in this important cardiac condition where there's a huge role for hydrogen to play, or to at least check it out along the lines that I'm going to suggest to you. So doxorubicin is a wonderful anti-cancer drug, but it does cause a cardiotoxic side effect, which is a huge risk factor and does limit its full potential use. So the challenge is still out there. Drug has been in the market for almost 50 years now, and it is still in use, used carefully, of course. And this is the doxorubicin molecule. I'm showing it to you for a particular reason. It is tetracyclic aglycon. This damn thing is not working. To which amino sugar is linked through a glycosidic bond. But in this tetracyclic ring, ring B, the quinone ring, has the capacity to shunt back and forth between quinone and hydroquinone in the presence of oxygen and transition metals, and in the process, it produces electrons, which are, when captured by oxygen, it can take oxygen through single electron reduction pathway, which has been shown in pieces and parts by many talks already before me. We published this in late 80s. So oxygen, when it takes up one electron, it's superoxide radical, 2 electrons, it is hydrogen peroxide. 3 electrons is hydroxyl radical. 4 electrons is water. And if all 4 electrons are added at the same time, which is done through the cytochrome oxidase system, which hold the oxygen in place till 4 electrons are added and is released, and we have production of ATP. Now these are, when produced in physiological levels, are very useful, essential for detoxification, for signal transduction, and many other noxic presence in the cell. However, if they exceed in their production, then we have different antioxidants, enzymatic and non-enzymatic. Enzymatic superoxide dismutase has been talked about a lot, catalase, glutathione. For different peroxidases, glutathione peroxidase, particularly in case of heart. For hydroxyl, we still don't have any enzymatic antioxidant, and now hydrogen is coming on the scene, which is directly hitting it here. So anytime this flux exceeds the capacity of enzymatic and non-enzymatic, which is vitamins and large proteins, then one begins to see occurrence of cell injury. In case of heart, it's heart failure. Now, interestingly, with the hydrogen coming on the scene, this is a slide that I have taken from Slezak's paper, which was published 2 years ago, where they have shown that superoxide, when it interacts with nitric oxide, it causes the production of peroxynitrite. Peroxynitrite is highly, highly toxic, and I'll come back to it. And hydrogen specifically quenches this. And the other side where hydrogen is very effective is hydroxyl radical. And it does not interact with superoxide or with hydrogen peroxide. So this is where the sort of hydrogen potential role is. And I am going to now focus on the occurrence of nitrosative stress. We have examined both the oxidative stress coming through this scheme and the exceeding capacity of the antioxidants. And in that context, so there are these two major pathways through which the doxorubicin effects really occurs. It's either oxidative stress or nitrosative stress or both. So this part we examined in early 80s, and in 90s we published a paper. In fact, we published 2 papers in the New England Journal of Medicine. So doxorubicin causes increased production of reactive oxygen species. It compromises the antioxidant capacity, and the resultant effect is increase in oxidative stress, which then compromises membrane function, protein, DNA, and also modulation of different adaptive processes. And one has apoptosis, necrosis, and cell death. Now, with respect to nitrosative stress, we have the production of nitric oxide through nitric oxide synthases. There are 3 different isomers: inducible, endothelial, and neuronal. And we have followed all 3 in the presence of doxorubicin. And then here is the continuation of the slide that I showed you earlier. You have the production of electron, which gives you superoxide radical. When these 2 interact, we have the production of peroxynitrite, and then it attacks at many sites. Mitochondria, increasing the membrane permeability pores to cause cyto-C release, activation of caspases, apoptosis, nitrosylation of different proteins acting on DNA and affecting producing pro-inflammatory cytokines, inflammation resulting in, again, myocardial cell injury, and we have heart failure. So, our approach in my lab for this component, we have 3 different models of heart failure that we follow. This is DOX-induced heart failure. For this particular study was to use 2 different experimental models. One is ex vivo isolated cardiomyocytes, exposed to dox in the presence and absence of vitamin C. The other is giving dox to the whole animal in the presence or absence of vitamin C. I would not have time to touch this at all, this study part B of it, but I'll show you significant data in this aspect, which will set the stage, and you will get the picture that that happens in vivo also, which we have reported and published. So the model here is that we take isolate cardiomyocytes from adult rats and have them in 4 groups: control, vitamin C treated, dox treated, and vitamin C plus dox. And the doses I'm showing you are the doses that we have worked out and have established. And the treatment of dox in this condition was for 24 hours. Where we wanted vitamin C, that was added 1 hour prior to dox. So the dox, the vitamin C is already in the medium, then dox is thrown in. So here we have viability of the cardiomyocytes. So dox with no vitamin C causes huge kill of the cardiomyocytes, but when we have vitamin C presence in different concentrations, there's a protection or cell viability increases, which reaches to an optimal level at about 25 micromolar, and that's the dose we have used. And we also monitored production of reactive oxygen species, and which is shot up by dox more than 80% at 0 vitamin C. And with the increasing concentration, the production of reactive oxygen species is compromised, and again it reaches to a certain maximum, and no further improvement if you try to increase the vitamin C concentration. And in the next slide, I'm showing you the pictorial view of the reactive oxygen species induced by dox, control, vitamin C, and here dox almost all cardiomyocytes, isolated cardiomyocytes, they show a huge flux of superoxide radical. This one is monitoring superoxide radical. And vitamin C hugely modulates this effect. Now, monitoring the total nitric oxide synthase activities in cardiomyocytes, that is all 3 NOS activities, and there's a huge increase by dox in NOS activities, and vitamin C controls that. And then the production of nitric oxide in the cell, significant increase by dox and compromised by vitamin C. And the nitric oxide released in the medium is increased by dox and is compromised by vitamin C. And this is different NOS activities. iNOS, which is inducible, it produces nitric oxide in micromolar range, is hugely increased by dox, and vitamin C mitigates that. And eNOS exists in 2 forms, monomeric or dimeric. In dimeric form, it acts as an enzyme and produces nitric oxide. In monomeric form, it produces superoxide radical. So, and that is determined by phosphorylation at certain sites within the eNOS molecule. If it is phosphorylated at serine, there is upregulation of dimeric form. And if it is phosphorylated more at threonine, then there is upregulation of monomeric form. So dox upregulates monomeric form and downregulates the dimeric form. And vitamin C reverses this effect. The levels of peroxynitrite, the real killer stuff that is produced by the interaction of superoxide and nitric oxide, dox increases the nitric oxide levels almost by 200%, and vitamin C tends to mitigate that. And nitrosylation of different proteins, dox causes huge nitrosylation of different proteins, and vitamin C tends to correct that. We did not go after the isolation of different proteins. That's a whole new ball game and whole new science, and we did not need to get into that other than showing that there is a nitrosylation that's caused by DOX, and vitamin C prevents that. So we monitored several cytokines. Here I'm showing you data, one on pro-inflammatory cytokine, that is TNF-alpha, is increased significantly by DOX and compromised by vitamin C. And IL-10, which is anti-apoptotic, antioxidant, and it negates the effect of TNF-alpha. And we have published many papers studying the interaction of these two cytokines. So that is reduced by DOX, and vitamin C tends to correct that. And the ratio of the two, TNF-alpha over IL-10, this data, same expressed in a different fashion, of course, is increased, and vitamin C tends to reduce that. And now looking at the pro-apoptotic and anti-apoptotic proteins, VAX, which is pro-apoptotic, is hugely increased by DOX, and vitamin C reduces this. And BCLXL, which is anti-apoptotic, if anything, is reduced marginally, and vitamin C, again, brings it back. Caspase, which is the immediate enzyme for apoptosis, is increased by DOX, and vitamin C tends to correct that. So putting this whole story together, doxorubicin increases INOS, that increases the production of nitric oxide, and it also increases the production of superoxide. Interaction of these two results in the jump in peroxynitrite, and we have cell kill and heart failure. And vitamin C tends to block the increase in INOS and increase in NO, and then blocks the production of peroxynitrite. And eNOS is blocked by doxorubicin, which is released by vitamin C, and one has the production of nitric oxide, and you have cardio protection. So in summary, DOX increases the expression of INOS, leading to increased NO production. Treatment with vitamin C prevented DOX-induced increase in nitric oxide. It causes protein modification by nitrosylation, which was blunted by vitamin C. DOX-induced increase in TNF-alpha over IL-10 ratio was reduced by the treatment of vitamin C with vitamin C, and DOX-induced increase in apoptotic protein BAX and caspase-3 was inhibited by vitamin C. So a simplified cartoon, it really needs battery, this dumb thing. It functions with its own mind. So here we have then a composite picture. DOX increases reactive oxygen species, decreases antioxidant defense, increases reactive nitrogen species. Result is increased oxidative stress, increased nitrosative stress, cell death, loss of cardiomyocytes, reduced cardio function, and heart failure. And vitamin C tends to block all these three chains or the processes. So this is a challenge to those hydrogen lovers to see if vitamin C would, hydrogen would fit in this slot, And finally, I'd like to thank the students, people who worked on it. And Alutke is a faculty member in Health Canada, so is Dr. Gauriya Kulkar. They were PhD students. Ashim Bapti was a research associate, now a faculty in Kansas. And Akshi Malik is still a PhD student in the lab. And funding agencies, St. Boniface Hospital, Institute of Cardiovascular Sciences, University of Manitoba, and CIHR of Canada. And I thank you for your attention.
Coming up next. Sing-Ram B. Can molecular hydrogen therapy enhance oxygen saturation among patients with chronic lung disease?
Good afternoon, ladies and gentlemen. I am very much obliged to the organizers for giving me an opportunity to share my views with you on this very topic. I'm not going into details of the title, but all the three vital signs acquired from pulse oximeter are predictive of COPD exacerbation, chronic obstructive pulmonary disease, and with oxygen saturation being the most predictive, followed by respiratory rate. And of course, there is a systemic inflammation, and there is also circadian misalignment in COPD, as well as also in night shift workers, which was presented earlier. Our planet revolves around the sun on its axis, and therefore biological function change accordingly from in day and night and every hour. And when these changes occur, the central circadian clock present in the brain, this is being activated, and this also activates all the peripheral clocks in all the organs, including the smooth muscle cells and also the skeletal muscles responsible for sympathetic activity. This Dr. Hallberg, he's called the father of chronobiology and also my guru, and she is a lady now in charge of this center, Hallberg Chronobiology Center. Dr. Hallberg described several blood pressure variability, which are shown, but they are not established. That means other investigators still not agree with these ones, but they are well known. So this slide you have already shown that when there is a variability, night shift work, or there is a other disturbance in the circadian rhythm, there is a DNA damage, which results into various diseases. And in shift workers, these abnormalities do occur. And these are various already Dr. Fatima showed, so I'm not going into details of these. Day and night rhythms in various biomarkers are shown here, and they, of course, they are dependent on the diet and lifestyle factors. And this slide you have seen already. So night is meant for repair, that we should know. And all the Western lifestyle is bad, it is disturbed the biology and biochemistry of the night. That results into various diseases, including heart failure. And this is the shift work, how this causes various abnormality. If there is obstructive sleep apnea, neurological disorders, and if there is oxidative inflammation, cardiovascular disease, and impaired glucose and lipid tolerance, metabolic syndrome, and GIT diseases. And shift workers circadian rhythm has already shown this, how these problems are created. Then the study meta-analysis of trials already shown to you. More diabetes, more when there is a more duration of rotating night shift work. Oh my God. Can anybody help me to come back? Can you help? Okay, nice, thank you. This is the study, this finding showed that when there is a shift work, there is an adverse effect, and when without adjusted HR, there is like that. This slide shows the night, during night, what happens to the blood pressures, and during daytime, these biomarkers show changes. And during circadian change in the night dipping, this is the dipping? Yes, this is the dipping. When there is no dipping is lost, the BP curves become like this. What is happening? Perhaps I'm not that much educated. Yeah, next. Why there is a problem?
You have to use this one to change.
Yeah, I'm doing this one only. Something wrong, perhaps. Next one. Next one. Yeah. Next one. Oh, she would do? Please, next slide. Next slide. Next one. So, during night, the beta cell asleep. Alpha cell go increase the glucagon. And this I already commented. Next one. Next, this is the same one. Oh, it is not going ahead. Next, please. Pardon?
You give us probably bad version because it's the last slide on this presentation.
Okay. So, but I wanted some more slide earlier. Don't go for the last one.
The last one according to your presentation.
No, there is something wrong. Yeah, these ones, I want these ones. Yeah. Little more. Please go ahead some more slides before. Go back to some more slides. Go back. That's right. Now it's okay. Now this is a clinical study where the effect of night hyperglycemia was described, and it had an adverse effect on nighttime blood pressure as well. Next one. And this is our study, effect of HRW, hydrogen-rich water, 3 tablets in the morning, 2 in the evening, on oxygen saturation and nighttime blood pressure in patients with these. Oxygen, yeah, this is about patients with COPD. So when these patients were given, the oxygen saturation goes up from 90 to 95, then it comes back after 45 minutes. So in all the 11 cases perhaps, or only 3 cases, one of them had severe COPD, and the other had tuberculosis lungs, and also one more case, COPD. They did not show response, but all other cases showed a response on oral intake of hydrogen-rich water. And so this was very interesting observation for us. The first patient was me, actually. I had COVID, and during recovery time, I tried this because my oxygen saturation was not going above 90. Next one. And showing higher systolic blood pressure at 3 and 6 p.m. This shows higher systolic in 6 hours. Next one. Showing higher diastolic blood pressure between 3 to 6 hours in the night. That means dipping is absence. Next one. Showing a higher heart rate during the same period. Next one. And this is showing decline in oxygen saturation during this period. Next one. So mechanism of nocturnal hyperglycemia, nighttime eating activity disrupts the day and night cycles, resulting into hyperglycemia, hypertension, decrease in O2 saturation, and exacerbation of COPD due to increase in sympathetic activity and low vagal activity. The clock within arterial smooth muscle cell, insulin producing beta cell anticipates the start of the and feeding period and increase in cortisol and glucose stimulated insulin release, which in turn stimulates the clearance of glucose from the blood. Next one. And these are the various factors and biomarkers that become abnormal and result into various dysfunctions. Next one. Dr. Hallberg, again, my guru, thank you very much. So in conclusion, high at bedtime blood glucose or activity may predispose circadian dysfunction, leading to nighttime hypertension with loss of dipping, decrease in oxygen saturation, and may cause obstructive sleep apnea. Treatment with the hydrogen-rich water may reverse the adverse effects of night shift and COPD as well by decreasing oxidative stress inflammation. You know the mechanism better than me, perhaps. Thank you very much.
Coming up next, Sladekskova Barbor. The effect of hydrogen-rich water on performance following high-intensity interval training.
Okay, so thank you. So good afternoon to all of you. So as my colleague said, my name is Barbora Sladečková, and I'm a PhD student. So I would like to express a big pleasure and a little fear to stand in front of you, such as honored audience and honored people in molecular hydrogen field. So I came from Olomouc, as my colleagues before, from the Faculty of Physical Culture, Palacký University, and the main interest of my PhD research is the molecular hydrogen and its impact on different physiological parameters. Today I'm going to present you a small part of my PhD research, but I would say quite an important part. I named my presentation The Impact of Hydrogen-Rich Water on Fin Swimming Performance After High-Intensity Interval Training. So first of all, a brief introduction and methodology. So when preparing the presentation, I was like, okay, so what am I going to say about molecular hydrogen in front of the audience as you are? So I decided, I was going to say like, well-oriented audience as you are. So I decided to present here very briefly ergogenic effect of molecular hydrogen. So the question is there any ergogenic effect of molecular hydrogen? So we know some papers which saying no, there is no ergogenic effect of molecular hydrogen. But there is more papers saying yes, there is ergogenic effect of molecular hydrogen. These papers say molecular hydrogen can enhance physical performance or the recovery after sport performance, after physical activity, and so on. And actually these papers supported us to start with molecular hydrogen research at our workplace, and actually they keep us, or they keep supporting us to continue in our research. So, okay, now very briefly, I want to introduce what fin swimming is, because I don't know if there is anyone here who knows what fin swimming is. So very, very shortly, fin swimming is underwater sport consisting 4 techniques. I'm not going to present all of them or introduce all of them because we don't have enough time, but I just want to present the one we used in our study. The technique, what you can see in my presentation, is the technique, or maybe better to say event, of swimming where we use fins, or better to say monofins, and snorkel to swim like on the water surface. The aim of this sport is to finish the set race in as fast as possible or as quickly as possible. And as you can see, the main force comes from the fin swimmers' lower limbs. So this is how fin swimming looks like. And now let's look at our study. It was randomized double-blind crossover study, and it consists 12 Finn swimmer, 8 women, and 4 men. I'm sorry for the spelling mistake here. Here you can see very brief characteristics of participants and of course randomization process. We divided participants into 2 groups. First group was given hydrogen-rich water first and then placebo, and the second group was given placebo first and then hydrogen-rich water. Of course, none of us knew what is hydrogen-rich water and what is placebo. I would like to mention that all participants were well-trained athletes, and all of them reached the level of Czech junior national team in Finn swimming or Czech national team of Finn swimming. And this activity is very specific for them, and they are used to practice like every day or twice a day, so they are able to keep very constant results. So, the presented study took place at 25-meter-long swimming pool. Participants underwent high-intensity interval training in the morning. We apply high-intensity interval training to cause muscle damage or to cause fatigue and so on. So, in the morning, high-intensity interval training. After 8 hours of recovery, they underwent 400 meters performance. And this schedule wasn't just random schedule. It comes from the typical swimming and Finn swimming competitions programs. Because in these 2 sports, swimmers usually need to swim qualification in the morning, and in the afternoon, they swim semifinals or finals. And they have just a few hours to recover from the morning session. And the final result of the afternoon session is usually the result of a good or maybe bad recovery. Okay? So here is the example of the high-intensity interval training, but it's not that important for us. Here is hydrogen-rich water characteristics and the supplementation method. So here you can see the characteristics you can see in a yellow table. And for this research, we use these small packages of hydrogen-rich water or placebo. And these small packages consist 420 milliliters hydrogen-rich water or placebo. From the producer of these small packages, we were given like 2 expirations. One expiration was hydrogen-rich water, and the second one was placebo. And we didn't know which one is hydrogen-rich water and which one is placebo. So, 3 days before our experiment, participants were given 3 times this small package of either hydrogen-rich water or placebo. Then before, during, and after high-intensity interval training, they were given again 3 times 3 small packages. And before 400-meter performance, they were given 1 package of placebo or hydrogen-rich water. So, now my results. First of all, I would like to present this result, which is not significant, but I want to show you how demanding the high-intensity interval training was. So here you can see blood lactate concentration after high-intensity interval training. And now, results of 400 meters swimming, or Finn swimming. Here you can see that 10 participants improved their performance after using hydrogen-rich water. Two of the participants actually didn't benefit from hydrogen-rich water. So, Participants with hydrogen-rich water were able to swim faster. Concretely, they were 1 second, 0.34 seconds faster than the group with placebo. So now, maybe you are asking yourself, okay, so what is it, 1 second, 0.34? So I have prepared some results from the highest competitions, fin swimming and swimming competition. So let's look at it. So here you can see the results from the Olympic Games in Tokyo. It's 400-meter freestyle, and as you can see, the difference between the first swimmer and the sixth swimmer is 1.52. So these small results decide if you win or not the Olympic Games. Here, World Swimming Championships, and again, the difference between the first and fourth swimmer, 1.06 seconds, and the last one, this is the highest competition, the highest competition in fin swimming. It's called the World Games. It took place in Birmingham this year, and this is 400 meters men. And again, as you can see, the difference between the first and fifth is 1.44 seconds. So, to conclude it, based on presented results, we assume that hydrogen-rich water may improve continuous performance after high-intensity interval training. The improvement in performance may reflect better recovery after hydrogen-rich water consumption. So, thank you for your attention.
Coming up next, Cinquin. Heart transplantation innovative method mitigating oxidative stress by perioperative administration of molecular hydrogen.
In our experiments, we focused on translational research. We want to bring the results of on rats and on small animals into clinical practice. Therefore, we try to make experiments on bigger animals and get closer to preclinical experiments. Nowadays, heart transplantation has become a relatively safe and routine method of end-stage heart failure treatment. However, there are many factors that can significantly affect the success of transplantation. The main risk factor for adverse events that may happen peri- and post-operatively appear to be factors where the common denominator is oxidative stress. What are these factors? First of all, it is graft preservation. One back. Yeah, it is graft preservation, ischemia and reperfusion injury, effect of anesthesia, perioperative hyperoxia, and finally defibrillation. When talking about graft preservation, the quality of transplantation belongs or is on graft preservation. The gold standard for heart preservation is cardioplegia with cold storage and electromechanical quiescence. There are many strategies for scavenging reactive oxygen species. Seemed promising but failed in human clinical trials. Ischemia and reperfusion is always connected with altered cardiac ion homeostasis and structural remodeling associated with elevated reactive oxygen species, inflammation, endothelial dysfunction, and cardiomyocyte damage. Behind this is always uncoupling of oxidative phosphorylation and decrease of ATP. Another factor is effect of anesthesia. We used in our model isofluran and sevofluran, which is very safe anesthetic. It is considered very safe, but there are a lot of controversies about both of them. Especially in minor surgeries, it seems to be very safe. On the other hand, at major surgeries like orthopedics, increased DNA damage and decreased glutathione content was found. The next is perioperative hyperoxia. Next factor is perioperative hyperoxia, especially during anesthesia. High oxygen administration intraoperatively increased oxidative damage and inflammation. And finally, defibrillation. We know that weak defibrillation shocks do not cause any damage to the heart, but also do not defibrillate. Electric shocks, strong enough to defibrillate, immediately cause significant cellular destruction, and the ventricular myocardium abnormalities in calcium regulation, oxidative stress, and stimulation of pro-inflammatory and pro-fibrotic phenomena. Even it can reinduce ventricular arrhythmias. Effect of hydrogen. We know that hydrogen possesses antioxidant, anti-inflammatory, and anti-apoptotic properties and can exert variety of cytoprotective functions. That is why we used molecular hydrogen also in transplantation. So our hypothesis is that administration of hydrogen gas may mitigate the ischemia reperfusion injury and other sources of oxidative stress by selectively scavenging hydroxyl radicals, decreasing lipid peroxidation and inflammation, and increasing native antioxidant enzymes. To material and methods, I can say only that we used 3 groups. One group was simulated heart transplantation. I will explain it in a few minutes. What is it, simulated heart transplantation? Then transplantation with hydrogen added. Hydrogen air was added during anesthesia. And finally, a control group where markers were measured from blood samples taken before hydrogen administration. It means from normal peaks. Very shortly, peak was clamped. Actually, heart was not removed, but all vessels were clamped, and peak was connected to ECC. And after 3 hours of cardioplagia at low temperature, peak was again reperfused. Heart was reperfused, and after 1 hour of normal action, the samples were taken for different analyses. What is simulated heart transplantation? To simulate heart transplantation, the heart is completely isolated from the body, as I mentioned before, but it is not cut off and removed from the body. The heart remains in the chest, stored in the crushed eye saline solution at 4 centigrades, and after stopping with custodiol, with cardioplegic solution, cardiopulmonary bypass is connected. This is scheme how to, what vessels are clamped and how it is isolated, but it takes a longer time to explain. We don't have time for that. What are advantages of simulated heart transplantation? It is minimizing traumatization, eliminating antigenicity, and reducing sewing time during graft implantation. We took different samples. We took markers of inflammation and tissue damage, markers of oxidative stress damage, protein expression levels of total connexin 43, activity of matrix metalloproteinases. We did also histochemistry of sensitive enzymes and electron microscopy. Important is what was the concentration of hydrogen during whole experiment. The blue part means level of hydrogen in arterial blood during anesthesia. Red dots shows level of hydrogen during ECC, and yellow, it is after disconnecting extracorporeal circulation. And now I have a lot of different markers shown, so I will go very fast and I will show only, or we stop at only those which are most pronounced differences. So myoglobin didn't change too much, creatine kinase slightly increased. I have to say that green means control, normal peak. Red is after transplantation without hydrogen, and blue is with hydrogen. And levels are, as you can see, myoglobin didn't change too much, creatine kinase increased after transplantation, but and not significantly decreased after hydrogen added. Troponin, which is indicator of myocardial injury, again, it was nothing in normal. Of course, after manipulation with heart, it goes up. There is red column, and after hydrogen, it goes again down, but not significantly. Tissue damage markers, which are next. This is LDH in plasma. You can see very significant changes after transplantation, red column on left side, and significant decrease on the right side. Myeloperoxidase was not interesting because it didn't change too much. Now we can go to inflammatory markers. Yes. This is in left ventricle, both are in left ventricle, and we can see that nuclear factor kappa B is slightly increased after transplantation and decreased after adding hydrogen. So it is significantly changed. Also, tumor necrosis factor, the same, it is significantly decreased after hydrogen. Next is oxidative stress damage markers. Again, very significant changes we can find in malondialdehyde, and after significant decrease after hydrogen added. The same is with beta-hydroxydeoxyguanosine. Again, significant change after transplantation and decrease after hydrogen. Uric acid, the same. And antioxidant enzymes and antioxidative signaling activities, you can see in left ventricle, superoxidismutase significantly changed after transplantation and decreasing after hydrogen. Glutathione peroxidase the same, and the same way also SOD1. Catalase and catalase is significantly changed. Also, KEEP protein and nuclear factor kappa B are not significantly changed. Matrix metalloproteinases, you can see that only matrix metalloproteinases 9 reacts, and it is increased after transplantation, but it is decreased significantly after hydrogen. And finally, connexins. Connexins are increased, especially total connexins are increased, which means that this can explain decrease in fibrillation activity of the heart. And finally, a few pictures of histochemistry, where on the left side you can see normal heart, in middle it is sensitive enzymes for hypoxia, which you can see in middle, which are patchy reactions, and they disappear after hydrogen. And the same is shown on electron microscopy. Sorry, it doesn't move. What happened? Yeah. And electron microscopy. Upper picture shows normal heart. In middle, you can see a lot of changes after, especially hypoxic changes after transplantation, and when hydrogen was added, it disappears. Conclusion, I can go through because time is, we can go to conclusion. Addition of 4% hydrogen in the air inhaled during anesthesia and added to the extracorporeal circulation oxygenator significantly decreased oxidative stress markers and markers of ischemia, inflammation, and peroxidation of the whole body. That is important, that whole body, not only graft. This resulted in improvement in cardiac morphology, less severe ventricular fibrillation, and better resumption of heart pumping activity after 3 hours of cold ischemia in stored and implanted pig hearts. Results provide a rationale for designing clinical trials aimed at testing the efficacy of this therapy. And finally, I'd like to thank to my team of surgeons, anesthesiologists, and guy who was working with pump, and people who were doing all analysis. Thank you very much for your attention.
Thank you.
Coming up next. Song Go Wa. Hydrogen reduces neutrophil extracellular traps, nets, formation in atherosclerosis.
Hello everybody. First, I'd like to thank Professor Jin Slazak and Professor Jiankang Liu for their invitation. It is my pleasure to share with you the research results related to hydrogen medicine. The title of my presentation is Hydrogen Reduces Neutrophil Extracellular Traps Formation in Atherosclerosis. Neutrophil extracellular traps, abbreviated as NETs, were discovered as one of the defense mechanisms of neutrophils in response to various infections. Atherosclerosis is a multifactorial, multi-step disease that involves chronic inflammation at every stage, from initiation to progression and eventually plaque rupture. NETs are found in human and mouse plaques, and in mice, they are associated with increased atherosclerosis progression. We have previously found that hydrogen can inhibit the inflammatory response of atherosclerotic plaques and delay the occurrence and development of atherosclerosis. Here, we thought to explore the effects of hydrogen on NETs formation during atherosclerosis. 8-week-old male ApoE knockout mice fed a high-fat diet were treated with hydrogen-oxygen mixture, that is 67% of hydrogen and 33% of oxygen for 2 hours per day for 8 weeks. The HE staining and oil red O staining showed that plaque area was decreased by hydrogen treatment. Then, NETs formation was evaluated by immunofluorescence staining for myeloperoxidase and LY6G, two markers for NETs formation. We can see from the picture the expression of MPO and LY6G was decreased by hydrogen, suggesting that hydrogen attenuated NETs formation in atherosclerotic plaques. For in vitro experiment, neutrophils were isolated from healthy volunteers and were used to determine the effects of hydrogen on NETs formation. NETs were induced by PMA. And then, as shown in this figure, the expression of MPO and elastase in neutrophils were decreased by hydrogen. In addition to immunofluorescence, we also carried out Western blot to further verify the expression of MPO and elastase, and the results of Western blot were consistent with those of immunofluorescence. Further, it is known that ERK and P38-MAPK are important to direct neutrophils to NETosis. Thus, we decided to investigate the role of hydrogen on P38 and ERK phosphorylation elicited by PMA. The upregulated phosphorylation of P38 and ERK by PMA in cultured neutrophils were significantly decreased after hydrogen treatment. Our findings indicate that hydrogen can reduce the formation of NETs in atherosclerosis via downregulating the expressions of elastase and MPO, which might provide a novel scientific basis for the understanding of the effects of hydrogen on atherosclerosis progression. Finally, I would like to point out that our group just published a population study on hydrogen relieving a hangover in American Journal of Clinical Nutrition last month. We performed a pilot, randomized, double-blinded, placebo-controlled, matched, crossover interventional trial and found that consumption of hydrogen decreases breath alcohol concentrations and relieves the symptoms of hangovers. I hope to have the opportunity to share this population study with you in the future. Hello everybody. In the last video, I mentioned our new published paper, hydrogen intake relieves alcohol consumption and hangover symptoms in healthy individuals, a randomized and placebo-controlled crossover study. We published this paper in the American Journal of Clinical Nutrition last month. Because time permits, I will share the data here. Alcohol-induced hangover represents a significant yet understudied global hazard and a large social economic burden. The aim of this study was to investigate the effects of hydrogen on relieving drinking and hangover symptoms in 20 healthy volunteers. In this pilot, randomized, double-blinded, placebo-controlled, matched crossover interventional trial, participants were matched into pairs and randomly assigned. Studied Group 1 inhaled placebo air for 1 hour, followed by drinking 100 ml of liquor within 10 minutes, and then pure water. Study Group 2 inhaled a mixture of hydrogen and oxygen gas for 1 hour, followed by drinking 100 ml of liquor within 10 minutes, and then hydrogen dissolved in water. On a second intervention day, crossover, 1 week later, study group subjects were switched into the opposite order. Breath alcohol concentration, hangover severity, and cognitive scores were measured. Out of the 25 volunteers, 20 completed the trial and underwent the per-protocol analysis. First, we measured the breath alcohol concentrations. As shown in Figure A, the breath alcohol concentrations were significantly lower within the hydrogen group than within the placebo group at 30, 60, and 90 minutes after alcohol consumption, both on study day 1 and study day 2. In Figure B, the differences between the two stages, study day 1 and study day 2, were also compared, which further confirmed the alcohol-lowering effect of hydrogen compared with placebo group. Figure C the comparison of intra-individual BRAC difference in study group 1 and difference in study group 2 was not significantly different, suggesting the use of hydrogen first or later, that is, the order of treatment, has no effect on the result. Although alcohol-lowering effects of hydrogen was obvious, female participants showed an increased BRAC compared with males. To confirm whether hydrogen treatment has different effects on males and females, we performed a further cluster analysis. As shown in this Figure A, BRAC were significantly lower in the hydrogen group compared with the placebo group in male participants, both on intervention days of all participants. However, there were no differences between the groups in female individuals, although BRAC has a trend to be decreased in hydrogen group. This data suggested the alcohol-lowering effect of hydrogen was obvious in males, but not in females. Besides the BRAC, we also measured hangover symptoms. The severity of hangover symptoms within the placebo and hydrogen group during study is summarized in this table. Regarding the 15 hangover symptoms, the hydrogen group reported having fewer headaches and less sweating than usual compared with the placebo group. Hydrogen did not significantly improve the other 16 symptoms. Overall, the sum of hangover symptoms for the hydrogen group was significantly lower than that for the placebo group. We further analyzed the effect of hydrogen on the hangover symptoms in males and females respectively. As shown in this figure, hydrogen treatment improved the symptoms of headaches and excessive sweating in males. Further, in females, hydrogen also showed to improve headaches and excessive sweating. Besides the above self-described symptoms, we also performed computerized psychological assessments 3 hours after alcohol consumption by using the VTA, as shown in this figure. The relative scores of divided attention, response inhibition, processing speed, and cognitive flexibility were significantly decreased by hydrogen treatment after consumption of alcohol, indicating that hydrogen could improve the attention and executive functions after drinking alcohol. One of the secondary study endpoints was the evaluation of factors associated with BRAC and hangover symptoms. We performed multivariate linear regression analysis and ordinal logistic regression analysis for 2 target variables, BRAC and hangover symptoms, including all participants for study day 1 and day 2. As shown in this figure, the consumption of hydrogen was negatively and female sex was positively correlated with increased BRAC. Likewise, consumption of hydrogen was negatively and the female sex was positively correlated with increased risk of hangovers. In conclusion, we confirmed that treatment with hydrogen significantly reduced breath alcohol levels and improved attention and executive functions after alcohol consumption in the short term, and it relieved a variety of hangover symptoms in the long term. Our results suggest that hydrogen might offer a bit of relief for individuals who are suffering from the effects of alcohol consumption. That's all. Thanks for listening.
Coming up next. Sambolova Zuzana. Effects of molecular hydrogen on antioxidant content and mitochondria function in patients with non-alcoholic fatty liver disease.
Thank you very much for the introduction and for the opportunity to be here in this very nice event. So, non-alcoholic fatty liver disease is a metabolic dysfunction of the liver characterized by excessive fat accumulation in the liver caused by other factors than ethanol. This disease affects about 25% of population worldwide. And if untreated, this disease can lead to non-alcoholic steatohepatitis, an inflammatory condition associated with liver fibrosis. Mitochondrial dysfunction and excessive ROS production play a significant role in the development of and progression on non-alcoholic fatty liver disease. The exact mechanisms are not fully understood, but there is decreased fatty acid oxidation, decreased electron transfer chain function, increased ROS production, decreased mitochondrial biogenesis, and mitophagy. Molecular hydrogen is recognized as a novel gas with antioxidant, anti-inflammatory, and apoptotic effects. Its beneficial effect was documented in various diseases. The small hydrogen molecule can easily penetrate to all organs and cell structures and can reach subcellular compartments such as mitochondria, endoplasmic reticulum, nuclei, which are the primary sites of ROS generation and DNA damage. The aim of our study was to analyze the effect of 60-day administration of hydrogen, molecular hydrogen to patients with non-alcoholic fatty liver disease on platelet mitochondrial respiration and ATP production, on antioxidants coenzyme Q, alpha-tocopherol, beta-carotene, on parameter of oxidative stress, thiobarbituric reactive species. And we have patients, 30 patients with non-alcoholic fatty liver disease, which were randomly divided into 2 groups. A hydrogen group consisting of 17 patients drank 3 times a day 300 milliliters of water with tablets producing high hydrogen-rich water. And placebo group drank water with placebo tablets producing CO2. Control group consisted of 15 healthy volunteers. Biometric and biochemical parameters demonstrate that our patients were obese with body mass index above 33, and they had hyperglycemia and high activity of liver enzymes and low LDL cholesterol, HDL cholesterol. So after hydrogen therapy, in this group, the waist circumference decreased after the 60 days of therapy, and HDL cholesterol increased. Platelets are accessible source of mitochondria, and mitochondrial function of platelet is considered to be a marker of mitochondrial health. We isolated platelets from whole blood and counted on hematology analyzer and used for evaluation of mitochondrial function by high-resolution respirometry. So 250 million of cells were introduced into the chamber of O2K respirometer with respiration medium, and protocol with sequential titration of substrates, unclapper and inhibitor was applied to assess complex 1 link and complex 2 linked pathway in one measurement. On this trace is hydrogen, oxygen concentration and oxygen consumption after the titration steps. So there was no significant difference in absolute values of mitochondrial respiration between control group and patients, but after normalization for the maximal flux, there was a relative increase in complex 1 linked respiration, complex 1 linked oxphos capacity, and complex 2 linked electron transfer capacity were decreased in the whole group of 30 patients at the beginning of the study, and the study group did not differ. After 60 days of treatment with hydrogen water, there was a decrease in complex 1 linked leak respiration and increase in complex 2 linked ET capacity. And coupling control efficiency, which was depressed, initially improved after the hydrogen therapy. In placebo group, there was no significant difference in any parameter. And we evaluated concentration of coenzyme Q, which is a powerful antioxidant and component of mitochondrial electron transfer chain necessary for ATP production. It was reduced in platelets, blood, and plasma in both groups of patients, and after hydrogen therapy, increased in platelets significantly. So there was correlation between complex 2 linked electron transfer capacity and concentration of coenzyme Q10 in platelets. We also evaluated alpha tocopherol and beta carotene in platelets plasma. Both alpha tocopherol and beta carotene were depressed in patient group, but after therapy, 60-day therapy increased in both groups. Alpha tocopherol and beta carotene decreased in both groups. And the lipid peroxidation parameter was initially higher in the hydrogen group and decreased significantly after the therapy. So these results correspond with our previous study where we found increased coenzyme Q9 in hard mitochondria of rats after applying of hydrogen-rich water, increased T3 respiration and ATP production, and decreased MDA in plasma. So hydrogen affected coenzyme Q concentration and mitochondrial function. So ubiquinone is the most important electron and proton carrier. It can be in oxidized, reduced, and radical forms. And the quinone intermediates are very important, plays a significant role in the process of proton motif force formation. And it is proposed that molecular hydrogen may function as both electron and proton donor in Q cycle and convert quinone intermediates to fully reduced ubiquinol, thereby increasing antioxidant capacity of the quinone pool and preventing reactive oxygen species production. So the two proposed mechanisms, one is that molecular hydrogen directly neutralizes the ROS produced in mitochondria, and the other is that rectifies electron flow in the ubiquinol pool in the disordered or pathological state. So conclusion, 60-day therapy with hydrogen-rich water in patients with non-alcoholic fatty liver disease, improved platelet mitochondrial function, increased coenzyme Q10 concentration in platelets, reduced oxidative stress. We suppose that molecular hydrogen may have decreased degradation or stimulated endogenous synthesis of coenzyme Q10 in patients, and higher content of CoQ10 improved mitochondrial electron transfer in platelets. Long-term supplementation with hydrogen-rich water could be a promising strategy for acceleration of mitochondrial health and health recovery in patients with non-alcoholic fatty liver disease. Thank you very much for your attention.
We thank you for your nice presentation.
Coming up next, Sun Zujun. Hydrogen medicine, research advance, controversy and challenges.
Thank you for your attention, giving me a chance to give a talk in this conference. The topic my topic is the first advantage is safety in diving in hydrogen medicine. The first is a brief of hydrogen medicine. As we know, in 2007, a paper published in Nature Medicine is the foundation of this field. The group comes from Japanese and found the hydrogen act as a therapeutic antioxidant by selective reducing cytotoxic oxygen radicals. As we know, 30 years ago, in Science, published come from America, found the hyperbaric hydrogen therapy is a possible treatment in cancer. But why this paper not pay attention to other science, or why the Japanese group finding was more important in this field? The answer is not because of the effect of hydrogen. The answer is the safety of low concentration hydrogen inhalation. In 2007, they only used the very low concentration from 1 to 4%. but in 1975 they use 8-atom hydrogen. It is very dangerous. So the key finding of 2007 is trace amount hydrogen can kill disease. In this paper, the author states 35 minutes of inhalation of 1 to 4% hydrogen. If it is used in human being, 2% hydrogen 30 minutes, only 1 milligram can be absorbed, or 9 milliliters of hydrogen can be absorbed. So it is very, very little amount of hydrogen. It provides a theoretical basis for the safe use of this flammable gas in human body. It is also the reason for us to have interest to do the research work in 2007. We published in our paper in 2008 in Neuroscience Letters. And from then on, more and more publications of hydrogen biology effects were published. In Google Scholar, the 2007 paper was citing more than 2,000. In China, many top researchers have participated in hydrogen medicine research. The hundreds of PhD students graduate INTRAOSSEOUS is a hydrogen field. Thousands of research engaged in hydrogen medicine research, and more than 100 national Nature Science Foundation projects were granted. In 2013, we established Chinese National Academic Organization, which hosts conferences several times each year. At present, there are hundreds of hydrogen medicine products companies in China with various types of hydrogen medical products, and hydrogen agriculture has also made certain achievements. In 2020, a medical device of hydrogen oxygen mixture was approved by the Chinese FDA. So the second is the evidence of hydrogen safety. The main evidence for the human safety of hydrogen comes from diving medicine. When we dive, divers need to overcome two problems with breathing. One is the toxic of oxygen and nitrogen, and the other is increased resistance of high-density gases. To solve these two problems, it is necessary to use alternative gases with less toxicity and less respiratory resistance. Helium is the most ideal diving breath gas, not only without the toxicity of nitrogen, but also because of its low density and low respiratory resistance. Unfortunately, 100 years ago, we have no technique to get more helium, so diving scientists look for other gases. At last, the hydrogen is a good choice for instead of helium, and we also obtained a serious research result which were applied in ocean diving experiments. In the use of hydrogen for diving medical applications, the safety of hydrogen is the first issue to be addressed, because divers need to live in high-pressure environment for a long time during large depth dive. Studies have shown that humans can safely survive for several weeks in high partial pressure hydrogen without any adverse effects, let alone any toxic reaction. These studies on the safety of oxygen in diving medicine have laid absolutely solid foundation for us to use hydrogen in medicine. However, there are misunderstandings in Darwin medicine. Many scientists who study hydrogen medicine believe that hydrogen can overcome decompression sickness in Darwin, which is completely a misunderstanding. The effective way to prevent decompression sickness in Darwin medicine is through slow decompression, not through any gases such as hydrogen or helium. The real role of hydrogen in Darwin medicine is to overcome the toxic and resistance of air or nitrogen. In summary, in 1975, American scientists found the high-pressure hydrogen can treat cancer, but it is high pressure is very dangerous, so it is not used in clinic. In 2007, in Nature Medicine come from Japanese group. They found the trace hydrogen is effective in treating disease. It is very important finding. The third, hydrogen is safe for people or for diving. There are sufficient evidence come from Darwin medicine research. So the safety is the first in hydrogen medicine. High safety is foundation of hydrogen medicine. Any behavior that ignores the safe use of hydrogen is very dangerous, and we should always pay attention to it. We must also remember that hydrogen is a very dangerous gas that can burn. Even in academic research, the safety of hydrogen should be carefully considered. At last, the safety in Darwin medicine is different from hydrogen medicine. The safety in different diseases needs to be evaluated. So some research give us guidance for selection of hydrogen gas inhaler based on hydrogen explosive accident. Some research come from Japanese give us guidelines to hydrogen inhalation. At last, thank you much for your pay attention. As we have hydrogen, I'm very happy. Thank you very much.
Coming up next, Tarnava Alex. Solving the discrepancy between translational and clinical research dosages with high concentration hydrogen tablets.
Hello. So, first, a little bit of a background on our company and how we work with researchers. So, we have a active product, obviously, and we have a well-designed placebo that behaves and looks just like the active product. We've color matched it to the elemental magnesium using activated charcoal, and it gives the same amount of magnesium and it releases CO2 likewise in small nanobubbles. So it's a very effective placebo that we provide, and we work with teams on giving advice on dose and administration and compliance with patients, which is obviously very important. We also tend to donate extra funds to increase testing, controls, statistical power, to enroll more people when it's important. Things that we don't do is we do not control the final trial design, and we do not demand decision on whether to publish the outcomes. We firmly believe in open science, so negative results should always be published, right? It should be used as a learning lesson, not to be hidden. Hydrogen, like anything else, is not a panacea. It will not work for everything, and we shouldn't pretend that it will. So as a company, we firmly believe in open science. Also, we work hard to connect various research teams together. There's been an absence of very important conferences like this over the last few years. So hopefully we're not needed as much in the future because everyone's getting more acquainted and meeting each other and talking about their research, which is absolutely fantastic. So a bit about what we've obtained with our technology. Now, our patents are related so far to the creation of quasi-dissolved nanobubbles that far exceed the typical saturation of hydrogen in water. We can exceed this in 500 milliliters by 7-8 times. I'll explain a bit more why. So we have 2 patents granted in the USA. Then we have allowance on patents in many other jurisdictions, such as Russia, South Korea, and Japan. Here in the EU, verbally the examiner has removed all objections, so we're just waiting for that final allowance letter. So moving to grant basically everywhere it's been reviewed so far. And we have several other patent applications pending for various applications using our tablets or other technologies to make molecular hydrogen. So for certifications to use, in the United States, we have new dietary ingredient status and GRAS status, generally regarded as safe. This is very important to do. Basically, how the bureaucracy works is if something is a legal supplement first, it could then be pursued as a drug. However, if it's an investigational drug first, it can never be sold as a supplement. And obviously, there is a lot of applications for hydrogen as a supplement, such as in sports, such as in pre-disease states, diabetic states. So we don't want to limit hydrogen to only disease functions. We want to make sure that it can be accessible by the population. We also have approval in Russia from an ethics committee to use a tablet in our technology, and we are about to file novel food in the EU. I do have one of my customers that in France has legally registered it as a beverage mix, but we are going to be moving for novel food in the EU. The EU just had very, very specific requirements on exactly what they needed to cross T's and dot I's that were substantially different from the United States and Russia. So we also, for researchers in sports, we are at an Informed Sport and NSF Sport facility and test our technology to be informed sport. So this is approved for all WADA guidelines. So amateur and professional athletes do not have to worry about any cross-contamination in that regard. And our technology is certified to IHSA standards through H2 Analytics, which is a lab in the United States that conducts the gas chromatography through the methods that were developed by various IHSA board members. So our NDI actually was quite a large portfolio. A lot of people think supplements aren't very well regulated. They don't take a lot of work, but our NDI that we filed to the US FDA was over 300 pages, assessing safety, efficacy, our manufacturing, consistency, everything like that. Similar filing into places like the EU for this. And in the United States, for instance, it's not enforced properly, but when you do submit, it is quite rigorous. It's estimated only about 4% of products on the market have obtained NDI status in the United States. So also we have a lot of manufacturing certifications for various countries that might be important to enrollment. And getting into basically how is what we're doing possible? How are we quasi-dissolving large amounts of gas well beyond the saturation point? I first want to say that this discovery, to kind of, as a Artamonov, it was not met with eureka, but that's funny. I was trying to solve something completely different, and I noticed this effect that was going on. And to get where it is today, nothing was particularly clever. It was banging head on the desk. We're at about 7,000 iterative adjustments in formulation to be maximizing this effect. But we're making very small nanobubbles in a first burst of hydrogen gas. So the first burst of nanobubbles are when we remove basically noise, background noise with laser backscattering. They're between about 10 to 30 nanometers in size. So this is far smaller than any nanometer they're able to get. Now, what happens very small in bubble diameter is the bubbles resist both coalescence and dissipation. So both for bubbles or particles, whether it's in the air or in an aqueous solution, when you go below 5 microns, they neither rise They neither float or sink. They just maintain in suspension. This is the same as aerosols, like during the COVID pandemic, that just stay in the air for hours or indefinitely. So when you go very small bubbles like this, they stay in the water. They do not need to saturate. They stay in a quasi-dissolved cloud. Now, the smaller you go, the more they are. It alters the potential, and they repel, and they resist coalescence. So it gives a much longer time to drink and get a very, very high dose and concentration of hydrogen water. So to get the dosage that we're giving, would typically need, if we were saturating the water, about 120 psi in at least 8 hours to reach an equilibrium. So this is done in about in an open container of water. I don't know if we can click this video so we can see the effect, but I've been talking a bit about this. Another effect that's going on in the tablets that gives us a bit of a reserve tank is as the magnesium is reacting, it gets smaller and smaller as well. And after the first burst, the remaining magnesium tends to also be in the high nano range, so it also stays in suspension in the water, giving a reserve tank. It's okay if you guys can't get the video to play, but as you can see, the end result is milky white water, and that is the dense cloud of gas. So, oh, clicker's not working. No, not moving. Okay, so testing the tablets, it's very important to use gas chromatography. As another presentation by Dr. LeBaron earlier showed, pH is critically important to the ORP derived meters that measure this. The tablets are initially acidic in nature, so they will end up being very, very low on these meters. Titration does work fairly well, in measuring the hydrogen tablets, and the Unisense meters are able to detect some of the nanobubbles, but not all of them, so they are more accurate. But gas chromatography is the premier method that is able to specifically test for these tablets, but for all forms of hydrogen water. So we used H2 Analytics, and actually they worked with the IHSA and developed a specific method for detecting the quasi-dissolved nanobubbles in the tablets. So I greatly thank them for that. Now, we're reaching a peak of dissolved and quasi-dissolved gas of about 7.3 milligrams a liter, or ppm. However, when accounting for the nanoparticles of magnesium in solution, in 500 milliliters of water, we're reaching 12.4 milligrams a liter equivalent, which of course is about 7.5 times the saturation point of hydrogen in water. And we determine that by taking the water and then equilibrating it in a stomach acid simulation. So those nanoparticles of magnesium instantly reacted, producing more hydrogen gas. So that is what the consumer or the patient would be receiving. So for context, about 86% of the total theoretical maximum of the hydrogen gas produced by the tablet is maintaining in solution when it's drunk quite quickly. So how this can solve and assist with research is we still have a lot of questions and discrepancies between the rodent research and the human clinical research. Now, there is a lot of things we don't know here. For instance, typically in translating rodent research or animal research to human research, there are formulations, as I'm sure you all know, for different metabolic rates. Now, with hydrogen, we don't know how much is really metabolized. We don't know if it's metabolized in the same way. We don't know if there's, say, a hormetic effect in entering our cells. So some of these formulations, like I believe in mice to humans, it's roughly 12 times. These might not be applicable. We don't know. That's the point. But often mice are receiving between 12.8 to 25.6 times higher relative dose based on how much water and hydrogen they are consuming than humans. This could be critically important when we can look at some of the stronger results that are seen in rodents as compared to humans. So in some of these, now there was one good study by Jackson et al. I know Dr. LeBaron was one of the researchers on that study. They found that 0.3 ppm was not effective at all, but 0.8 ppm was effective. Now, if we do a straight conversion, that's 3.8 milligrams or 10 milligrams when extrapolated to the average human size. Now, Korovlev et al. Found in AFL-V modest to strong results of about 6 milligrams per day of hydrogen, which is right between those two doses. Now, there was another fantastic study that was done out of Japan. Nishimaki et al., I believe Professor Ota was involved in this study. Now, in humans with mild cognitive impairment, there were modest results in only people with the ApoE4 allele. However, in the mice, and actually I really liked this study because they gave hydrogen at different points in the mice's life and found that even giving it to them later in life had the same effect as early on. But the results were truly spectacular in the mice. They basically resisted neurodegeneration and it improved their health span. So the results were very strong. Now, is a higher concentration safe? Now, we know it's safe. Hydrogen has shown little to no adverse events. We're using it at 1,000 times higher dosage in deep sea diving. We're naturally producing anywhere from 300 milliliters up to 12 liters a day of hydrogen gas through fermentation of carbohydrates. So in about 140 plus trials in humans, there are no significant adverse events that are directly linked to the hydrogen. There's a handful of potential adverse events, mostly things like diarrhea and headache. Those were found in just 3 studies with 63 participants, a few adverse events. Now, is this necessary? And we don't quite know yet. I mean, some other researchers have also found dose-dependent response. I know members from the Botek group reported this in sports as well. I believe it was Jakub's presentation. We are seeing possibly some dose-dependent responses in humans in metabolic issues. Actually, it seems possibly in metabolic issues a higher dose is needed because lower doses seem to be more effective in sports. But it also could be duration, right, if you look here. So basically, the study with both the longest duration and the highest dose was by far the most effective. So it's yet to be answered if that was a duration issue or a dose issue, right? But precautionary, it's probably best to do both longer and higher dose. There are other potential ways we've seen dose-dependent responses. I know Professor Cinquin's presentation on COVID-19, we saw results in a higher dose, looking at some biomarkers and some things out of a study in Serbia, but in the study out of France with a lower dose, there was no significance. So, in conclusion, we need to be using the right ways to measure hydrogen gas to know what participants are getting, to avoid some of these devices that don't properly measure it. Higher doses of hydrogen are safe and potentially more likely to produce positive results. Again, we still have a lot of questions to answer here if that's true, and it might not be true in all cases. A lower dose might be as effective as a high dose in certain indications, but we might need a higher dose in other indications. We don't yet know the exact mechanisms hydrogen's working, if it's working in multiple mechanisms. So we can't yet do accurate dose conversion from animals to humans and for different indications and different levels of stress. But what we do know is animal studies have historically administered relatively much larger concentrations of hydrogen than we've been able to get in humans. And a lot of this is issues with both technology and compliance, because it's much harder to get humans to consume large water as putting it in the animal's tank. And lastly, so my company is legally registered in multiple jurisdictions, patented, and to date we have 11 published clinical trials that have been using our tablets, plus 4 case studies, multiple preclinical trials, working with, I believe, 12 or 13 universities all around the world right now. So, thank you.
Okay. Thank you very much.
Coming up next, Valikova Katerina. Molecular hydrogen, the beneficial effects in scavenging hydroxyl, alkyloxy and alkylperoxy radicals.
Thank you for introducing. I will present the results of the beneficial effects of scavenging hydroxyl, alkyloxy and alkylperoxy radicals of molecular hydrogen. Molecular hydrogen can occur safely in the air when its concentration is below 0.7%. Hydrogen applied into the body has antioxidant, anti-apoptotic, anti-inflammatory and anti-allergy effects. It can modulate signal transduction, protein phosphorylation cascades and gene expression. Molecular hydrogen is when applied to the body in therapeutics through various delivery routes, such as through inhalation, oral administration of hydrogen-rich water, as hydrogen tablets, and as hydrogen-saturated saline injections. Inhalation of hydrogen gas or ingestion of hydrogen-rich water is beneficial in individuals suffering from, for example, cerebral infarction, post-caudal arrest syndrome, rheumatoid arthritis, mild cognitive impairments, Parkinson's diseases, metabolic syndrome, mitochondrial myopathies, has a therapeutic and protective function in chemotherapy and radiotherapy. In our laboratory, we are studying for many years with hyaluronic acid. It is a linear natural polysaccharide occurred especially in skin, joints, and vitreous body. Its molar mass in the articular joint is up to 7 megadaltons. It forms vitreous solutions, and it has viscoelastic properties. It serves as a joint lubricant. However, viscosity of hyaluronan solution decreases when exposed to reactive oxygen and nitrogen species. I forgot to mention that hyaluronan is composed of N-acetylglucosamine and glucuronic acid. We work with hyaluronan with its molar mass 1.7 megadaltons. We work with its physiological concentration 2 milligrams per milliliter. We used ascorbic acid in its physiological concentration 100 micromoles per liter, and we work with pathophysiological concentration of cupric ions 1 millimole per liter, and also we use molecular hydrogen water. We used an original method, rotational viscometry, where here is the machine, and we worked with temperature, with conditions such as temperature 25 degrees of Celsius, 180 rotations per minute, and data were recorded in 3-minute intervals during 5 hours. Here is the scheme how we produce hydroxyl radicals in our system. We have, here is ascorbate, which interacts with cupric ions under aerobic conditions where cuprous ion complex is formed, and this system produces hydrogen peroxide. Ascorbate is oxidized to dihydroascorbate, and hydrogen peroxide, when interacts with cuprous ion complex, produces hydroxyl radicals, which is the most reactive oxygen species, damaging all molecules, including hyaluronan. Here is a figure which explains how we add antioxidants or drugs to the oxidative system. We added tested substances at the beginning, where before hyaluronan degradation starts, in this system hydroxyl radicals are produced, and this is called the initiation phase. In a second experimental setting, we add substances 1 hour later during hyaluronan degradation. And in this experimental setting, alkyl oxy and alkyl peroxy type radicals are formed, and this is propagation phase. Hydroxyl radicals are formed according to the previous scheme. However, alkyl oxy and peroxy type radicals are formed from hyaluronan. I don't have many results, only 4 figures. So by rotational viscometry, we monitor time-dependent changes in dynamic viscosity of hyaluronan solutions exposed to cupric ions and ascorbate, which is our reference system, that black curve. And when we add molecular hydrogen at a concentration 55 micromoles per liter, which was dissolved in drinkable water, we showed some protective effect of hydrogen. So it means that it was effective in part in scavenging hydroxyl radicals. In a second experimental setting, hydrogen was also partially effective in scavenging alkyl oxy and alkyl peroxy type radicals. And the last experiment, when we dissolved the molecular hydrogen in distilled water, hydrogen was also effective in scavenging hydroxyl radicals. However, in a second experimental setting, hydrogen was only slightly effective in alkyl oxy and alkyl peroxy type radicals. We plan to prove the protective effects of hydrogen and the production of hydrogen radical by electron paramagnetic resonance. I believe that I could present the results here, but it has not been possible so far. Maybe next time. We can conclude that the addition of molecular hydrogen decreased the rate of Halloran degradation. It means that the scavenged hydroxyl, alkyl oxy, and alkyl peroxy radicals. And here we can present the mechanism of reaction of hydrogen with reactive oxygen species. So when a hydrogen must react with two molecules of hydroxyl radicals, which leads to production of two molecules of water. When hydrogen reacts with two molecules of alkyl oxy radicals, two molecules of alcohol are produced, and when hydrogen reacts with two molecules of alkyl peroxy type radicals, two molecules of hydroperoxides are produced. Thank you for your attention.